Hello, everyone. Good afternoon, and welcome to today's second day of National Ayurveda Cardiology Symposium. We have with us a very amazing speakers today, and we have with us a fantastic panelists. And to start the session, I invite the key person for today's and of course all the 4 day session, the host, Dr. Omkar Chaudhary. Dr. Omkar, we are live on the screen. Over to you, sir.
Thanks a lot, sir. Welcome. Good afternoon to all, and welcome for this second day of first National Ayurveda Cardiology Symposium. Yesterday was a fantastic day wherein around 21 doctors of Madhavbaug presented their super presentations on various lifestyle disorders like chronic heart failure, ischemic heart disease, diabetes, hypertension. And today too, we have around 21 to 22 doctors of Madhavbaug of Western Mumbai and Pune regions, wherein they are going to present some fantastic, mind-blowing presentations about their scientific approach towards these lifestyle disorders. Madhavbaug, as all of you know, is an organization since 2006, wherein 99% doctors are Ayurveda graduates. One person who is the lead role of Madhavbaug, Dr. Rohit Sane sir, Sir is an MBBS graduate and he is helping all the BMS doctors to get empowered to treat these lifestyle disorders. With view of being the first line of treatment in India, Ayurveda has to be taken up to that level that MBBS doctors too, or the allopathy fraternity too, knows about the scientific evidences which we can get through our Ayurveda treatments. To establish this, we have taken this challenge of these 4 days of presentations, wherein today 21 doctors will be sharing their scientific evidences results in front of all the doctors. I'm very glad to know that majority of the doctors yesterday who asked questions in the chat box were not of Madhavbaug. They were from all different states of India, and today too we are expecting n number of questions from all the doctors who are outside Madhavbaug as well as from Madhavbaug, because the cases which are going to be presented today by all the doctors are going to bring about n number of questions in each person's mind. So I will request everyone to ask questions in the chat box instead of raising their hands, because when you ask a question, maybe that question can be the same question the other doctor is also willing to ask. So requesting all to please ask questions in the chat box. Today, all of us know that around 21 doctors are going to present, but before that presentation, we have our respected CMO sir, Dr. Gurudatta Amin sir, who will be enlightening all of us to know what exactly the concept of Madhavbaug is from 2006 till now, near about 16, 17 years. Sir is associated with Madhavbaug. Yesterday, all of you know, we had 3 chief guests, Dr. Madhuri Kanitkar madam, Dr. Jagdish Hiremat sir, and Dr. Rohit Sane sir, who had enlightened all of us regarding the concept, the main morale behind this 4 days cardiology symposium. Today, Dr. Gurudatta Amin sir, CMO of Madhavbaug, is going to help us understand what is the basic research portfolio of Madhavbaug. Madhavbaug as an organization is completely based on the research which we are doing in Madhavbaug, and that too with scientific evidences, using the help, taking the help of all modern diagnostic investigations. We are educating the people in the same language like the allopathy doctors. So it is a great privilege to all the BMS doctors and Ayurveda fraternity to understand if we can treat diseases like chronic heart failure, valvular heart disease, it may be congenital heart disease, it may be ischemic heart disease, diabetes, hypertension, and n number of lifestyle disorders through basic treatments of Ayurveda. Without wasting much time, I will like to spotlight our respected CMO sir, Dr. Gurudatta Amin sir, who is the man behind all the empowered BMS doctors of Madhavbaug. Can we have a round of applause in the chat box virtually?
Thank you.
Yes, sir. Over to you, sir.
Thank you, Omkar sir. First of all, let me congratulate Dr. Rahul Mandole, who has arranged this symposium, and since last I guess it is of second day, and yesterday was the fantastic day over there. Near about 300 doctors were there, and all of them were enjoying the sessions and the case presentations. So when I was at Madhavbaug Khopoli, I guess 10-15 years back, at that time we were not having any sort of a research book in our hand. So there were no any evidence in our hands to say that yes, the Ayurveda can work. And in that phase, uh, while treating the cardiac patients with the Ayurvedic concepts and whatever knowledge we had at that time, अगर कुछ ऐसा हुआ कि किसी पेशेंट में कुछ इमरजेंसी हुई और उस पेशेंट को एलोपैथी हॉस्पिटल में शिफ्ट करना पड़ा, तो वहां पे जाने के बाद बहुत ही बुरी तरह से एक मैं कहूंगा बेइज्जती होती थी। क्यों? क्योंकि वो पूछते थे कि इफ यू डोंट नो हाउ टू ट्रीट अ हार्ट डिसीज, देन व्हाई यू आर ट्रीटिंग अ हार्ट डिसीज। और वहां पे बहुत दिल को वो लगता था। सिंस देन रिसर्च वर्क बहुत एग्रेसिवली चालू हुआ और बहुत सारे रिसर्च पेपर्स पब्लिश किए। हार्ट डिसीज रिवर्सल हो, ब्लॉकेजेस रिवर्सल हो, डायबिटीज रिवर्सल हो, हाइपरटेंशन रिवर्सल हो, ये जो लाइफस्टाइल डिसीजेस है, हाउ टू रिवर्स ऑल दिस डिसीजेस विद द हेल्प ऑफ आयुर्वेदिक फिलोसॉफी। एक बेसिक आयुर्वेदिक फिलोसॉफी के बहुत मूलभूत सिद्धांत है जिसके आधार पर आज सारे पेपर्स पब्लिश किए जा रहे हैं। शमन या शोधन, शमन करना है तो उसमें दीपन, पाचन, क्षुत्रुट निग्रह, आतप सेवन, मारुत सेवन और व्यायाम, इसमें से हर एक प्रकार में अपने आप में एक रिसर्च की ताकत है। सिंपल से व्यायाम में, सिंपल से आतप सेवन में, सिंपल से लंघन में हार्ट डिसीज को रिवर्स करने की, सीआरएफ को रिवर्स करने की क्षमता है। आज जो डॉक्टर्स प्रेजेंट करने वाले हैं, कल जिन्होंने किया है, या जो कुछ इस सारे सिंपोजियम में केसेस प्रेजेंट करने वाले हैं, उनके मूल सिद्धांत आयुर्वेद के इन्हीं बेसिक प्रिंसिपल्स पर आधारित है, जो शमन और शोधन चिकित्सा के मूलभूत सिद्धांत है। मुझे लगता है इसी तरह से हम सब लोग आयुर्वेद पर विश्वास रखते हुए, पंचमहाभूतिक सिद्धांतों पर विश्वास रखते हुए अगर हमारी चिकित्साएं करते रहे और उन चिकित्साओं के रिजल्ट्स एलोपैथी के मापदंडों पर अगर हम उसे एनालाइज करते रहे, तो निश्चित रूप से हम यशस्वी होने वाले हैं। क्योंकि ये एक टाइम टेस्टेड, समय ने इसे जांचा है, परखा है और उसके बाद यह आयुर्वेद सिद्ध हो चुका है कि यस, इट इज गोइंग टू वर्क। और मुझे यही महसूस हुआ कल के दिन में जो सेशन चालू थे, उस समय हिरेमठ सर का जो एक कमेंट था कि इस तरह से जो कुछ केसेस प्रेजेंट हो रहे हैं वो यूनिक केसेस है, इसमें आउटस्टैंडिंग रिजल्ट्स मिल रहे हैं। इजेक्शन फ्रैक्शन बढ़ना कोई बड़ी बात, छोटी बात नहीं है, बहुत बड़ी बात होती है। क्रिएटिनिन कम हो जाना, ये कोई हल्की सी बात नहीं है। 8-10 महीनों से अनहील्ड वुंड हील हो जाना, एम्पुटेशन से पेशेंट को बचाना, ये कोई छोटी बात नहीं है। हर एक जो कुछ केस है वो यूनिक है, और इसी सारे यूनिक प्रेजेंटेशंस के लिए मैं आप सारे डॉक्टरों का अभिनंदन करता हूं। कल जिन्होंने भी प्रेजेंटेशन किया था, बहुत ही काबिले तारीफ था। उसमें से कुछ सिलेक्टेड प्रेजेंटेशंस थे जो बहुत मन को भाए थे। कुछ लोगों ने जस्ट डिजिटल एंगेजमेंट पे बात की थी। सी टू इट कि आयुर्वेद किस तरीके से हम एक्सप्लोर कर रहे हैं। फिर वहां पे पांचभौतिक सिद्धांत हो, पंचकर्म चिकित्साएं हो, दवाइयां हो, योग चिकित्सा हो, व्यायाम चिकित्सा हो, डिजिटल एंगेजमेंट हो, इन अलग अलग विषयों के माध्यम से हम हमारे रुग्णों को बेहतर जीवन प्रदान करने का प्रयास कर रहे हैं। मुझे लगता है यही सबसे बड़ी अचीवमेंट है और यही माधवबाग की कोर फिलॉसफी है। अक्सर मैं कहता हूं कि माधवबाग इज not just a treating organization, it is going to transform the patient into a good human being. 360 डिग्री पे उस पे काम करना है। जो आयुर्वेद में लिखा गया है, स्वास्थ्य की व्याख्या जो की गई है, वहां तक अगर उस रुग्ण को पहुंचाना है, तो निश्चित रूप से हमें मानसिक चिकित्सा भी करनी होगी, शारीरिक भी करनी होगी, और हर एक एंगल से उस पेशेंट को अच्छा करने का प्रयास करना होगा। रिसर्च मेथोडोलॉजी के माध्यम से हम आगे बढ़ेंगे, डेटा पब्लिश करेंगे। इस सेशन में सिंगल केसेस प्रेजेंट हो रहे हैं, ये बहुत बड़ी अचीवमेंट है। आगे के सिंपोजियम्स में डेफिनेटली हम बल्क ऑफ पेशेंट्स यानी सैंपल साइज प्रेजेंट करेंगे, और अच्छा खासा सैंपल साइज होगा, ऐसी अपेक्षा रखते हुए आज का मेरा विश्लेषण मैं खत्म करता हूं। यहाँ पे जो बाहर के डॉक्टर है, एक्सटर्नल डॉक्टर्स जो है, मैं उन सबको ये रिक्वेस्ट करूंगा कि माधवबाग की जो डॉक्टर्स केस प्रेजेंट कर रहे हैं ना, ये सिर्फ एक केस है, बट दे आर ट्रीटिंग, एवरी डॉक्टर ट्रीटिंग नियर अबाउट 200 हार्ट पेशेंट इन स्पैन ऑफ 1 ईयर। तो ये कोई छोटी बात नहीं है। 200 से ज्यादा हार्ट डिसीज के पेशेंट जिनका इजेक्शन फ्रैक्शन कम होता है, कोरोनरी आर्टरी डिसीज होता है, या फिर बहुत सारे मेडिसिन उन्हें चालू होते हैं, कॉम्प्लिकेटेड केसेस होते हैं, और इन पेशेंट्स को रिकवर करते हुए वो बहुत सारे नॉलेज को अप्लाई करते हैं अलग अलग तरीके से। तो डेफिनेटली आप यहाँ पे इनको बहुत सारे क्वेश्चंस पूछिएगा ताकि ये इंटरेक्टिव हो। और इसके आगे कल के सेशन के मैं रिव्यूज देख रहा था और वहां पे मुझे पता चला कि बहुत सारे बाहर के डॉक्टर भी माधवबाग के साथ एसोसिएट होना चाहते हैं। तो मैं यहाँ पर आपको बता दूं कि 2025 तक माधवबाग का विजन है करीबन 5 करोड़ डायबिटीज के पेशेंट्स को रिवर्स करना। और उस उद्देश्य को साध्य करने के लिए या फिर मैं उस मिशन को कंप्लीट करने के लिए निश्चित हमें बहुत सारे डॉक्टरों की आवश्यकता होगी जो हमें इस मिशन को अकम्प्लिश करने में मदद करेंगे। तो जो जो नॉन माधवबाग के डॉक्टर्स आज ये सेशन देख रहे हैं उन सबको मैं रिक्वेस्ट करूंगा कि इस सेशन के बीच में जैसे ओंकार सर कुछ अपॉर्चुनिटीज आपके सामने रखेंगे जिसे माधवबाग एसोसिएट के नाम से हम जानते हैं, तो उसके बारे में आप चीजों को समझ ले, विषय को समझ ले और माधवबाग के साथ जुड़ जाए ताकि हम 5,000 डायबिटीज पेशेंट को रिवर्स करने का जो हमारा उदात्त ध्येय है 2025 तक उसे पूर्ण करें। तो यहाँ पर मैं रुकता हूँ। थैंक्स ओंकार सर, थैंक्स राहुल सर एंड माइक टू यू।
यस सर, थैंक्स अ लॉट सर। राहुल सर, मैं 2 मिनट के लिए आपको स्पॉटलाइट कर रहा हूँ और मैं चाहता हूँ कि यस, आज जो हमारे डॉक्टर्स अभी प्रेजेंट करने वाले हैं, करीबन 21-22 डॉक्टर्स है, आप उन तक आपका जो मनोगत है वो व्यक्त करें और बेस्ट विशेस जरूर दे सभी डॉक्टर्स को।
जी बिल्कुल, डॉक्टर गुरुदत्त सर और डॉक्टर ओमकार, अभी जैसे डॉक्टर गुरुदत्त सर ने कहा कि माधवबाग एक दिन में या फिर एक कुछ महीनों में, एक साल में नहीं बना है। इट टुक अराउंड 15 to 16 ईयर। ये बहुत बड़ा तपश्चर्या है जो माधवबाग के कुछ डॉक्टर्स ने करते हुए, डॉक्टर साने सर के अंडर ये सब हम लोगों ने जब ये एस्टेब्लिशमेंट का शुरू किया था, तो फ्रॉम अ सिंगल हॉस्पिटल टू 300 क्लिनिक्स तक पहुंचना और एक डॉक्टर से अभी 400 डॉक्टर्स का पूरा बड़ा टीम क्रिएट होना, और वो भी जो आयुर्वेदा से क्लिनिकल कार्डियोलॉजी प्रैक्टिस करते हैं, जो काबिल तारीफ है। और इसके पीछे, ये बनाने के पीछे जो बेसिक कॉन्सेप्ट है, जैसे हमें पता है कि सेल का रिप्लिकेशन कब होता है, डीएनए रिप्लिकेशन तभी होता है जब सारे जेनेटिक पैटर्न आइडेंटिकल हो, यानी वो मैच्योर्ड हो, प्रॉपर आइडेंटिकल हो, तभी उसका रिप्लिकेशन होता है। तो रिप्लिकेशन होने के लिए वहाँ पे साइंस और वहाँ पे साइंटिफिक आर्टिकल्स और रिसर्च की बहुत जरूरत होती है। तो यही डीएनए में हम सब डॉक्टर्स के है, रिसर्च और रिसर्च मेथोडोलॉजी। इसीलिए एविडेंस बेस्ड क्लिनिकल कार्डियोलॉजी प्रैक्टिस जो माधवबाग का बैकबोन बन चुका है, कि आप कल आपने देखा होगा कि कोई भी चीज का इंप्रूवमेंट अगर दिखा रहे हैं तो वहां पे एक कोई ना कोई पैरामीटर कैप्चर्ड किए गए हैं, और पैरामीटर ऐसे कैप्चर्ड किए गए हैं कि जो पैरामीटर को लेके वी कैन कन्वे द इम्प्रूवमेंट टू द कार्डियोलॉजिस्ट। जैसे कल डॉक्टर जगदीश हिरेमठ सर ने बहुत सही कहा कि इम्प्रूवमेंट इन टूडी को इजेक्शन फ्रैक्शन में इम्प्रूवमेंट होना, या फिर ईजीएफआर यानी रीनल आउटपुट इम्प्रूव होना इन सीकेडी पेशेंट इज नॉट एक छोटी चीज नहीं है, ये बहुत बड़ा आउटकम है। और ये तब हम बता सकते हैं जब हमने पैरामीटर लेके हमने पेशेंट के केसेस डील किए हैं, पेशेंट को दिखाया है कि आपका जीएफआर पहले कम था और अभी ये बड़ा है, या फिर टूडी को पहले कम था अब बड़ा है। तो माधवबाग के सारे जो डॉक्टर्स है, मैं तो खुद क्लिनिकल कार्डियो यानी प्रैक्टिस में नहीं हूँ, लेकिन आप इन सब आपके डॉक्टर्स के जब मैं रिसर्च या फिर इनके सब रिजल्ट देखता रहता हूँ, और जब मुझे मौका मिलता है इसका डेटा का एनालिसिस करने का, और प्रेजेंट करने का, अभी रिसेंटली जैसे मलेशिया में नेशनल हार्ट एसोसिएशन मलेशिया, दे हैव एक्सेप्टेड माधवबाग का जो ब्लॉकेज मैनेजमेंट, यानी ब्लॉकेज पे जो हमने 300 पेशेंट ऑफ ब्लॉकेजेस जहाँ पे रिवर्स हुए हैं, ऐसा डेटा सेट जो एनालिसिस करके वहां पे एक्सेप्ट हुआ है, एंड दे हैव इनवाइटेड माधवबाग to come and read the article on the blockage management at National Convention Center of Malaysia। तो नेशनल हार्ट एसोसिएशन मलेशिया ने भी इस चीज को के प्रति अपना एक इंटरेस्ट दिखाया है। तो डेफिनेटली आयुर्वेदा का बेसिक सिद्धांत को यूज करते हुए कल हमने देखा कि लंघन या फिर क्षुधा निग्रह, तृष्णा निग्रह जैसे बेसिक कॉन्सेप्ट को लेके भी CCF CKD जैसे पेशेंट्स को ट्रीट किया जा रहा है। कहा कुछ जगह पे हम लोग भ्रामरी का यूज करते हुए हम लोग एसेंशियल हाइपरटेंशन को मैनेज कर रहे हैं। सो मेनी ऑफ टाइम वी आर नॉट यूजिंग अ प्रोडक्ट, यहाँ पे ड्रग नहीं यूज किए जा रहे हैं, यहाँ पे कॉन्सेप्ट यूज किए जा रहे हैं आयुर्वेदा के, और ये बहुत ही काबिल तारीफ चीज है। दिस इज समथिंग वेरी एक्स्ट्राऑर्डिनरी एंड आई एम एक्सपेक्टिंग टुडेज सेशन बिकॉज वी नो कि डॉक्टर्स फ्रॉम पुणे एंड डॉक्टर्स फ्रॉम साउथ मुंबई दे आर नोन टू बी एक नॉलेज गुरु है एंड नॉलेज का सब भंडार उन लोगों के पास है। और ऐसे 22 डॉक्टर्स दे आर गोइंग टू प्रेजेंट टुडे। सो मैं तो पूरा अभी अगले 5 घंटे ये स्क्रीन से हिलने नहीं वाला हूँ। एंड ओवर टू डॉक्टर ओमकार के यहाँ से हम लोग अभी आगे कैसे जाने वाले हैं, अगर आप बताएं तो बेहतर रहेगा।
Yes, thank you, Rahul sir. Doctors, let me introduce again Dr. Rahul Mandole sir and Dr. Praveen Gadigaukar sir, who will be the chairpersons for today's event, and I'll be the moderator, wherein we are going to give 10 minutes time per presenter, out of which 8 minutes will be allotted to each presenter for presenting their presentation, and 2 minutes will be taken up later for the question answer session. Not more than 2 questions will be taken up by me and Dr. Rahul, so that the presenter will finish up in 10 minutes time, because there is a good number of doctors who are going to present, so we need to be very stringent with the time, right? So before starting today's first presentation, Gurudatta sir has told regarding associate program of Madhavbaug. So if the doctors who are from outside Madhavbaug have joined, and if you want to be an associate of Madhavbaug, there will be a link shared in the chat box by Mr. Saurabh Kulkarni. You can get complete details of this associate program in that link to be the best type 2 diabetes reversal associate doctor. So if you are interested to be an associate with Madhavbaug, definitely in the chat box, Saurabh Kulkarni will be there to guide you all for this associate program. Now, let's start with our second day of first National Ayurveda Cardiology Symposium. Knowledge partner MUHS, Madhavbaug Institute of Preventive Cardiology, and powered by Medemy. So best wishes to all the doctors who are presenting today, and keep your smiling faces on. You are superb doctors. We just we want to let this world know about the hard work which you are doing. So best of luck. I'll be introducing the first doctor now. The first doctor for today's presentation is Dr. Aarti Badre from Andheri West Clinic, Mumbai. And her topic of presentation is comparative study of reverse and swasthyam diet box with respect to lipid parameters. Dr. Aarti, I am going to spotlight you now, and you can unmute yourself and start your screen sharing. You have 8 minutes of time with you. Best of luck. Ma'am, you are not audible. You need to be audible. No, ma'am. Can you remove the headphones?
There are three logins of Dr. Aarti Badre.
Yes, doctor, can you speak now? There is some technical issue. Okay, by the time Dr. Aarti sorts out this issue, I think, Rahul sir, we should move on to the second presenter. Is it fine?
Yes.
Okay, fine. The second presenter is Dr. Neelam Mahadik from Vasai West Clinic, and her presentation topic is role of 800 calorie low carbohydrate diet and herbal medicines in non-physically fit diabetes patient. So I'll be spotlighting Dr. Neelam now. Dr. Aarti, you will be given chance after Dr. Neelam. Yes, Dr. Neelam.
Am I audible?
Perfectly audible, ma'am.
Yes. Good afternoon, all. Myself, Dr. Neelam Mahadik from Vasai West Clinic. I'm working in Madhavbaug since last 12 years, and I'm sharing my PPT.
Ma'am, you have 8 minutes of time left.
Yes. There is some issue. Dr. Rahul, can you please share my PPT?
Yes,
Hello?
Neelam, ma'am. The presentation is visible now. You can start.
Yes, sir. Hello? I'm audible?
Yes.
Yes. Okay. I'm starting my presentation. My presentation is role of only 800 calorie low carbohydrate diet in newly diagnosed type 2 diabetic patient, a single case study. Next. The objective behind this, what is the prevalence of diabetes in India? So in 2019, 77 million people are diagnosed with diabetes, and it is predicted that in 2030 it will be 100 millions, and 2045 it will be 134 million. And in 2019, 77 million adults in India have diabetes, and still 43.9 million people were with undiagnosed diabetes. So I have choose this topic as a diabetes case. My case next. My patient medical history. My patient is 55 years female. By profession, she is a teacher. Past history, she is having a hypothyroid and on medication, thyroxine 100 microgram since last 5 years. 6 months back, she had a history of fall and she is living in Mumbai, Vasai. Next. When patient came to me, the patient had a history of fall on her back. So she was not able to do any physical activity. And that's why she gained a weight. And when she came to me, she is having a complaints of low vision. So that time she went to ophthalmologist and did a normal routine test for the routine checkup and found that HbA1c was 15.9, and she was not having other symptoms like which we are having in a diabetes, but only a low vision. So having a 15.9 HbA1c, I thought of a type 1 diabetes also and did C-peptide, but C-peptide levels were in normal range. So I diagnosed her as a type 2 diabetes with hypothyroidism. Next. As patient was contraindicated for exercise due to severe injury on lumbar vertebra. She was on a bed for 2 months, and after that she was having a little normal daily walk or daily routine. So she was not able to do any type of exercise. Second, in Madhavbaug, we know that we all treat diabetes by a panchakarma treatment also, but as she was not able to move a little bit or even on a backside or not able to sleep on her own abdomen. So the treatment protocol was available for only diet and oral herbal medication. So I chose only a diet and oral herbal medication for her as a diabetic treatment. Next. So diet 800 calorie low carbohydrate diet, moderate protein and low fat. And in Madhavbaug, we all know it's a Prameha diet box. What it contains? Next, the diet box has 800 calorie. How this 800 calorie is divided in daily routine? Early in the morning, 5 gram of avla churn with 200 ml of water we are giving to a patient. After that, 8 a.m. one fruit that is allowed in a diabetes, that we can have an apple or a pomegranate or a pear, like fruit, 15 minutes before breakfast, then herbal tea, then one type of breakfast which I have mentioned here, that one idli, thalipit, uttappa, moong dalia, roasted chana jod, roasted moong, roasted soybean. All these are not like our daily routine breakfast. Idli is not that we usually made of this rice or urad dal. It is of a mixed dal. Then thalipit also we know it's of a mixed dal. Uttappam, usually we have uttappam of rice, but this is not a uttappam of rice. It is also a mixed proportions of a mixed dal. So all these breakfast are rich in protein, not in carbohydrate. Then at 11 a.m. we are having a herbal soup in that. Next, then lunch. For lunch, we are offering a roti, sabji, dal, and salad. For a roti, we are not giving a normal roti. It is a roti of a what we are having roti of that gehu and all that. This is not normal. The roti we are giving it's of 40 grams, and 40 grams is on of barley and the mix. Then sabji. Sabji what we are giving normally, dal and salad. In that lunch, we are divided all this in a proper portion, and the salad portion is half of the plate. Then 4 p.m. 4 p.m. we are offering dry fruits, 5 almonds, 2 walnut, 2 pista with herbal tea. 6 p.m. kokum juice. It is not a sweet one. It's a kokum. And last 8 p.m. it's a dinner, same like as a lunch. Next. It is of a diet. What herbal medication I have used? It's first is a decoction of Meshashrungi and Guduchi. This all we know in Madhavbaug as a diaphragm kada. It promotes regeneration of islet cells and improves the function of liver and pancreas. Second medicine which I have used in a capsule form, that is a combination of banaba extract, amalaki extract, and haridra extract. In Madhavbaug, we know this capsule as a BAH capsule, which acts like a synthetic insulin, activates beta cell, increases sensitivity of peripheral tissue to insulin. Third medicine which I have used is again a capsule, which is of Meshashrungi extract, Amalaki extract, and Haridra extract. In Madhavbaug, we know it is as a glycinoma capsule, which inhibits glucose absorption from the intestine.
Doctor,
Next.
last 2 minutes.
Yes, sir. Churna 9 herbs, which is antihypertensive, pancreatic stimulant, liver stimulant. Liquid, which is having a 44 herbs, known as a alluri, liver stimulant, anti-inflammatory, and antioxidant. And Churna 5 herbs, which stimulates colon motility, inhibits water and electrolyte absorption, and improves digestion. The clinical data which I observed in this patient was, day 1, her weight was 77.6, which on day 120 it is 67. That is a 10 kg weight loss in 4 months. And HbA1c, which I have gradually observed, in day 1 it is 15.9, but in after 1 month it is 11.9. In February it is 9, in March it is 7.5, and day 120 it is 6.6. And just now I consulted the same patient, her weight is 63 and her HbA1c was 6.5, below than 6.5. And I have mentioned fasting and PP sugar here also, which comes after 1 month only in a normal range. In that, I have observed one more thing, that TSH, which was 16.54 in day 1, which was immediately after 1 month 0.6, and I have to reduce the hypothyroid medicines. Next, compliance given by the patient was daily sugar monitoring, fasting and PP for 1 month, and then on Wednesday and Sunday, and daily sending a picture of food on an app designed by Madhavbaug, which I have shown in the picture. Discussion, the hetu of prameha, we all know that in Charak Chikitsa Stan, it is described as the Asya Sukam Swapna Sukam Dadini, Pramyadaka Ahar Nava Payansi, Navanapanam Gud Vaikrutam Cha Prameha Hetu Kaphakrutya Sarma. In that, we all know that diet is the main hetu in a prameha. Next, pathophysiology, we all know that because of the obesity, there is an insulin resistance. Insulin resistance causes decreased glucose uptake, hyperglycemia, and type 2 diabetes. If there is decreased glucose uptake, increased hepatic solution also causes hyperglycemia and type 2 diabetes. So how I reverse the diabetes in this patient? Reduction in dietary carbohydrate causes reduction in weight, reduction in insulin resistance, that decreases the hepatic glucose output and control sugar levels. So my conclusion is diet plays important role in diabetes management. Low carbohydrate, moderate protein, and low fat diet is a key to reverse diabetes. Oral treatment also reduces the hypothyroid medicines dose. Thank you.
Thank you, Dr. Neelam. Praveen sir, your views on this, please.
Yes, Dr. Neelam, superb presentation. And as we saw in your presentation that low carb diet is key to reverse type 2 diabetes. Is there any other special observation in your case that 800 calorie diet, is it sufficient to the patient, or patient is consuming outside food or home based other food in her diet?
No, sir. I have monitored hers from first day till date also,
Okay.
and she was giving me each peak of breakfast, her lunch, her dinner, and sugar level for 1 month. And we all know 15.9 HbA1c goes to 11.9 in within 1 month, and her sugar level was perfectly normal after 1 month. This is not possible without diet. And I know her ki she was a teacher, and I found the profession wise teacher patient, those who are teacher are really following all the things given by a doctor.
Okay, thank you.
Thank you.
Yes, Rahul sir, your comments on this, please. Kindly unmute. Yes, sir.
Dr. Neelam, excellent presentation. I
Thank you,
have
sir.
very few, not a doubt, but a curiously, I would like to ask you. In your
Yes, sir.
diet, you use so much of things which are made up of dal. I think
Yes.
to minimize the glycemic index. And
Yes, sir.
so if you are giving so much of dal we know it's a ruksha anna, and having so much of dal from the morning, from the breakfast to the lunch to the dinner, everywhere you have used dal, and I haven't seen the anything apart from this who can counteract the vata prakop. So how you have managed or how
Uh,
you have yes.
okay, sir. In first month it was okay, but in second month the patient was complaining, so I have started with the Gogruta.
Okay, so what was
Ha,
the complaint?
so daily, patient was having a little bit back pain, and no, already she has a
Yes.
history
So
of fall
the
and all the
Lakshana
things.
of a Vata
Ha,
Prakop was
yes.
there.
So Lakshana was what Prakop was there. So I have added a Gogruta in the, daily consumption, daily morning, 2 teaspoon, 10 ml.
Okay, that's super.
So
But
that, ha.
consumption of two spoon of a grita may have increased the calorie because you advise for 800 calorie.
Yes, sir, but that was not observed in my patient. So her
Okay.
basically her complaint reduced, and I saw na ki her sugar level was reducing down. So that was not an issue.
Okay. So always, if it ends well, and you have got a very good success here in your patient, and the good thing is your patient was not able to do the physical activity, and yet
Yes.
that patient has reduced a weight, and that patient has reduced HbA1c, and excellent result, and all the best and congratulations again.
Thank you, sir.
Awesome presentation, Dr. Neelam. To start with the second day of National Ayurveda Cardiology Symposium. Hats off to you. So now we'll move on again to Dr. Aarti. Dr. Aarti, can you unmute yourself?
Do you consider insulin resistance?
Yes, doctor. Still there is some issue. Fine, ma'am. I think you need to speak with some of the IT persons of Madhavbaug.
I think if she connect through her phone, cell phone, and we can catch her voice through cell phone.
Yes, that.
Dr. Neelam, you can share your phone number in the chat box. I think Dr. Medhavini Joshi, she's having some question, and if you can share your phone number or something, so she will talk to you and you can answer her question.
Okay, fine. So I think Dr. Aarti, you'll have to wait for some time. We'll come back to you again. Don't worry. That's a technical glitch which can be sorted out. No worries. Okay. Chalo, we'll move on to the next presenter now. Okay. Dr. Prajakta Asnodkar from Meera Road Clinic. Her presentation, the topic of presentation is efficacy of Ayurvedic Panchakarma therapy and Langan Chikitsa in patients with CHF having raised NT-proBNP levels. Doctors, let me tell you that Dr. Prajakta Asnodkar is not present over here. She is out of India presently, but she has sent her presentation on video. So I'll be sharing my screen. Go through the presentation. If Dr. Prajakta can connect with us in the chat box, then definitely you can ask some questions to her. But meanwhile, you can view her presentation. I'll be sharing my screen for Dr. Prajakta's presentation. Just give me a moment. Just a moment, doctors. Okay.
Good evening, respected jury and my dear friends. My name is Dr. Prajakta Asnodkar and my topic for today's presentation is role of Ayurvedic Panchakarma therapy and Langan Chikitsa in treating patients with chronic heart failure having raised NT-proBNP levels. Chronic heart failure is a clinical syndrome that primarily...
Is it audible to all?
Yes, it is audible.
Yes, and visible too, na?
Yes, Doctor.
Yes, just a minute.
Affects elderly people. It is associated with high mortality and high morbidity and is often attributed to left ventricular systolic dysfunction. How does heart failure begin? One seldom has an opportunity to observe the very beginning of heart failure syndrome. Patients often go through asymptomatic left ventricular dysfunction before development of overt signs and symptoms. In this context, I would like to present my case of a female who was 63-year-old, who presented with complaints of orthopnea, insomnia, irritability, reduced appetite, and dry cough. She was hospitalized thrice in the past 1 year for sudden onset of dyspnea. She was on antipsychotic medicine, which she has stopped on own since 1 month. On examination, I found there was bilateral pitting edema, there was pallor, irregular heart rate, and her blood pressure was low. A 2D echo showed LV dilated, LV dysfunction with the EF of just 25%. I diagnosed her chronic heart failure with LV dysfunction. She had come with 3 reports of 2D echo which were showing similar findings, but she was deteriorating day by day in spite of several hospitalizations. Hence, I advised her NT-proBNP test, which was found very high, 20,141. NT-proBNP, also known as N-terminal B-type natriuretic peptide, is a cardiac neurohormonal marker released from the ventricles. The main stimulus for proBNP synthesis and secretion is the stretch of the cardiac myocyte. In heart failure, increased wall stretch, neurohormonal activation and hypoxia stimulate BNP secretion from the ventricles. Hence, anti-proBNP levels are elevated in CHF from LV dysfunction. And these are the normal values of anti-proBNP. So determination of NT-proBNP helps identify subjects with LV dysfunction, and the changes in value can be used to evaluate the success of treatment in treatment of LV dysfunction. Coming back to my patient, 20,141 NT-proBNP was a huge challenge for me, and I first put the patient on Langan Chikitsa. Definition of Langan as mentioned in Charak Sahita Sutrastan, Yat Kinkit Laghav Karam Dehe Tat Langanam, which means procedure which brings lightness in the body. Amongst the 10 types of Langan Chikitsa, I first carefully planned Upvas and Pipasa Nigra in this patient as she was culpable. To reduce fluid retention and improve her Agni, I kept the patient NBM for 24 hours and repeated this weekly once for the next 1 month. Remaining days, she was advised to go on Moong diet. Moong being Madhur Ras, Ruksha, Laghu Gunatmak, helped in clearing the obstructed body channels, digestive and metabolic pathways. Later, I advised the patient to be on 12-hour intermittent fasting to help reduce the inflammation. In the above process, she lost good amount of weight due to excretion of excess fluid from the body and preventing excess fluid retention. Also, there was fluid restriction of 1 liter per day and salt restriction. A fluid intake and urine output were asked to measure regularly. Later, advised the patient 1,000 calories diet, high in ORAC and antioxidants. For the first month, due to the pedal and congestion, her Panchakarma procedures was planned as 8 Shirodhara with Jatamasi path weekly twice, along with Fufu Snehan, that is Snehan over the thoracic wall with til oil followed by Svedan. These procedures help to bring a sense of well-being and relaxation in her, reduce her anxiety, reduce her sympathetic overactivity, induce sleep, and reduce the heart rate. Fufu Snehan helped in dilating the blood vessels of the lungs and helped the circulation to the accessory muscles of respiration, which in turn reduced the pulmonary artery hypertension and dyspnea. Further, 21 sessions of Snehan, Svedan, Rudadhara, and Basti were planned weekly twice with a gap of 3 days between 2 sessions. Snehan done significantly helped in reducing the sympathetic overactivity, improved the vascular tone, and helped in reducing the myocardial oxygen demand and workload. Svedan helped in reducing the systemic vascular resistance. Cause vasodilatation helped in decreasing the afterload. Rudadhara done with the Shmul decoction helped to improve the blood supply, accessory muscles of respiration, and improved symptoms of dyspnea. Of Arjuna and Pundarnava extract helped in diuresis and improving the strength of the cardiac muscles. Oral medicines between formulations of Arjuna, Pundarnava, Gopchur, Ashwagandha, Vata, Brahmi, Janamasi, and Teran. The patient was also advised some exercises like pranayama, spirometer, ballooning, and some simple chair exercises to improve her VO2 max. Patient showed a very good compliance during treatment, and the results were as follows. As you can see, the blood pressure improved from 80 by 50 mm of mercury to 126 by 80 mm of mercury. The heart rate, which was irregular, initially improved from 96 to 74. The weight reduced from 59.2 kg to 46 kg. The pedal reduced. Orthopnea improved to a great extent, and it's only DOE grade 1 now. The 6-minute walk test improved. I mean, she couldn't even walk on the first day, but now she can walk for almost 500 meters. Her quality of life improved to a great extent. She was breathless while talking, even during sleep, even during rest. And now she can walk 2 kilometers and go for her satsang. There was a great improvement in the parameters also. The HB improved from 8.6 to 11.8. The electrolytes improved. The TSH improved from 10.28 to 0.94. The serum creatinine improved. The NT-proBNP specifically improved from 20,141 to 4,549. Then to 4,043, and now it is 2,274 after a period of 120 days. The 2D echo, which was showing global LV hypokinesia, improved to mild global LV hypokinesia. The LVEF, which was 25%, improved to 45.8%. The PASP reduced from 35 to 30. The LA diameters, the LV mass, the EDV, ESV also improved to a very good extent. And these are the reports, the laboratory reports of the patient. Here you can see the NT-proBNP, which was 20,141, and now it is 2,274. The allopathic medicines, as you can see, digoxin has been completely stopped. Atorvastatin, torsemide, clopidogrel, aspirin, amiodarone have been reduced. Thyroxine has been reduced from 100 mcg to 25 mcg. The spironolactone, sodium bicarbonate, and the nebulization has completely been stopped now. Coming to the pathophysiology of CHF, heart failure is the end result of a number of different pathophysiological processes in which there is injury to the heart with loss of functioning of the myocardial cells. Compensatory neurohormonal mechanisms are activated in order to maintain adequate cardiac functions and tissue perfusion. Activation of the sympathetic nervous system, increase in the heart rate and cardiac contractility, while activation of renin, angiotensin, aldosterone system, increase in sodium reabsorption and water retention. Although these responses are initially beneficial, prolonged overstimulation results in maladaptive cardiovascular remodeling. So reduction in the sympathetic overactivity, reduction in fluid overload, reduction in cardiac workload, dilatation of the blood vessels, improving the vascular tone, strengthening of the cardiac muscles, Strotoshodhan, Rasdhatavagni Deepan, and Rasdhatu Poshan helped me in improving this patient of CHF with LV dysfunction. Hence, I can conclude NT-proBNP levels along with clinical assessment may prove as a superior tool for patient evaluation in patients with CHF having LV dysfunction. Ayurvedic Panchakarma therapy along with Langan Chikitsa, exercise, lifestyle modification, and stress management can definitely help in inhibiting neurohormonal activation, reduce the myocardial wall stretch, thereby reducing the NT-proBNP levels and have a long-term benefit with regards to mortality and morbidity in patients with chronic heart failure. Thank you.
That was very kind enough of Dr. Prajakta. Being out of India, still she wanted to be part of this fantastic symposium and had shared her presentation. I feel all doctors must have gone through this video properly, and definitely you will appraise the efforts taken by Dr. Prajakta in giving the patients so beautiful results. Thank you, Dr. Prajakta, for being part of this second National Ayurveda Cardiology Symposium. Excellent presentation. Rahul sir or Praveen sir, if you want to highlight some of the points in Dr. Prajakta's presentation. Yes,
First of all, it's a really wonderful presentation and hats off to dedication of Dr. Prajakta. That the patient when she started treatment of the such patient where the NT-proBNP is such a high level with the LV distress and poor LVEF and even VO to peak was very low. If there was a edema, in generalized pedal edema, so as such condition normally many of even allopathy doctors give up. They directly ask patient to you should take your patient and go to home because we can't do anything extra apart from this. And in such condition, without adding any allopathy medicine or without adding any surgical intervention into it, she improved the patient to very good extent. Reduction in NT-proBNP, improvement in his LVEF, and reduction in edema without adding any diuretic. So really commendable job the doctor has done, and God bless her.
Yes, Praveen sir, your views on this, please.
Yes, as Dr. Rahul sir said, many patients who are in 25% EF and having NT-proBNP more than 20,000 may land up in a critical condition, and further heart transplant like operative procedures were suggested in such type of patient. And these patients, Ayurvedic treatment without allopathy intervention help in that way, which are really commendable. Good work, Dr. Prajakta. Keep it up.
Yes, excellent presentation, Dr. Prajakta. Now we move on to our fourth presenter of the day, Dr. Supriya Shinde from Andheri East, Western Mumbai. And her topic of presentation is effect of ischemia reversal program on ischemia and lipid levels. So I am now going to spotlight. Yes, Dr. Supriya, you can unmute and you can start screen sharing. Best of luck.
Thank you, sir. Am I audible?
Perfectly audible.
I'll start sharing my screen.
Yes.
Okay. Good afternoon, everyone, and respected delegate. I'm Dr. Supriya Shinde. I'm working as clinic head for Madhavbaug Andheri East Clinic. Effects of Panchakarma and diet modification of ischemia and lipid levels is my today's topic of presentation. Ischemic heart diseases as highest risk of mortality. So if Ayurveda interventions are going to treat ischemia at initial levels, further complications can be avoided. Thus, aim of my topic study is to evaluate the role of Panchakarma and diet on reversing ischemia and reducing lipid levels. Now let us understand ischemic heart disease, in which our heart requires 225 ml of blood every minute. As we exert, the requirement of blood goes on increasing. If the heart doesn't receive the required amount of blood during exercises, the heart muscles can get damaged due to lack of blood supply. This is clinically termed as ischemic heart disease. In ischemic heart disease, patients suffered chest pain due to increased stress on heart, which reduces and reduction in blood supply. It causes death of heart muscles with reduction in pumping capacity of heart, which leads to chronic cardiac failure. With the understanding this ischemic heart disease and in progression, Madhavbaug's ischemia reversal program was used as intervention in my case series. Advanced Ayurveda, Panchakarma diet and lifestyle management was applied for the same. I will be representing a case series of 3 patients which were studied for a duration of 90 days at Madhavbaug Andheri's clinic. Reverse diet box. Ahar has been considered as one of the Trayopastamba, reversing ischemic heart disease, which is a lifestyle disorder. Correcting diet was the important step in reversing ischemia and reducing lipid levels. The diet box helped the body to use the stored glycogen in the adipose tissue by maintaining the negative calorie balance. Along with rich nutrition content, it also contains Ayurveda herbs, amplifying its value. It's rich in anti-inflammatory action, omega-3 content, more than 50,000 ORAC value. It is reduced in glycemic index. It is 1000 in calorie and it repairs the collagen. This scientifically based diet plan initiates the reverse cholesterol mechanism by which body removes excess cholesterol from the peripheral tissue, delivers them to liver. The main lipoprotein involved in this process is HDL. Thus, we have increased HDL levels in my cases. I would like to add few more key ingredients of reverse diet kit, in which Arjun is hypolipidemic in nature and which is rich in CoQ10 enzyme. Green tea contains catechin, which is helpful to reduce the cholesterol level. Dry ginger helps to reduce ApoB by ApoA ratio, and which is hence helpful to reduce the total cholesterol. Again, turmeric is good in Lekhan Karma, so it helps to reduce the cholesterol levels. Oats contain beta-glucagon, which reduces the total cholesterol and LDL level. In diet box, we do have chickpeas, which contains cetosterol, which helps to interfere with absorption of the cholesterol mechanism and reduces the cholesterol. Along with that, there is in diet box, we do have nut mix bar, which is rich source of omega-3. It contains pumpkin, sesame seeds, sunflower seeds, flax seeds. So these ingredients are really helpful to reduce down the cholesterol levels. Panchakarma. In Panchakarma, centripetal olation, we use til oil with lavender oil. Lavender oil, which was used for Snehan, had a soothing effect on patient, which reduces the sympathetic activity of body. Also, Snehan improves the elasticity of vessel, thus improving the blood supply towards heart. Svedan, that is thermal vasodilatation with Dashamulkwat. It helps to excrete the accumulated salt and water through sweat, reducing the viscosity of blood. Basti, per rectal drug administration, in which we use GHA Kwat. GHA contains Gokshur, Amalaki and Haridra. Many researchers have said that Gokshur improves the intrinsic and extrinsic nitric oxide, thus included in Basti, along with Haridra, Amalaki, which also act as anti-inflammatory and as an antioxidant. Nitric oxide improves the dilatation of blood vessels, thus improving blood circulation. Here I would like to present case series of 3 of my patients. They were known case of ischemic heart disease and dyslipidemia. The common complaints were dyspnea on exertion and chest heaviness. After compliance of diet box and proper Panchakarma treatment after 90 days, the results are shown in upcoming slides. BMI, on an average, in first two cases, BMI is reduced by 4, which is approximately 4 to 10 kgs. VO2 max, as we know, exercise tolerance capacity of heart is known as VO2 max, and it is a predictor of mortality. Improving ischemia reversal shows improvement in my patient by averagely 7 to 8 ml of oxygen. Duke score, as there is significant improvement in VO2 max, there is an improvement in MET value, which shows there good improvement in Duke score. Reverse diet box, which initiated reverse cholesterol mechanism, give a significant improvement in lipid levels, which were as follows. The total cholesterol is reduced. LDL levels is reduced in good quantity. LDL levels are improved. And triglycerides levels, again, in second case, there is a markable improvement.
Last 2 minutes, please.
Yeah. Discussion. Ischemia is imbalance between demand and supply of blood. Reverse diet box, reducing the weight burden and initiating reverse cholesterol mechanism help to reduce LDL levels. The intervention increase in HDL, which facilitates the effects of cholesterol from the peripheral to liver cells, where it is metabolized, thus reducing blood viscosity, improving endothelial dysfunction, improving elasticity of arteries. Panchakarma played its part reducing heart rate, improving blood pressure, and reducing spasm of blood vessels. Thus, improvement in heart muscle strengthening and circulation, thus improvement in ischemic heart disease. So the conclusion is, as per our discussion, with the proper diet management and Panchakarma, it is helpful to reverse ischemia and definitely lower down the cholesterol levels. Thank you.
Thank you, Dr. Supriya. That was a fantastic presentation. Dr. Rahul sir, your views on this, please.
Yes. Can we stop? Yes. Thank you. Dr. Supriya, excellent presentation, and it requires a lot of literature search to come out with so much of information. And you did it like a very expert researcher. So hats off to you, first of all.
Thank you, sir.
I just by your presentation, I just imagine you must have spent so much of time in exploration of your the ingredient of food what you are prescribing to your patient. So it's a very limited edition logo mein aisi quality hoti hai. So very good. And just a question that your presentation was excellent, and the topic was that you have chosen ischemic heart disease with dyslipidemia. In that case, is you did exceptionally good job. Just one point I want to ask you. Your patient, when they came to you, they had a ischemic heart disease. Their stress test was positive. They had a dyslipidemia. Why? What were the chances that the patient may having a coronary artery disease as well?
Sir, one of the three cases, one of the patient, the case C was having coronary artery disease. Okay. But patient was underweight, like his BMI was on lower side. Okay. So accordingly, we treat them in our treatment, which is for coronary artery disease. The treatment was like that only.
Okay, but treatment, right? Yeah. I don't have any problem, but I'll suggest in such cases if we could have get CT angiography done.
Sir, actually, patient's family was concerned about his weight, so patient's family refused for the same.
Okay, but maybe in the future, if such patient is again coming to you, will you?
Rahul sir, your voice is not audible.
If in the future the same kind of a patient is coming to you, where you are already you have reduced the dyslipidemia condition, you have reduced the ischemic heart disease, you have controlled the without reducing so much of weight. So won't you suggest your patient to go for CT angiography, because you have lost a chance to show that your patient's blockage is also reduced.
Okay, sir.
Right?
Yes.
So at the end, what I will suggest, excellent presentation, superb way, and keep it up.
Thank you, sir.
Yes, Praveen sir, your views on
Yes.
this?
All the best, Dr. Supriya.
Thank you, sir.
Okay, in the chat box, I am expecting questions. If anyone has any questions, you can please put your questions in the chat box. Otherwise, we'll move on. Acha, there is one question from Dr. Sanjeev Kumar. Did you take written consent from the patient?
Yes, sir. We took written consent from each and every patient.
Fine, thank you. Any more questions, doctors? Fine, then we'll move on to our next presenter. Our next presenter for today is Dr. A.M. Siddiqui from Boisar Clinic. Role of Ayurveda-based heart failure reversal program in management of CHF with pleural effusion and pericarditis. So now I will spotlight Dr. Amirullah Siddiqui. Yes, doctor. Welcome. Kindly unmute yourself. Yes, doctor.
वेरी गुड आफ्टरनून टू एवरीवन सर मेरा आवाज आ रहा है आपको
एकदम clear, sir. You can start with your screen sharing. You have 8 minutes of time.
Fine. सर मेरा पीपीटी दिख रहा है आपको
Yes, sir.
जैसे कि हम लोग देख पा रहे हैं सर कि अभी तक हम लोग आयुर्वेद बेस्ड एविडेंस बेस्ड आयुर्वेदिक प्रैक्टिस में कैसे हार्ट डिजीजेस को ट्रीट करने में सक्षम रहे हैं और आज उसका कहीं ना कहीं हम कल से और आज तक में बहुत सारे केसेस में उसके एविडेंसेस भी देख लिए। मेरा एक जो केस था वो एक डेफिनेटली कार्डियक फेलियर का केस था, बट उसमें एक एडिशनल पॉइंट थे जो कि एक एज अ कॉम्प्लिकेशन केस था, मतलब वो डिजीज का एक कॉम्प्लिकेशन पार्ट था जिसमें मैंने ये स्टडी की है। तो द प्रेजेंट स्टडी फॉर द डे इज the present study was designed to evaluate the effect of pipilocytin panchakarma, a single case study in heart failure induced pleural effusion. So ये एक तरह का कॉम्प्लिकेशन था हार्ट फेलियर की वजह से जो प्लूरल एफ्यूजन डेवलप होता है, वो मैंने एक केस स्टडी किया हुआ है। एंड ये एक तरह का जो पेशेंट था उस टाइम पे जब वो आया मेरे पास ट्रीटमेंट के लिए, तो उसके सिम्टम्स कुछ इस तरह से थे, लाइक कफ विथ एक्सपेक्टोरेशन, पाल्पिटेशन बहुत था, हेवीनेस इन चेस्ट थी, डिस्निया इतना था कि उसका सैचुरेशन लेवल वाज अराउंड 84-85। आई वाज अनेबल टू टेक हर ईसीजी ऑन फर्स्ट डे, so fatigue was so much of fatigue feeling were there, and the constipation was her initial complaint. So you can see that after treatment all the symptoms has been reduced successfully. This was some parameters which I have observed during her treatment, 90 days treatment. So there was very improvement in heart rate. Initial stages her heart rate was 92, which has come to 78, and these were the medicines, allopathic medicines, which I have used during the treatment as well. So these are the Ayurvedic medications like Punura, RGX granules, SM cards, Thermomil liquids. These are the medicines which we use in our day-to-day Madhavbaug practice. So I will show you this was the before X-ray, like before treatment X-ray. You can see the clear water level at the left side of the heart, and this This was after treatment. This was the X-ray which was like after the treatment, and these are the reports which were noticed before the treatment as well as after the treatment. So pleural effusion बहुत successfully इस केस में treat हुआ. साथ ही साथ you can see that the cause of pleural effusion, जहाँ पे वो patient already एक old MI patient था जिसमें dilated LA, left atrial और left ventricle भी dilated थे, और regional motion abnormality भी थी उसकी, severely impaired थे, और type 2 diastolic dysfunction था, moderate pleural pulmonary arterial hypertension था, pericardial effusion and pleural effusion था, और उसका प्रेशर जो pulmonary artery प्रेशर था, it was 50 mmHg. जो आगे की केस में जो हमने इम्प्रूवमेंट देखा उसके कॉम्प्लिकेशन प्लूरल एफ्यूजन को कम करने के बाद, वो ये हुआ कि मॉडरेट पल्मोनरी आर्टरी का जो प्रेशर था वो रिड्यूस होके माइल्ड पल्मोनरी आर्टरी प्रेशर हाइपरटेंशन पे आया, और जो प्रेशर 50 mmHg था का वो 45 में हो गया. तो ये उसका 2D को पोस्ट ट्रीटमेंट इम्प्रूवमेंट था, और पोस्ट प्लूरल एफ्यूजन का जैसे हमने एक्सरे में देखा वो एक्सरे में उसकी reportings थी. So these were the findings which I found during my treatment course. So इस केस में रिपोर्ट वाइज एज वेल एज ये उसके एविडेंसेस थे जहाँ पे मैंने ये गैदर किया हुआ है पेशेंट का इम्प्रूवमेंट. और इस ये प्लूरल एफ्यूजन को जो ट्रीट करने के लिए मैंने बेसिक कॉन्सेप्ट जो पिपली रसायन हमारा आयुर्वेद बेस्ड का पिपली रसायन कॉन्सेप्ट इस्तेमाल किया था, जिसमें जो मेरा थॉट था कि अगर लंग्स में पानी भरा हुआ है तो वो लंग्स के पानी को अगर मुझे सुखाना है, या फिर वो जो हार्ट के बगल में जो पेरिकार्डियल फ्लूइड जमा है अगर मैं उसको रिड्यूस नहीं करता हूँ तो मेरा हार्ट अच्छी तरीके से फिर आगे फ्यूचर में फंक्शन नहीं कर सकता है. सो दैट वाज द आइडिया कि मुझे वो पेशेंट का पानी का जो स्तर था वो कम करना था, जो एफिशिएंट जो फ्लूइड एक्यूमुलेशन था उसको रिड्यूस करना था, और उसके लिए मैंने ये पिपली रसायन का कॉन्सेप्ट इस्तेमाल किया, जहाँ पे पिपली का जो उष्ण और रुक्ष गुण है उसका इस्तेमाल मेरे दिमाग में था, और जो दीपन पाचन उसकी प्रॉपर्टीज है उस चीजों का, उसका जो वीर्य विपाक है, उन सब चीजों के कॉन्सेप्ट पे मैंने आगे काम किया, जहाँ पे मुझे ये लगा कि इससे मैं इम्प्रूवमेंट ले सकता हूँ. तो आफ्टर फर्स्ट सेटिंग के पिपली रसायन करने के बाद में मैं जो पेशेंट का सैचुरेशन लेवल ऑलमोस्ट 93-94 तक जाते मिला, और जो डिस्निया था वो काफी हद तक इम्प्रूव हो गया. पेशेंट का 6 मिनट वॉक टेस्ट भी अच्छा इम्प्रूव हुआ, जहाँ पे मुझे वो कॉन्फिडेंस मिला. और फिर मैंने सेकेंड एक्सरे निकाला, वो एक्सरे में हाफ ऑफ द लोब इट वाज इम्प्रूव्ड, एंड देयर आफ्टर द सेकेंड सिटिंग्स पिपली रसायन का मैंने यूज किया, जहाँ से सेकेंड एक्सरे में आने के बाद में उसमें जो एफ्यूजन लेवल काफी कम हुआ, और सैचुरेशन अभी पेशेंट का 98-99 रहता है. पेशेंट आराम से अपनी डे टू डे एक्टिविटीज कर सकता है. बिफोर दी ट्रीटमेंट पेशेंट वाज अनेबल टू लाई डाउन ऑन लेफ्ट लैटरल पोजीशन बिकॉज ऑफ एक्यूमुलेशन ऑफ फ्लूइड. तो उसके लाइफस्टाइल काफी कुछ डिस्टर्ब थे, जो आफ्टर ट्रीटमेंट बहुत उसको हेल्प हुई, और अभी वो पेशेंट मेरा काफी अच्छी लाइफस्टाइल जी सकता है, अच्छे तरीके से वो अपने लाइफ को लीड कर रहे हैं. तो उसमें हमने एक पिपली रसायन का सबसे इम्पोर्टेंट एक इम्पोर्टेंस देखा ट्रीटमेंट का, और साथ ही साथ में जो CHF पेशेंट में था वो क्रोनिक हार्ट फेलियर के कंडीशन आने का रीजन उसका MI, उसमें CAD का होना, ये सभी चीजें थी. उसका ब्लड प्रेशर को लॉन्ग टाइम तक नेग्लेक्ट करना, जिसकी वजह से वो पेशेंट एक CHF कंडीशन में गया, और उसको ट्रीट करने के लिए फिर हमने जो प्रिंसिपल हमारे माधवबाग में हम इस्तेमाल करते हैं मेथोडोलॉजी, दैट इज सेंट्रीपिटल ओलेशन, थर्मल वैसोडाइलेटेशन एंड थोरेसिक ड्रिप पर रेक्टल ड्रग एडमिनिस्ट्रेशन. एज मेरे कॉलीग ने अभी जस्ट इसके पहले ही एक्सप्लेन किया कि कैसे सेंट्रीपिटल ओलेशन ये इम्प्रूव करता है आपके सेंट्रीपिटल सर्कुलेशन को. तो आपके मायोकार्डिक मसल्स को अच्छी तरीके से सर्कुलेशन मिलने में मदद करता है. थर्मल वैसोडाइलेशन अगेन आपकी ब्लड वेसल्स के वैसोडाइलेशन में हेल्प करता है, जो आपके ब्लड फ्लो में आपको, या आपका जो वॉल्यूम है, वॉल्यूम ऑफ ब्लड है, वो ओवर फ्लूइड जो होता है वॉल्यूम में, वो रिड्यूस करने में मदद करता है. थोरेसिक ड्रिप कैसे आपके लंग्स के एक्सपेंशन को हेल्प करता है, सो दैट कि आपका मैक्सिमम ऑक्सीजन कैरिंग कैपेसिटी बढ़े। साथ ही साथ पर रेक्टल ड्रग एडमिनिस्ट्रेशन, जैसे मेरे कोलिग ने वहाँ पे इस्तेमाल किया कि उसके जो हम लोग औषध इस्तेमाल करते हैं वो हमारे हार्ट के कार्डियक कॉन्ट्रैक्टिबिलिटी को इम्प्रूव करने के लिए मदद करता है। तो इन सब चीजों की मदद से वो पेशेंट का CHF ट्रीट हुआ। और
लास्ट 2 मिनट्स डॉक्टर।
ये CHF होने की जो सीक्वेंसेस हैं वो कहीं ना कहीं जो कॉजेज होते हैं पेशेंट्स के, कार्डियोमायोपैथी, हार्ट वॉल डिजीजेज होती है, लाइफस्टाइल डिसऑर्डर लाइक डायबिटीज, ओबेसिटी, हाई ब्लड प्रेशर और हार्ट अटैक। सिमिलर ये सभी चीजें हमारे कहीं ना कहीं हार्ट को की मसल्स को वीक करते हैं, जो उनकी पंपिंग, जो कार्डियक कॉन्ट्रैक्टिबिलिटी है को है उसको डिस्टर्ब करता है, और जिसकी वजह से हमारा स्लोली पेशेंट का इजेक्शन फ्रैक्शन कम हो जाता है और वो पेशेंट एक हार्ट फेलियर कंडीशन में लैंड अप करता है। तो द कंक्लूजन ऑफ दिस ये केस में ये था कि हार्ट फेलियर रिवर्सल प्रोग्राम में हम हार्ट फेलियर रिवर्सल प्रोग्राम का भी, यानी HFRT का एक आयुर्वेद बेस्ड जो ट्रीटमेंट था उसका, साथ में एक पिपली रसायन जो एक आयुर्वेदिक हर्बल मेडिसिन का भी इस्तेमाल करते हुए ये पेशेंट के प्लूरल एफ्यूजन एज वेल एज पेरिकार्डियल एफ्यूजन दोनों को ही सक्सेसफुली ट्रीट किया गया, सो दैट कि वो पेशेंट का जो फ्यूचर है, लाइफ है, वो काफी अच्छी, गुड क्वालिटी ऑफ लाइफ कैन बी एक्सपेक्टेड। सो दिस वाज माय केस। थैंक यू।
Nice presentation, Dr. Amirullah Siddiqui. I have a question before I give it to Dr. Rahul and Dr. Praveen, because this was one case wherein the pre and post ejection fraction of the patient was similar, right? So the LVEF was 25% prior to your treatment, and LVEF was the same 25% even after reduction of fluid in the pericardial cavity, right? So now tell me one thing, sir, whether this patient is improved, is yet to improve, is taking treatment, or has his treatment been completed? What is the exact scenario?
She is on treatment.
Okay, the treatment is still going on.
Yes, sir. Still her 4 to 5 treatments are still pending.
Fine. Over to you, Praveen sir.
डॉक्टर आमिर,
Yes, sir.
आपने जो पिपली रसायन दिया था उसमें वो क्या क्वांटिटी में दिया? वो वर्धमान पिपली रसायन था क्या? कैसे प्लान आउट किया?
यस सर, वर्धमान पिपली रसायन में मैं पेशेंट को 1 से 7 दिन तक, पहले दिन 1 पिपली और 1 कप दूध और 1 कप पानी का शीरपाक फॉर्म करके ऐसे डे 1 से लेके डे 7 तक इंक्रीजिंग ऑर्डर में लेके गए, और फिर वापिस साथ ही साथ डिक्रीजिंग ऑर्डर में हम वापिस 1 पे लेके आए। ऐसा 2 सिटिंग्स मैंने वो पेशेंट्स के लिए इस्तेमाल किया।
ओके, एनी पैथोलॉजी आइडेंटिफाई करने के लिए कुछ पैथोलॉजिकल इन्वेस्टिगेशन?
यस सर,
सीबीसी या फिर इन्फेक्टिव पैथोलॉजी रूल आउट की गई थी क्या?
जी सर, बिफोर गोइंग कि ये प्लूरल एफ्यूजन है कि नहीं है, इसको कंफर्म करने के लिए मैंने पेशेंट का कोविड टेस्ट भी कराया था, और हिस्ट्री में ट्यूबरकुलोसिस वगैरह कुछ है या नहीं है वो भी पूछा, और फिर ट्यूबरकुलोसिस के लिए भी PTV टेस्ट भी कराया था। तो वो भी नॉर्मल था, नेगेटिव था, उसके बाद ही मैंने ये प्रोसीजर शुरू किया।
ओके, थैंक यू।
यस राहुल सर, योर व्यूज।
डॉक्टर आमिर, कॉन्ग्रेचुलेशन। बहुत यानी क्रिटिकल कंडीशन में भी आयुर्वेदा कैन हेल्प, ये आप दिखा रहे हो आपके केस में से। इट्स अ वंडरफुल थिंग। बट बिफोर गोइंग अहेड, जैसे डॉक्टर प्रवीण सर ने भी आपसे पूछा कि whether you have done any pathological investigation just to rule out other pathologies, first of all. Secondly, what I heard, while using Pippali Rasayan, have you seen any weight gain in your patient?
Not much, sir. Almost 500 to 600 grams बस इतना।
Because every day you suggested patient to take a milk also, right?
Right.
Okay. And along with the Pippali Rasayan, you advise your patient for HFRT, that this is the Panchakarma therapy. In the Panchakarma, you advise patient to take that Arjuna decoction.
Yes, sir. Yes, sir. Right.
So, how to identify whether the results are only because of the Pippali Rasayan, or results are maybe because of that Arjuna decoction also?
सबसे पहला चीज जो मेरे दिमाग में था सर उस टाइम पे कि अगर पेरिकार्डियल एफ्यूजन है तो यूजुअल जो नॉर्मल पेरिकार्डियम में फ्री फ्लूइड होता है वो 2 to 4 ml 5 ml होना चाहिए यूजुअली। और अगर पेशेंट को सैचुरेशन कम हो रहा है तो ये कहीं ना कहीं कार्डियक के बाहर लंग्स की पैथोलॉजी भी है। तो मुझे वो लगा कि पहले मुझे फ्लूइड जो ओवरलोड है, अगर मैं कार्डियक का फ्लूइड ओवरलोड कम कर पाऊंगा तभी मैं कार्डियक कैपेसिटी को इम्प्रूव कर सकता हूँ। तो मुझे जो मेरा कॉन्फिडेंट लगा कि अगर एफ्यूजन रिड्यूस होगा तो मेरे पिपली रसायन से एफ्यूजन रिड्यूस होगा, और वही मेरा कंक्लूजन था।
At the end, if patient has get a good relief from your treatment, so
Yes, sir.
it's all good, and all the best for your future clinical practice.
Thank you, sir.
Yes, Dr. Amir, we have a couple of questions. What type of diet was prescribed along with Pippali Rasayan?
बेसिकली ये केस में मैंने पेशेंट को बटर मिल्क और मूंग से बने हुए पदार्थ इस्तेमाल करने वाले थे। मूंग की खिचड़ी या फिर थोड़ा दूध का भी इस्तेमाल हमने किया है कहीं ना कहीं। बटर मिल्क और मूंग डाइट पे मैंने ज्यादा रखा कॉन्सेंट्रेट।
ओके। और पिप्पली रसायन का समय क्या था? व्हाट वाज द टाइम ऑफ पिप्पली रसायन?
7 days इंक्रीजिंग और 7 days डिक्रीजिंग ऑर्डर।
ओके। And was it a unilateral or bilateral effusion? This is the question asked by one of my doctors.
So unilateral effusion था।
Okay, fine. Super presentation, Dr. Amir.
Thank you.
And we will like to see even better results in this patient. We want to improve that LVA function to normal.
Surely, sir, we will do it. Surely.
Without relapse.
So now we move on to Dr. Aarti Badre. And Dr. Aarti Badre madam will be presenting her topic.
Screen share karo.
Yes, now you're audible, ma'am. The topic is comparative study of reverse and Swasthyam diet box with respect to lipid parameters.
So is the screen visible?
No, ma'am. In fact, your video is also not visible now.
You need to share your PPT.
Rahul sir, do you have the presentation of Dr. Aarti that you can share it from your end?
Yeah.
Dr. Aarti, now screen is visible.
Yes. Okay, sir.
Keep your phone on landscape mode. Yes. Thank you.
Yes, doctor, it's visible now. We have 8 minutes.
Sorry for the inconvenience. Yeah. Sorry for the inconvenience caused this morning. Good afternoon, Dr. Praveen sir, Dr. Rahul sir, Dr. Omkar sir, my fellow friends. I am Dr. Aarti Badre, Clinic Head of Andheri West, along with Compliance Doctor, Dr. Shweta Rajadeksha. The topic of my today's presentation is comparative study of diet kit in dyslipidemia, a single case study. As we know, lipids are organic compounds that are fatty acids and insoluble in water, stored in the adipose tissue. And the metabolism of lipids is associated with carbohydrate metabolism, as glucose are converted into lipids later on. Since lipids are insoluble in water, lipids are carried from the intestine into the bloodstream by lipoproteins, which are soluble in water like HDL, LDL, etc. So what are apolipoproteins? Apolipoproteins in the cholesterol and triglycerides cannot circulate loosely in the blood, so the liver packages them into parcels called as lipoproteins. The lipoproteins are then released into the blood and carried around the body to wherever they are needed. So apolipoprotein A is a protein component of HDL. Apolipoprotein B is the main apolipoprotein of chylomicrons and LDL. High levels are related to heart disease. Lipoproteins, as we know, are of four types: chylomicrons, which carry the fats from the intestine to the adipose tissue, liver, and the skeletal muscles. VLDL carry fats from the liver to the adipose tissues. LDL carries fats from the liver to the viscera, and HDL, which works on the reverse cholesterol mechanism, and it carries from the viscera to the liver. So these are the lipoproteins, and specifically, I would specify on the apolipoproteins, which are components of the lipoprotein. Again, lipoprotein A is another factor. It's a LDL particle, which is a combination of both apolipoprotein A and apolipoprotein B. It is significant as very high levels of apolipoprotein A are related to heart disease risk, as they are bound with phospholipids, apoproteins from lipoprotein particles into which different lipids can be packed. The importance of lipid in organism. Lipids perform three primary biological functions, as they serve as structural components of the cell membrane, function as energy storehouses as they release the energy, produces different types of hormones, transport fat-soluble nutrients, phytochemicals, and so on. Triglycerides control the internal climate with the goal to maintain the body's temperature. Now, my objective today's presentation was to evaluate the role of diet boxes in lipid metabolism without taking aid of Panchakarma. Also, to compare the outcome of two different diet boxes on lipid parameters in a single patient. So, it's a single case study. The patient had come to me he was a male patient, 43 years old, suffering from hyperlipidemia. In his past history, he had his excision of benign craniopharyngioma, later for which he was on Thyronorm 50 mcg for few years, which was tapered as his thyroid levels were quite normal. In September 2021, he was diagnosed with hyperlipidemia. He was advised by the cardiologist to do some dietary changes, exercise, which showed little improvement as he was not guided properly. But in January 2022, he had a symptom of chest pain for which he had done his ECG, but it didn't show any significant changes except for left axis deviation. When the patient came to me, he had burps, hiccups, throat dryness. On examination, ECG was normal. Rest of the parameters were also normal. His blood investigation showed hyperlipidemia levels. Meanwhile, he had, due to the chest pain, he had already gone to a cardiologist, and he was suggested medicine, niacin NF 500 and Rosuva's 21. Statins inhibit COA in endogenous cholesterol biosynthesis, and thereby they reduce the blood cholesterol levels. So he was suggested the same. The patient was a very high profile patient, and he had come because his dad was with taking treatment with us for other disease like that of diabetes. So he was aware of Ayurvedic treatment in the form of Panchakarma and diet that we generally give. But he was very specific that he didn't want Panchakarma, and he wanted to focus mostly with Ayurvedic diet and medicine. The diagnosis after was as hyperlipidemia. Uh, According to Ayurveda, it could be termed as Santarpanjanya Vyadhi. So accordingly, I planned his treatment in the form of diet because his BMI was also on a little higher side. And considering the lipids, we already advise patients in CAD patients reverse diet box, and in obesity patients Swastham diet box, which are known to reduce the lipid levels in both the cases. So my way of treatment was that I wanted to compare the results of both. So I gave one diet box in 1 month and the second diet box in second month, along with Ayurvedic medicine, Manjidam, H8, Lipox, and Vincol. They also assist for the lipid metabolism. Considering it as a Santarpanjanya Vadi, Apatarpan in the form of diet restriction, I will explain you later how the diet boxes work. So little Apatarpan and Sadhyo Virechan was carried out in the patient. Investigations advice were lipid profile after each diet box.
Last 2 minutes, ma'am.
So coming to the Swastham diet box, it is a 1,000 calorie diet, low carbohydrates, moderate protein, high antioxidant capacity. We have nutshelled it in various herbs in it, which help for the dyslipidemia. Along with that, uh, fibers take a major role in Swastham diet box.
Come to the
The
discussion
soluble
point.
fibers.
Dr.
Sorry.
Aarti, come to the discussion.
Yeah.
Dr.
Yeah,
Aarti,
soluble fibers in the form of carrot soup assist, and insoluble fibers in the form of flax seeds and are going to assist in the lipid metabolism. In case of reverse diet box, 1,000 calories again, but the ORAC value is going to assist the patient for the treatment, along with the vitamin C, as both reduce the lipid oxidation, inflammation, and hence these two were used. When assessed the parameters, the BMI was reduced. Swastham reduced the weight by 2.6 and reversed by 2 kgs. And as we can see, the various investigations that we included in his were included the apolipoproteins levels also, which showed marked difference. So after discussion, we can come that both are equally helpful in reducing the lipid levels. Also, instead of statins, diet kit can be used, as statins treatment is costly, and also it is associated with long-term side effects, and chances of discontinuation are there. LDL reduction is sometimes not achieved also with monotherapy. Another is diet box can be prescribed to all those who are not comfortable with panchakarma, and also in emerging youngsters who are not in exactly disease pathology but have mild to moderate lipid increasing in their uh, parameters. In this patient, tolerance towards swastham was better than reverse. So a larger group of patients would be required to assess this, and I would also like to focus more on these apoprotein levels, as because apoprotein B is a single molecule in each B lipoproteins. So sometimes small dense LDL particles can result in lower concentration of LDL, but are relatively more atherogenic than the dense ones. So apolipoprotein B can be a better marker to assess. Also, lipoprotein A is the one who initiates HDL for the reverse pathology. So I would like to focus on this also. So conclusion is that both the diet boxes play equivalent role in lipid metabolism, and I would also ask our senior management if Swastham also can be used for CAD management program, and if we can throw more light on the apolipoproteins and forward, so that we can reverse the pathology right from the beginning itself. Thank you, sir.
Thank you, Dr. Arti. Rahul sir, your comments on this.
Dr. Arti, thanks a lot. Nice presentation, especially the points that you have raised. The use of high ORAC diet, rather using only high ORAC diet in dyslipidemia condition by using just low carb and moderate protein diet can be useful in a condition with a dyslipidemia, right? This is what your point was,
Yes.
right? So in a nutshell, as many of the doctors, they are not familiar to the language of S diet or R diet. I just tried to make it simple. The diet normally, doctors from Madhavbaug, they prescribe to patient with a CAD or ischemic heart disease is having a high ORAC value. It's high in antioxidant, and for the obesity management, it's just a low carb with a moderate protein diet. We normally advise in a very specific packaging size, and we call it as a diet box. Okay, in every diet box was a percentage of fat. What is the percentage of fat? Okay, overall, it's with each diet box, the percentage of fat is different. Dr. Bhushan Sonawne, as the link mentioned earlier, we have planned to teach the principles of diet that have been mentioned in Ayurveda. Dr. Gurutta sir is going to teach each and every Ayurveda students. So I request you also to get subscribed to that link. So definitely you will get all the details, what diet we prescribe in what condition. So coming to your presentation, Dr. Arti, nice presentation. The points that you have mentioned in your presentation are well taken, and keep it up and all the best. Over to Dr. Praveen sir.
यस, नाइस प्रेजेंटेशन डॉक्टर आरती. यहाँ पे आपने जो कंपैरेटिव स्टडी करने की कोशिश की है, इसमें अगर दो अलग अलग पेशेंट होते तो और ज्यादा हम इसमें आउटपुट लेके आ सकते थे, क्योंकि जो इनिशियल फर्स्ट मंथ अगर स्वास्थ्यम दिया है तो जो फर्स्ट मंथ में जो कुछ फिजियोलॉजिकल चेंजेस बॉडी में हुए उसके बाद रिवर्स डाइट किया जाता है. तो थोड़ा सा इफिकेसी फाइंड आउट करने के लिए ये डिफिकल्ट हो सकता है. तो अगर हम कंपेयर कर रहे हैं रिवर्स और स्वास्थ्यम को, या फिर हाई ओरैक डाइट को और लो कार्ब हाई फाइबर डाइट के साथ अगर कंपेयर कर रहे तो डिफरेंट दो पेशेंट होते तो ज्यादा बेटर होता. ओके, यस, थैंक यू.
Thank you,
Dr. Arti, it was a fantastic presentation. Thank you. Now we move on to our next presenter, Dr. Krishna Kumar Yadav, and his topic of presentation today is effect of IRP treatment on ischemic heart disease. Over to you, Dr. Krishna Kumar. You can share your screen. You have 8 minutes of time.
Okay.
Meanwhile, Dr. Krishna Kumar is presenting his screen. Sir, there are some questions. Praveen sir, if you can answer this. In pericardial and pleural effusion case, isn't it contradictory to apply sneha when it's clay the pradhan avastha?
यहाँ पे सामावस्था और निरामावस्था जो सिम्टम्स है पेशेंट के अकॉर्डिंगली हमें एक्ट करना पड़ेगा. ऑयल का एप्लीकेशन प्लूरल इफ्यूजन और क्लेद अंदर है, इसको पकड़ के हम अवॉइड नहीं कर सकते. अगर पेशेंट में सामावस्था है और सामावस्था के जो कुछ सिम्टम्स आयुर्वेद में कहा गए हैं, अंग गौरव है, आलस्य है, ऐसे अगर सिम्टम्स है तो आमपाचन तक हम ऑयल नहीं यूज कर सकते. उस कंडीशन में कुछ सिम्टम्स या कुछ प्रॉब्लम दिखाई दे सकता है. रेस्ट अगर निरामावस्था है तो जहां तक मेरा ऑब्जर्वेशन है कि ऑयल एप्लीकेशन से कुछ दिक्कत नहीं होती है.
थैंक यू प्रवीण सर.
100% agree with Dr. Praveen sir what he is trying to say. Ki unnecessary, many of time what we do, we correlate the allopathic diseases with the Ayurveda concept of Vata, Pitta and Kapha. So it's always better to assess your patient with the Ayurveda concept only. If, as Dr. Praveen sir has rightly said, if there is a Niram Avastha, go with the Gruta or the Sneha. If there is a Sam Avastha, do the Deepan Pachan and then go for the Sneha. So, regardless of what clinical condition or what diagnosis is there as per the allopathy, the other clinical assessment we have to do as per the Ayurveda. The common sense that what our Acharya has given to us, we should use that, right? So there is no need of unnecessary correlation with all the disease and Ayurveda points.
Fine. Thank you, both
Hi,
the
doctor.
chairpersons. Now, Dr. Krishna Kumar, you can start with your presentation. You have 8 minutes of time.
Okay, sir, I am audible?
Yes.
Perfectly audible, sir.
Okay, sir. Okay, good afternoon all. Today my topic is effect of Ayurveda-based Panchkarma on ischemic heart disease. Myself, Dr. Sri Krishna Kumar Yadav, Clinic Head, Daisarist Clinic, Madhavbaug. A title, The Role of Ayurveda-based Panchkarma in Management of Ischemic Heart Disease. The background, despite a progressive decline in death rate from ICD due to improved treatment strategy and preventive measure, 1 of 6 death. The clinical syndrome of ICD caused more death, morbidity, and financial burden. The many suffer from ICD and estimated annual incidence. It's more, and myocardial infarction also increases. Aim and objective. The present study was designed to evaluate effect of herbal procedure like Panchkarma and allied therapies as add-on the standard in ischemic heart disease patient. Understanding ICD, normally our heart requires 225 ml of blood every minute. When we start exertion, demand increases. When on exertion, the demand not enough, it's called ischemia. The methodology which we use is ischemic heart disease reversal. The ischemic reversal program considered 3 main core procedures: centripetal oleation, thermovascularization, and per rectal drug administration. Centripetal oleation is done with the L-abhyang oil, which improves the elasticity of the blood vessel, reduce peripheral resistance, and improve cardiac and reduce the cardiac overload. Thermovascularization excrete extra overload from salt and water. And per rectal drug, which is done with the Gokshur, Haridra, and Amlaki. Gokshur is a very good diuretic. It's help in NO production. It's anti-inflammatory and antiplasmatic in nature. The case which I taken is 3 cases: case A, case B, and case C. The case A with the history of MI, CAD, HTN, and DM, and IHD and CHF. Case B, DM, CHF, IHD. Case C with DM, HTN, CAD, IHD, CH, and PTCA done. These three cases are different. The first case, the patient have a history of MI, have a history of CAD, but not done a PTCA. Second case, have a history of CHF, IHD, and DM, but not have a MI. And third case, have a MI, CAD, and done with the PTCA. The complaint: dyspnea on exertion, chest heaviness, abdominal fullness, pedal edema. Case A, case B, chest pain, on and off lower limb swelling. Case C, swelling over lower limbs, tingling and numbness, disturbed sleep, chest discomfort on exertion. The result in weight change we found in case A, the 120 to weight reduction 97.2. In case B, 96 to 88. In case C, 53 to 54. BMI reduction 39 to 31. In case B, 34 to 31. In case 2, case 3, 22 to 23. The VO2 max improvement we can see over here, 12.95 to 26.95. In case B, 15.4 to 28.7. In case C, 16.2 to 28.7. The Duke score changes we can say here. The in case 1, minus 2.42, it increased 9.25. In case B, it from minus 0.22 is increased 10. In case 3, 0.582 it increased 9.37. Factor responsible for the condition: the blood demand increase to heart in case where heart rate increases, blood pressure increases, enlarged heart, and loss of elasticity of artery. And supply reduces in case of endothelium dysfunction, thickening of artery, increased blood viscosity, and spasm of blood vessels. The conclusion: the ischemia reversal program improves the Duke score, which improves reverse the IHD. Thank you.
Super presentation, Dr. Sri Krishna Kumar, in very super speed too. So very nice. Good. Yes, I will request Praveen sir to please share your views on this presentation.
Yes, Dr. Krishna Kumar, very nice presentation, and you show in your presentation that ischemia reversal program includes panchakarma, which helps ischemic heart disease patient to increase their VO2 max and Duke treadmill score. Duke treadmill score is a crucial parameter which indicates the mortality of heart patients. So in your case, you increases your patient's DTS score, which is a commendable job. Hats off. Thank you very much.
Yes, Rahul sir, your views on this, please.
Yes, excellent presentation, Dr. Sri Krishna Yadav. Specifically, I have a question that in the Snehan part, you used some L-Abhyanga oil. What exactly the L-Abhyanga oil is?
Sir, L is a lavender oil, which is used with the tilatel. It is very helpful to reduce the sympathetic tone and release the anxiety level of patient.
Okay, so it has a specific action.
Yes.
And what product you used in your Kada, Basti Kada? Because there is one question from the audience also.
The GHA Kada, the Gokshur, Haridra, and Amlaki. So okay. Gokshur is very useful for as a diuretic, and it's very useful in production of NO, external or naturally is produced. And Amlaki is very good for endothelium health, and Haridra is very good in anti-inflammatory action.
Okay, good. So overall, nice presentation, Dr. Krishna Kumar Yadav, and all the best for the future.
Thank you, sir.
From this point of view, I will like to let know all the doctors who have joined this symposium who are not part of Madhavbaug as of now. Now, yesterday around 22 doctors presented, today around 5 doctors have presented till now. And you can see the parametric improvement which all the doctors have tried to show in their presentations. And we do have different set of parameters for all different various diseases. So this is something which Madhavbaug doctors are doing efficiently since many years now. And if anybody of you, any doctor outside Madhavbaug wants to be the associate of Madhavbaug, there is a link present in the chat box. If you want to be a diabetes reversal expert, definitely you can click the link and share your details. Our correspondent, Saurabh Kulkarni, can help you out to know what exactly that associate program is for. So now we'll move on to the next presenter, Dr. Vaidehi Revankar from Borivali East. And her topic is quite different. It's COVID-19 and overview and insight. Is Dr. Vaidehi? Welcome. Good afternoon. You have 8 minutes of time.
Good afternoon, sir.
Yes, you are perfectly audible, ma'am. You can share your screen and start your presentation. Started with a thank you. Right, so this is a new topic, not discussed yesterday, not even today. Best wishes, doctor.
Thank you, sir.
Yes, you can start now.
Hello, everyone. So it was very obvious for me to present a COVID data study since we have been all affected since last 1.5 years. Myself, Dr. Vaidehi Revankar, clinic head for Madhavbaug Borivali East, will be presenting a topic on COVID-19 overview and Ayurveda intervention. Practicing clinical cardiology, where COVID was affecting comorbidities like hypertension, diabetes, obesity, effect of Ayurveda on such set of patients was objective of my presentation. A meta-analysis showed that a patient with history of cardiovascular disease had tripled the odds to 95% to the severe course of this disease, which was defined as death. Thus, the aim of my presentation was to understand the research related to COVID-19 and role of Ayurveda in COVID-19 management. A 64 patient data was collected from the period of September 2020 to February 2022 at Madhavbaug, Borivali East for a age criteria of 23 to 85 years. Though some small yet significant changes were observed through this data. Age group of 46 to 65 had more number of COVID infected patients, where male dominated the gender type. Renin-angiotensin system imbalance that favors the pro-inflammatory stage is the core of COVID-19 pathophysiologic mechanism, might be one of the reasons due to which the HTN comorbidity had a greater number for my clinic. It was good to know that lesser patients were hospitalized. LOH, that is length of hospitalization, out of 23 hospitalized patients, 22 patients were divided according to their LOH category. 17 patients were admitted for 7 to 14 days. Further getting deeper, it was observed these 13 patients who were hospitalized were then again divided according to their mild, moderate, and severe CT score. Only 2 patients had severe CT score. Also, these 13 patients, 9 patients required plain O2 management, while 3 were shifted to ICU management. Understanding this outcome, Ayurveda management in COVID was the main thought behind this presentation. Ayurvedic boosting medicines, exercise, strong follow-ups, and diet modification played a major role in management of COVID-19 at my clinic. The first herb which was used was Gudilex. Guduchi in Gudilex, played by its name as Amruta during COVID-19. Guduchi of all its content acted as a Jwara herb during this period. It also helped in Amapachana, increasing Agni, then increasing Dhatwagni, thus acting as an immunomodulator, was favorite choice of drug for me during this time. Vidanga in Gudilex, which was 46 milligram present, also acted as a Krumihar. The next drug was SMP Churna, which is also known as Trikatu, though used very routinely, played an extraordinary effect during this time. Shunthi, which was also suggested by Ayush guidelines, acted as a potent Jwaragna in it. Marich acted as a Krumihar and churned out the kapha through the system. Pipli acted as a Kasahar and strengthened the Shwasan Sanstha. Overall, all these 3 medicines acted as a very good bioenhancer. The third drug which was used was Madhavprash. Rasayan has its own importance in Ayurveda. Rasayan Chikitsa has its own importance in Ayurveda. It falls under the Swasthya Urjaskar Chikitsa. Rasayan drugs or Rasayan herbs helps to improve Ayu or Bal, that is strength and immunity. Amla was the first herb which came to my mind while talking about immunity. Madhavprash is a modified version of a Chavanprash. Also, it is sugar-free and has 44 precious herbs. Regular Chavanprash has 34 milligram of vitamin C per 100 gram. Fresh Amla has 450 milligram of vitamin C, whereas Madhavprash has 3000 milligram of vitamin C per 100 gram, which played its major role in improving the immunity. These were the drugs used for the COVID management through me during this period. Moving further, for exercise, it was the physical inactivity was the major hurdle which was tackled through yoga, pranayam, and exercise during this period. And evidence has suggested combination of pranayam and Surya Namaskar helps in increasing volume of breath. Also, incentive spirometer as an exercise helps to reduce respiratory distress syndrome. Another study has told us that people during COVID invested more on health and mental well-being. So, live exercise sessions through MIB Pulse app twice a day helped me or made me easier to prescribe exercise to patient during this period. Also, keeping patients engaged through various activities like diet competition, yoga competition, disease awareness webinars, nantar updating vitals help me to maintain and improve the quality of life of these patients. So the outcome from above process showed the following result. Out of 21 home quarantine patients, the saturation was improved from 96 to 98%. The taste and smell function of the patient got improved, and heart rate was maintained below 90. Also, same line of treatment was used on post-hospitalized patients, and the count was 8. The saturation was maintained from 97 to 98. These patients were observed for 14 days. 4 patients developed complication post-hospitalization, out of which 3 were managed at clinic level. Though my data has different numbers in various categories, 0 was the outcome of the death out of all 64 patients. So we can now say that the herbal medicines and immunity building medicines which were used helped me to break the Jwara Samprapti by doing Am Pachan, increasing Agni, then increasing Dhatu, which helped me to improve OJ and immunity, whereas yoga, exercise, and meditation help me to reduce inflammation, psychological stress, and it improved oxygen saturation and lung oxygen capacity. So thus I conclude that herbal medicines help me in reducing jwara, improving immunity, exercise, meditation, and follow-up help me in improvement of OJ and reducing complications. Overall, I want to share some few insights which I have learned through the entire study. First is Ayurveda intervention in each and every aspect has become now very relevant. Poor metabolic health condition is the main cause of all risk factors.
Last 2 minutes, ma'am.
Healthy lifestyle will lower the risk factor and is the only retainable source, and technology updation is must. Thank you.
Very nice presentation, Dr. Vaidehi. Yes, Rahul sir, your comments on this, please.
Very noble topic, Dr. Vaidehi, and excellent presentation. You took a very different topic and yet you presented it very well. The most important fact that you have shown that just by improving a good immunity, we can improve the survival of your patient in epidemic, in such a viral epidemic also. So very nice. You make us proud that you manage so many of your patient with all the engagement tools which we have provided, and you help your patient to fight through all this epidemic. And congratulations that you have a 0 mortality. So superb. The only question that I'm having, all the patients, those who were treated with your immunity program, what was their other pathological conditions? Like what was their VO2 peak? What was their HbA1c? What was their lipid levels? What was their CAD status? So the other complications, if you have added those complications, because for example, if you have reduced down their HbA1c, if you have improved their VO2 max before before this epidemic has started, so that might be the add-on points to your presentation. But at the end of what I'll suggest, you have took a courageous topic to discuss here, and super presentation. All the best, Dr. Vaidya.
Thank you, sir.
Yes, good topic, Dr. Vaidehi. यहाँ पे सिर्फ मुझे एक सवाल पूछना है कि ये जो इम्यूनिटी बूस्टर मेडिसिन आपने जो प्रिस्क्राइब किए थे, ये कोविड होने से पहले ही उनको स्टार्ट किए थे या कोविड के सिम्टम्स आने के बाद प्रिस्क्राइब किए हैं?
नॉर्मली जो डेटा लिया गया है वो सितंबर 2020 से लिया गया है. इट वाज लाइक जब मार्च में वी केम टू न्यू अबाउट कोविड. फ्रॉम मार्च टू सितंबर इट वाज वेरी अप एंड डाउन पोजीशन की क्या कैसे आगे प्रोसेस करना है. तो टिल सितंबर वी हैड अ वेरी स्ट्रॉन्ग थॉट प्रोसेस कि कैसे कैसे ट्रीट करना है. सो आफ्टर people were diagnosed with COVID, after allopathy line of management, we were able to set our line of treatment. And since patients were not able to come to the clinic, medicines were delivered to their home through various sources. So it was post diagnosis of COVID. कारण का म्हणजे जैसे जैसे अपडेट्स आ रहे थे वैसे वैसे फिर वो मेडिसिन प्रोवाइड कर रहे थे. एक 6 मंथ्स के बाद, सितंबर के 6 मंथ्स के बाद नॉर्मली सब पेशेंट को फिर ये दिया जा रहा था. एटलीस्ट उसके फर्स्ट 2 या जिनमें रसायन ज्यादा रिक्वायर्ड था उनमें रसायन का मेडिसिन प्रोवाइड किया जा रहा था. जिनको हेवी कोमोर्बिडिटीज थे उनको तीनों मेडिसिन प्रोवाइड किया जा रहा था. सो इट वाज डिपेंडेंट कि क्या पेशेंट बोलने वाला है. सो पोस्ट 6 मंथ्स सब मेडिसिन स्टार्टिंग में ही दिए जा रहे थे.
तो ऐसा कुछ ऑब्जर्वेशन है क्या कि जो ऑलरेडी रसायन या इम्यूनिटी बूस्टर मेडिसिन पे थे उनके घर में बाकी घर वालों को कोविड हुआ और उनको कोविड नहीं हुआ, ऐसे कुछ ऑब्जर्वेशन है?
ऐसे काफी ऑब्जर्वेशंस थे कि अभी ये जो 64 पेशेंट का डेटा था ये सारे कोमॉर्बिड पेशेंट थे. म्हणजे 64 which were selected all were comorbid patient. Still they had no or zero death rate. जिस टाइम पेशेंट हम लोग को फोन करके बोलता था कि कोविड जैसे सिम्टम्स दिख रहे हैं, दैट टाइम आई यूज्ड टू आस्क कि उनके फैमिली में किसको किसको हुआ है एंड देयर एज क्राइटेरिया कि पेरेंट्स है या उनके बच्चे हैं. तो उनमें पेशेंट्स को सिम्टम्स दिखते थे पर आरटीपीसीआर कभी कभी नेगेटिव आते थे. तो यही एक पेशेंट था जिनको नहीं भी हुआ है. सिर्फ आई हैव नॉट मेड अ प्रॉपर डेटा कि कितने पेशेंट ने मुझे बोला था कि फैमिली में है और मुझे नहीं है. पर इट वाज वेरी ऑब्वियस कि पेशेंट हैव अप्रिशिएटेड अस और द माधवबाग और आवर ट्रीटमेंट की दे वर हैप्पी कि ये मेडिसिन लेके दे आर ऑलरेडी विथ गुड इम्यूनिटी. व्हेन दे यूज्ड टू आस्क मी कि मैडम क्या लेना चाहिए इम्यूनिटी के लिए, तो आई यूज्ड टू टेल देम कि हम लोग आपको ऑलरेडी दे रहे, आपके मेडिसिन जो है बाकी के उसमें आप ऑलरेडी ले रहे हो. सो दे वर एट अ रिलीफ कि उनको साइड बाय साइड ये भी थॉट या तो ये भी कॉन्सेप्ट उनका ध्यान में रखा गया था.
यस, थैंक यू.
यस, राहुल सर. Unmute, sir.
I think we should move to next present.
Yes, there is a question in the chat box. It's a very interesting question, Dr. Vaidehi, for you. Would you like to comment on immunity against COVID-19 gained with Ayurvedic medicine versus immunity gained by COVID vaccine, based on your clinical practice and observation? Immunity gained with medicine versus vaccine.
Yeah, I will like to comment on it. I will be for Ayurvedic. I am for Ayurvedic medicines. I have a little bit come weightage for COVID vaccines. Since Ayurvedic medicine is part of our life, it has been classified as medicines, but there are many contents we actually use in our daily life. COVID vaccine was made. किती पण झालं तरी it was an artificial हे. So if there are natural sources which can build up your immunity, then I don't think vaccine will be more powerful if you have already building your immunity through all the natural herbs or Ayurveda text has even told us before COVID. So and end of the day, I don't म्हणजे I don't not at all agree with COVID vaccine. End may we have that solution कि we can anyways go for vaccine. But if we prior build our immunity, which has been already told to us, irrespective of any epidemic, that will be more better.
Very nice answer. Thank you, Dr. Vaidhi. It was a fantastic presentation. Now we move on to our next presenter, Dr. Ranjita Kevat from Borivali East Clinic, and her presentation topic is reducing rate of hospitalization in CHF with reduced ejection fraction. Yes, Dr. Ranjita, welcome.
Good afternoon, sir.
Yes, ma'am. You have 8 minutes of time with you. You can start with your presentation. Yes, doctor.
गुड आफ्टरनून एवरीवन. मैं डॉक्टर रंजिता केवट, बोरीवली ईस्ट की कॉम्प्लेक्स डॉक्टर, और आज जो मेरा टॉपिक ऑफ डिस्कशन है वो है रिड्यूसिंग री हॉस्पिटलाइजेशन इन क्रॉनिक हार्ट फेलियर पेशेंट. ये टॉपिक डिस्कस करने का जो मेरा मेन रीजन था वो ये था कि जैसा कि क्रॉनिक हार्ट फेलियर के केसेस बढ़ रहे हैं और उसकी वजह से हॉस्पिटलाइजेशन का रेट भी बढ़ रहा है, तो मुझे इस टॉपिक के ऊपर डिस्कस करना ही था. सेकेंडली, मैंने माधवबाग में अभी रिसेंट ही ज्वाइन किया है और मैं यहाँ पे भी क्रॉनिक हार्ट फेलियर के पेशेंट को ट्रीट कर रही हूँ. उसमें से मैंने कुछ पेशेंट्स को देखा था जो हॉस्पिटलाइज होते थे, वो आफ्टर जब वो डिस्चार्ज होकर के आते थे तो थोड़ा नेगेटिव हो जाते थे, मेंटली डिस्टर्ब हो जाते थे. और वहीं पे जब मैंने ऐसे पेशेंट्स को माधवबाग में देखा, उन्हें ट्रीट किया, तो मैंने ये पाया कि ये पेशेंट जो है मंथली प्रॉपर फॉलोअप ले रहे हैं, मेडिसिन ले रहे हैं, पंचकर्मा ले रहे हैं और ये पेशेंट बहुत ही पॉजिटिव है. तो मेरे अंदर एक क्यूरियोसिटी थी कि आखिर में हम लोग उनकी लाइफस्टाइल में ऐसा क्या चेंज कर रहे हैं, उनके अंदर ऐसा क्या पॉजिटिव पैरामीटर इनबिल्ट कर रहे हैं जिसकी वजह से ये पेशेंट माधवबाग में आने के लिए पॉजिटिव रहते हैं. तो आफ्टर सम टाइम मैंने ये पाया कि दो क्रॉनिक हार्ट फेलियर ये एक लीडिंग कॉज है हॉस्पिटलाइजेशन का, बट उसको प्रिवेंट करने में हम सक्सेस हो रहे हैं. पेशेंट को ओपीडी लेवल पे हम मैनेज कर पा रहे हैं और उनके जो कॉम्प्लिकेशंस है उनको भी हम लोग ओपीडी लेवल पे ट्रीट कर रहे हैं, जिससे उनका फाइनेंशियल बर्डन काफी कम हो रहा है. उनकी जो क्वालिटी ऑफ लाइफ है वो इम्प्रूव हो रही है, जिससे उनके मोर्टेलिटी रेट में भी हमको कमी देखने को मिली है. इन सारी चीजों को ध्यान में रख करके मैंने जो टॉपिक ऑफ डिस्कशन लिया है वो है रिड्यूसिंग री हॉस्पिटलाइजेशन इन क्रॉनिक हार्ट फेलियर पेशेंट विद पंचकर्मा and proper monitoring and compliance with follow-ups. इसका जो मेरा एम था वो ये है to evaluate the effect of panchakarma and its follow-up management to reduce the rehospitalization rate in chronic heart failure patient with low ejection fraction. टॉपिक में आगे जाने के पहले मैं क्रॉनिक हार्ट फेलियर के ऊपर थोड़ा सा डिस्कस करना चाहूंगी. क्रॉनिक हार्ट फेलियर एक ऐसी बीमारी है जिसमें हार्ट बॉडी को जितने अमाउंट में ब्लड की जरूरत होती है उतना वो प्रोवाइड नहीं कर पाता. हार्ट का इजेक्शन फ्रैक्शन कम हो जाता है, वो हार्ट की पंपिंग कैपेसिटी कम हो जाती है. और जो हम देख रहे हैं, एक रिसर्चर्स में मैंने ऐसा पाया है कि 5 में से जो एक पेशेंट है वो आगे चल करके क्रॉनिक हार्ट फेलियर में कन्वर्ट होता है. और आफ्टर 65 इयर्स ऑफ एज जो मेन कॉज है हॉस्पिटलाइजेशन का वो क्रॉनिक हार्ट फेलियर है. उसमें से भी हमने पाया है कि 5 साल के बाद 50% ऑफ पेशेंट की डेथ हो जाती है. क्रॉनिक हार्ट फेलियर एक ऐसी डिजीज है जो अदर क्रॉनिक डिजीजेस के कंपैरिजन में पेशेंट के फिजिकल, मेंटल एंड सोशल लाइफ को बहुत बुरी तरीके से इम्पैक्ट करती है. क्रॉनिक हार्ट फेलियर के जो पेशेंट है वो सोशलाइज होने से डरते हैं, डेली रूटीन की एक्टिविटी नहीं कर पाते हैं, वो फैमिली और फ्रेंड्स में इन्वॉल्व नहीं होना चाहते हैं, अपनी हॉबीज को नहीं एंजॉय कर पाते हैं, जो उनकी जो क्वालिटी ऑफ लाइफ है उसको बहुत ही बुरी तरीके से इम्पैक्ट करती है. इन सारी क्राइटेरियाज को और जो उसका इन सारी चीजों को देख करके मैंने जो मेरा क्राइटेरिया लिया है वो है मेल पेशेंट्स जिसकी एज 65 ईयर से ज्यादा थी और इजेक्शन फ्रैक्शन उनका 35% से कम था. और इसके लिए मैंने जो मेथोडोलॉजी यूज की है वो है माधवबाग की संपूर्ण हृदय शुद्धिकरण की पंचकर्मा चिकित्सा, MIB पल्स ऐप की मॉनिटरिंग प्लस पावर मैप और फॉलोअप के लिए नवजीवन केयर प्लान्स के पंचकर्मा. संपूर्ण हृदय शुद्धिकरण थेरेपी ये माधवबाग की लैंसेट जर्नल द्वारा अप्रूव्ड रिसर्च बेस्ड कॉपीराइटेड ट्रीटमेंट है, पंचकर्मा की थेरेपी है। इसमें हम लोग पेशेंट को स्नेहन, स्वेदन, हृदय धारा और बस्ती देते हैं, जिसके लिए जो हम लोग मेन कल्प यूज करते हैं वो अर्जुन है। सेकेंडली जो हम लोग डाइट यूज करते हैं वो रिसर्च बेस्ड कस्टमाइज्ड डाइट प्लान रहता है, जिससे पेशेंट की जो रिवर्सल जर्नी है वो इजी हो जाती है। इसके साथ ही साथ में मॉनिटरिंग के लिए हम लोग पावर मैप और MIB पल्स ऐप का यूज करते हैं। ये दोनों चीज पेशेंट के कंटिन्यूअस मॉनिटरिंग में हमें बहुत मदद प्रोवाइड करती है। पेशेंट के वाइटल हम लोग इजिली मेजर कर सकते हैं, उनके रिपोर्ट्स इजिली हम लोग मेजर कर सकते हैं। और इसके अलावा फॉलोअप के लिए हम लोग नवजीवन पंचकर्मा केयर प्लान ये यूज करते हैं। इसमें हमने जो पेशेंट्स को इसके पहले इम्प्रूवमेंट दी है वो इम्प्रूवमेंट सेम रह रही है या नहीं, उसमें कुछ ऊपर नीचे तो नहीं हो रहा है, उनके वाइटल स्टेबल है या नहीं, ये सारी चीजें जानने के लिए हम लोग उनको मंथली फॉलोअप देते हैं। इसमें हम लोग उनको एक पंचकर्मा करवाते हैं। ये नवजीवन के केयर प्लान 1 साल, 2 साल या 3 साल के रहते हैं। इन सारे सूत्रों के हिसाब से मैंने जो पेशेंट को लिया है उसमें से 4 पेशेंट के सीरीज जो है मैंने 4 पेशेंट्स की ली है। इन 4 पेशेंट्स में से जो 3 पेशेंट है वो 65 ईयर से ज्यादा के थे, बट जो एक पेशेंट था वो 60 ईयर्स उसकी एज थी। जो फर्स्ट पेशेंट है उन्होंने 2018 से माधवबाग में पंचकर्मा लेना स्टार्ट किया। इनिशियली उनका इजेक्शन फ्रैक्शन 25% था, जो आगे बढ़ करके 45% हो गया। सेकेंड पेशेंट जो थे उन्होंने 2018 से माधवबाग में पंचकर्मा लेना स्टार्ट किया। उनका इनिशियल जो VO2 मैक्स है वो 12.12 था, जो आगे बढ़ करके 36 हो गया था। और जो थर्ड पेशेंट है उनका वो जो है NYHS के ग्रेड 3rd और 4th में थे जब उन्होंने 2018 में पंचकर्मा लेना स्टार्ट किया था, जो अभी इम्प्रूव होकर के ग्रेड 1 में कन्वर्ट हो चुका है। फोर्थ पेशेंट उन्होंने माधवबाग में 2016 से पंचकर्मा लेना चालू किया, दो उनकी एज 60 इयर्स थी। पेशेंट पोस्ट CABG पेशेंट था, इजेक्शन फ्रैक्शन 35% था। पेशेंट ने जब माधवबाग में ट्रीटमेंट स्टार्ट किया तो उसका VO2 मैक्स इंक्रीज हुआ था और पेशेंट का वाइटल स्टेबल हुआ था, बट बीच में किसी रीजंस की वजह से पेशेंट जो है प्रॉपर कॉम्प्लायंस नहीं दिया। उसके बीच में वो सेम ब्रीथलेसनेस की वजह से 2017 से 2021 के बीच में हॉस्पिटलाइज्ड हुआ था। देन उसके बाद में वापस से वो माधवबाग में पंचकर्मा ट्रीटमेंट के लिए आया। उसके बीच में उसका जो इजेक्शन फ्रैक्शन है वो 25% हो गया था, VO2 मैक्स और ज्यादा डिटोरिएट हो चुका था, पेशेंट DCM में कन्वर्ट हो चुका है, PAH में कन्वर्ट हो चुका है और उसका जो NYAH का ग्रेड है वो अभी बढ़ चुका है। बट हम लोग इसको जो है ये पेशेंट को हम लोग ट्रीट करने की कोशिश कर रहे हैं, उसका VO2 मैक्स इंप्रूव करने की कोशिश कर रहे हैं। इन सारी चीजों से जो मैंने एक चीज सीखी है कि क्रॉनिक हार्ट फेलियर ये एक लाइफ थ्रेटनिंग बीमारी है, उसके बाद भी हम लोग मॉडर्न के प्रिंसिपल साइंस को यूज करके, मतलब स्ट्रेस टेस्ट, 2D इको, NT-proBNP, सेकेंडली एशियंट आयुर्वेदा के मेथड मतलब पंचकर्मा थेरेपी और आयुर्वेदिक मेडिसिन, थर्ड टेक्नोलॉजी मतलब MIB पल्स ऐप और पावर मैप, इन सारी चीजों का यूज करके क्रॉनिक हार्ट फेलियर जैसे पेशेंट को भी हम लोग इम्प्रूव कर सकते हैं, जिससे उनकी जो क्वालिटी ऑफ लाइफ है वो इम्प्रूव होती है। एंड इससे जो मैंने कंक्लूजन निकाला है वो ये है कि संपूर्ण हृदय शुद्धिकरण का जो मॉड्यूल है वो हॉस्पिटलाइजेशन, क्रॉनिक हार्ट फेलियर के पेशेंट का जो हॉस्पिटलाइजेशन है रेट है उसको रिड्यूस करने में काफी हद तक सक्सेस रहा है। और ये पेशेंट के NYHS के ग्रेड्स को इम्प्रूव करने में बहुत ही सक्सेसफुल रहा है। पेशेंट की क्वालिटी ऑफ लाइफ को ये इम्प्रूव कर पाया है, उनके इजेक्शन फ्रैक्शन को इम्प्रूव किया है उसने। दैट्स इट, थैंक यू।
Super presentation, Dr. Ranjita. Yes, your comments on this, please, Rahul sir.
Yes, actually, super presentation, Dr. Ranjita. And
thank you, sir.
Congratulations, you just started your journey as a clinical cardiologist, and the way you have presented, it shows you will go so beyond. I think बहुत ऊपर आप जाने वाले हो, and very कम समय में. The way you presented today, the points that you have shared, they are exceptionally good, because chronic heart failure, the major problem the patients who are suffering from chronic heart failure is a hospitalization rate. Normally in India, the recent Lancet study is suggesting that if someone diagnosed with a chronic heart failure in India, the possibility of a death is around 23% in just 1 year. And in such condition, if you not only just help your patient to improve their quality of life, but you have also improved their survival rate and reduce the risk of hospitalization. So nothing like it. And all the best. Keep it up.
Thank you, sir.
Thank you.
Yes, Praveen sir.
Yes, very nice presentation, Dr. Ranjita.
Thank you,
And
sir.
as you said, long-term follow-up is very necessary in chronic heart disease patient. So all the best. Thank you.
Thank you, sir.
So yes, we have. Yes. Your point has been addressed in the chat box too by Dr. Sandeep to reduce repeated hospitalization in CHF. Very important topic. Very well appreciated, Dr. Ranjita.
Thank you, sir.
So we now move on to our next presenter, Dr. Meenal Naik from Andivli East Clinic, and her topic of presentation is role of Ayurveda-based HTN management program in patients of essential hypertension. Dr. Meenal Naik, just a minute. Yes. Now, ma'am, you can unmute and you can start sharing your screen.
Hello.
Yes.
Hello, sir. Am I audible?
Yes, ma'am. Audible.
Good evening, all. Myself, Dr. Meenal Naik, practicing as a preventive cardiologist at Madhavbaug, Kandivali East from last 7 years. The topic of my presentation is efficacy of Ayurveda-based blood pressure management program in patients of essential hypertension. In the current era of modernization and industrialization, stress has become a part of life, leading to the many stress-oriented psychosomatic disorders, one of which is hypertension. Overall prevalence of hypertension in India was 29.8%. The WHO rates HTN as one of the most causes of premature death worldwide. Conventional therapy is based on oral antihypertensive medication, which has potential side effects in long term. Hence, there is a strong need for safe and cost-effective alternative methods to control hypertension. Ayurveda has the potential to treat stress and anxiety. Using Ayurvedic medicines and interventions may give a strong alternate option to current allopathy medicine. Hence, I choose the topic hypertension. Aim and objective, the present study was conducted to evaluate the role of Ayurveda-based blood pressure management program using Panchakarma procedure on ABPM, that is ambulatory blood pressure monitoring. This is observational retrospective study conducted at Madhavbaug Kandivali East Clinic from the period March 2019 to December 2021, and the study duration was 90 days. Total number of patients recruited were 20 patients. ABPM, that is ambulatory blood pressure monitoring, is the most important investigation technique which was used to prove the efficacy of this program. Blood pressure is a dynamic parameter and it varies depending on physical activity, mental status, and there are certain diurnal variation also. Hence, conventional blood pressure measurement has limitation. During ambulatory blood pressure monitoring, repeated BP readings are recorded for 24 hours. That is, during daytime, the machine records BP after every 40 minutes, and during sleep, it records BP after an hour. Thus, the real blood pressure is reflected more accurately by repeated measurements. And thus, we will come to know certain blood pressure conditions like isolated systolic hypertension, hypotension, dipping and non-dipping. This is very important as night BP suggests future cardiovascular risk or renal risk or cerebrovascular risk. The normal daytime ambulatory measurement should be less than 130/80 and normal nighttime measurement should be less than 115/75. This is how the machine is applied to the patient. Inclusion criteria, known case of hypertension who are on antihypertensive medicines, known case of hypertension who were not taking any medicines, age group between 30 to 70 years of either sex. Exclusion criteria, patients with secondary hypertension with resistant hypertension, age below 30 and above 70 years, with severe hepatic and renal insufficiency, patients with hypertension crisis, pregnancy or lactating women were excluded. Method of evaluation. Detailed history with demographic information like age, sex, occupation of the patient was recorded on day 1. Vital parameters like blood pressure, heart rate, oxygen saturation, body mass index, abdominal girth was noted on the day 1 as well as every visit of patient and at the end of the 90 days. Certain blood investigations like CBC, lipid profile, HbA1c, RFT, HSCRP, serum TSH were done. ABPM was recorded pre and post 90 days of the treatment. Dose and duration of the treatment. Two major treatment modalities used for this program is Panchakarma treatment, that is Snehan, Swedan and Shirodhara, and dietary modification. Snehan was done with the help of rose perfumed teal oil. Swedan was conducted with the help of Dashamul Kadha, and Shirodhara of Jatamansi decoction was done. In diet, portion control diet, that is 1000 calories diet, which was low in carbohydrate, moderate in proteins, and rich in potassium, was used in the form of diet kit. And the results are as follows. I got excellent results in weight reduction. Average weight reduction was from 83.48 to 74.64. Almost 9 kgs weight loss was seen in 3 months. Abdominal girth was reduced from 104.95 to 94.44. This indicates visceral fat reduction, which helps to relieve anti-inflammatory condition, as well as it helps to relieve catecholamine surge, and thus the improvement in blood pressure is also observed. Heart rate was reduced from 83 to 71.7. Systolic blood pressure was reduced from 139.2 to 122.8. Diastolic blood pressure was reduced from 87 to 80.7. Now, improvement on ABPM reading, systolic day BP. So, as I mentioned earlier, day average BP and night average BP were recorded. So, systolic day average BP was reduced from 123.25 to 113.2. Diastolic day average BP was reduced from 76.65 to 69. So night BP, that is systolic night BP, was reduced from 122.65 to 112.15. Night diastolic BP was reduced from 75.65 to 68. So a reduction in night BP, that is dipping in night BP itself indicates that there was excellent reduction in the future risk of cardiovascular and renal events. So due to reduction in blood pressure, I could easily reduce the dose of allopathy medication. So as you can see here, ARB, that is angiotensin receptor blockers, were almost 11 patients were taking. Now only 8 patients are taking, but that too with very minimal dosages. Alpha blocker, almost 1 patient was taking, now he is not taking. CCB, 6 patients were taking earlier, now only 1 patient is taking. Beta blockers, 8 patients were taking, now only 2 patients are taking beta blocker. Diuretics were stopped almost in all patients. Statin was reduced from 6 to 2 patients. Antiplatelets were reduced from 4 to 3. Now these 3 patients are known, like they have history of stent implantation, that is angioplasty is already done, so couldn't reduce the dosages of antiplatelet. So number of patients recruited for the study were 20. Out of them, 6 patients are totally medicine free. More than 10 patients have reduced, like in case of 10 patients, I have reduced more than 50% medicines, and patients who were not on antihypertensive medicines are 4. So the probable mechanism of action of the treatment could be, that is first Panchakarma treatment. In that Snehan, for Snehan, rose perfumed teal oil was used. So this particular procedure reduces sympathetic overstimulation, it improves vascular tone, and rose oil is an anti-anxiety in nature. Swedan, the name itself indicates thermal vasodilation. It helps to induce vasodilation. It reduces fluid overload, reduces systemic vascular resistance. Shirodhara, which is herbal decoction dripping over forehead, it relieves anxiety by reducing catecholamine surge and helps to induce sleep. Jatamausi has got antioxidant properties, so it protects the cells. Then the diet kit, which was used for this treatment, helped to reduce weight, as it was low calorie portion controlled diet. It was rich in potassium, and potassium is helpful for vasodilatation. It induces excretion of sodium, hence reducing blood pressure. So this diet is also rich in antioxidants and helps to reduce vascular inflammation. So with this study, I can definitely say that Ayurveda-based blood pressure management program effectively reduces blood pressure and dependency of allopathy medicines, also improves quality of life in patients with essential hypertension. Thank you all. I would like to thanks to the whole clinic team, including my compliance medical officer, my Panchakarma therapist, and patient care executive. Also, I would like to thanks to the core medical team and research team for the same. Thanks a lot.
Thank you, Dr. Meenal. It was a superb presentation. Over to you, Rahul sir.
I would say this is one of the best presentations since yesterday. I'm trying to search. Yesterday also I asked the doctor that the blood pressure is a very dynamic thing. If you see in the morning, it is different. If you see in the afternoon, it is different. If you see in the evening, it will be different. So based on the one blood pressure, we can't say that there is improvement or there is no improvement. But when you have a 24 hours of ambulatory BP, and that is about 20 patients data sample size, that is showing something extraordinary work has done, because even the big academic institute, they never studied such kind of with investigation and intervention in a hypertension patient. So excellent work done by Dr. Meenal Naik, because just sitting in one clinic and doing the 20 patients data collection with ambulatory BP and treating them effortless. So excellent. Hats off to you and your team, Dr. Meenal Naik. The few questions I have and few suggestions for you, I would rather say. First of all, never the patient's face should be covered when you are presenting or you are taking their picture, if you are showing their picture. So that has to be take care. First thing. Second, the prevalence of hypertension, you mentioned 29.8%. So what is the reference you are having the prevalence is 29.8%?
That was like I have searched it on Google. So in 2020, the prevalence was 29.8%.
No, it is almost 11 to 12% hardly. And so please forward me that research article from where you have taken this.
Yes.
Before giving any big statement like the high prevalence or incidence, we should reconfirm with at least 2 to 3 different research articles. So that is a very small minor. It's not even a correction, I would say. It is a suggestion for all the presenters. Yes. So in the future, whenever you are putting any information, which is very important, because you are a researcher and you are representing all the fraternity of Ayurveda as a hypertension management doctor. So definitely people will look into it. Can you please take me to your slide? I have one more point, especially your day BP and night BP difference.
Yes. This one? No. Or the results?
Before and after.
Results. Yeah, hold on.
Yes, wait. Now you are trying to suggest here the first column of SBP day and SBP. Okay. So before your treatment, day SBP average was 123, right?
Yes.
And night SBP average is 113. Am I right?
Night SBP average is 122.
Okay.
Sir, it is like first data, SBP day and DBP day is all day BP average. And this third and fourth column is for night BP. So SBP night and DBP night.
But this data showing there is a no proper deepening.
How come, sir? It is
because
earlier it was 122.65 by 75.65.
No.
Earlier, and
what
now it
Dr.
is.
Praveen sir is trying to ask you, as compared to day BP, what was the day one's night BP? 123 and night BP was 122, right?
Yes.
So there was hardly, Praveen sir, there was hardly 1% of
1 mm of Hg.
There is hardly 1% of nocturnal deepening, or we can say there is a no deepening pattern at
yes,
right?
True.
So after a treatment, it is changed from
113 to 112,
right?
Yes.
So day BP was 113 average and night BP was 112 average.
Yes.
Right. So even here we are not able to see the proper nocturnal deepening again.
I think data में कुछ तो error है.
We have to you just send this data again. We have to recheck this data, because the nocturnal deepening was is something which is very essential part. Otherwise, your data is showing very remarkable improvement. So no problem at all. But we need to again reanalyze the data just to see whether what parameter has to be considered again.
Sir, what I have considered is like systolic BP. Day systolic BP was 123.
Right.
And day diastolic BP was 76. So 123 by 76 with medication. Now
Right.
it is 113 by 69 with reduction in medication and without medicines in some patients.
Right.
Even night BP was 122 by 75. I haven't compared it with day BP. Of course, it should fall down by 10% as compared to day BP. But if you are checking the normal values of night BP, then it should be less than 120 by 75. So that is fitting in the criteria. So after the treatment, night BP is 112 by 68, which shows it is in normal range, as per my knowledge.
No, see, there is a significant 10 mm of Hg blood pressure reduction, and that is superb. It's a hats off to you for this. The only thing, the nocturnal deepening, I think we should gather the data of nocturnal deepening, and that could have add the few more stars to your presentation. Apart from that, excellent presentation and keep it up, doctor.
Thank you, sir.
फिर ये 20 पेशेंट में से कुछ ऐसे पेशेंट होंगे जिनमें नॉक्टर्नल डीपिंग प्रॉपर नहीं हुआ है, तो नेक्स्ट स्लाइड में ये बताना चाहिए था कि आउट ऑफ 10 पेशेंट शोइंग प्रॉपर डीपिंग पैटर्न, 5 पेशेंट शोइंग नो डीपिंग पैटर्न, और जो कुछ रिजल्ट है वो, राइट?
ओके सर.
ओके.
So there is no major mistake in your presentation. Few suggestions from our side.
Okay, sir.
Right, Dr. Meenal, there are some questions in the chat box. Can similar therapy be administered in malignant HTN? Have you encountered such cases earlier?
Yes, we have encountered such cases of malignant hypertension, but along with this therapy, we have to focus on some medications as well as certain treatments like Sneha Virachan, which is helpful to reduce blood pressure in malignant blood pressure patients condition.
There is one more question. Do we administer this treatment in patient with HTN DM with CRF?
Yes, we do administer, but of course we check potassium level and serum creatinine level on weekly basis, because we are administering GoBP diet kit, which is rich in potassium. So in CRF patients, we have to take care of electrolyte imbalance. So if at all, if we observe that potassium is increasing, like baseline with baseline potassium value only, I will administer this kit. or else we have other options also.
There are some very good comments in the chat box. If you can see regarding your presentation, superb comparative study of patients' data analysis was too good. Very nice study. So good going, Dr. Meenal.
Thank you.
Yes, now we move on to our next presenter. Our next presenter is from Pune region, Fatima Nagar, Dr. Rohini Shinde, and her presentation topic is role of virechan in hyperuricemia. Just a minute, I'll spotlight. Yes, Dr. Rohini, welcome. Kindly unmute yourself. Best of luck.
Thank you. My topic is hyperuricemia. Virechan role in hyperuricemia.
Can we have the screen on presentation mode?
Yeah, I'll do that.
Yes. Carry on, ma'am.
Research topic is virechan a significant treatment for hyperuricemia? I have case representation of two cases, male and female. Male with age 41, staying in Fatimanagar itself, was diagnosed since 2015 for hyperuricemia, had severe rashes all over the body, skin allergies, seashells or any seafood causing the same event every now and then, and he has severe swollen all over the body and most specifically in the joint area. Severe pain in knee and came for the treatment after that. He had no major illness. His only complaint was severe pain in his finger, unable to move or continue with his daily routine every day. Investigation done via uric acid only. Second case is a female with no major illness and have severe pain in knee, uric acid, HbA1c and TSH were done pre and post. She came in with reports of HbA1c and TSH as well. That time she was been diagnosed for hypothyroidism just prior to the treatment. Okay. So as per for the pathophysiology, adapting a Western lifestyle, bed tea, viruddhahar, causes rakta dushti, that is unwanted free radicals all over the body, leading to vata rakta, which is caused by vata being hindered in the joint pain, in the joints, causing uric acid deposition. Further, I'll explain you how. Any reason that causes vata prakop results in the symptoms rising again. Vata rakta also later on resulting into sandigata vata. Medication given the oral medication first the Pachak, Pitta Shamak Chikitsa. Next, 2 months restriction of any seafood, any meat, and the next was virechan. Next to that was Samsarjan. As discussed, baseline was Panchakarma. Medicine was given, Snehapan was given to the patient. That was Mahatikta. Next to that, the follow-up was taken. The Snehapan was digested by the patient with how many treatments, like how many days it took for the patient to digest the Snehapan. Next to that, if the Panchakarma was done proper or not, the Vega that was given. For the virechan, how many Vegas patient came across after that? It's like 10 or 20. Both the patients went somewhere around 25. Male patient went to 22 and female went to 26 Vegas that day. Follow-up was done after Sansarjan. Snehapan was for 3 days. Virechan was for a day and Sansarjan was for 3 to 4 days. Snehapan was with 30 ml first day. Next to that was 60. Next to that was 80. This patient could not continue with the 90 ml. No. Like I have discussed prior to this, how was the vata rakta or how was the hindrance been occurring over here? Can you see this supply over here? This causes the hindrance over here, the crystals being deposited over the area, over the joint area, leading to uric acid deposition, leading to gout, leading to ambat. This is the osteoporosis been caused after that. Result of viration. Snehapan Samyak Lakshana Viration was 22 for male and 26 for female. Samsarjan Crum was for 3 to 4 days, not more than that. Uric acid in first case, that's the male case, from 77 to 5.77. Weight loss was near about 7 kgs, and female it was 6.3 to 5.2. HbA1c went down to 5.9 to 5.4. TSH level, which was just like was prior to this, 7.17 to 5.3, and weight loss was only 2 kgs in this case, near about. Viration has a significant effect on hyperuricemia. That was the conclusion of my study. Some references.
Thank you, Dr. Rohini. Super presentation. Rahul sir, your views on this, please.
Very nice presentation, Dr. Rohini, and it's a very novel topic that you have taken, uricemia. So along with parametric improvement in the pathological report of serum uric acid, what else the clinical evidences or the clinical assessment parameter you found are very what apparently changed after this therapy? Have you seen any remarkable change in their clinical condition as well?
Yes, there were no swelling till date. It has been 3 years that I have taken this case. Till date, he haven't shown me any symptom for uricemia again. And he can have sequel also. He is now residing in Mumbai, and he can have issues also, but there is no any side effect, no any skin allergies. Till date diagnosed, till date discovered.
Good. And after correction or the reduction in the uric acid, have you again checked their uric acid level after some time to and yes. So is there any reoccurrence of again? No reoccurrence after the viration. So this seems very interesting. In all the 3 cases, you didn't find any reoccurrence of uric acid. Okay, that's superb. And congratulations to you and your team, and keep it up. Over to Dr. Omkar.
Yes, it was a fantastic presentation. Thank you, Dr. Rohini. Now, any questions? Yes, the moment I ask questions, we have a couple of questions in the chat box for you, Dr. Rohini. Have you seen any relationship between hyperuricemia and cardiovascular condition?
Yes, I have seen such relations. Hyperuricemia does affect cardiovascular conditions. It gives inflammation. See, hyperuricemia causes inflammation in the body, which again results in endothelial dysfunction. That causes cardiovascular conditions going more worse.
Fine. And there is one more question. Have you done Rakta Mokshan also in these cases?
No, no Rakta Mokshan was done in this case.
Okay, so only Virachan was the primary line of treatment.
Yes.
Very nice, very nice. Thanks a lot. So, Rahul sir, we'll move on to our next presenter now.
Yes, Dr. Omkar.
Yes. So, our next presenter is Dr. Yogesh Yalmar from Sihagarh Road, Pune. And his topic of presentation is role of set of asanas in primary prevention of CHF, a case report. Dr. Yogesh Yalmar. Just a moment. Yes, Dr. Yogesh, welcome.
Good afternoon, sir.
Good afternoon, sir. Now you can start your presentation. You have 8 minutes of time.
Am I audible?
Perfectly audible, sir.
Good afternoon, all. Myself, Dr. Yogesh Yelmar, practicing in clinical cardiology at Sihagarh Road Clinic since last more than 12 years. My case report of today's topic is role of set of asanas in primary prevention of CHF. Main objective is that does yoga and lifestyle changes have a role in revitalizing the cardiac health? This is the main objective. Patient medical history is 37 years, male patient, profession in IT services, living in Pune, Sihagarh Road area. During the lockdown period, first lockdown, he faced that weight gain, feeling in general lethargy, disturbed sleep, snoring, constipations. After some months, dyspnea on exertion, palpitation and giddiness like symptoms seen. So patient is come to the clinic. Main purpose of patient is his family history. His father and grandfather had history of cardiac alignment. So he comes to the clinic. There were no major cardiac related symptoms. Patient had never taken any treatment for these presenting symptoms and wanted to opt only healthy lifestyle by changing his daily regime as per the yoga and Ayurveda. Treatment information. Preventive intervention was determined in front of primary management technique to improve his cardiac health. Set of asana and pranayam were prescribed to the patient to be performed daily, empty stomach in the morning along with the daily diet regime. The role of set of asana were explained to the patient and how to perform it stepwise was taught along with the breathing pattern, timing to hold the posture and its pretensions. Even the pranayam technique was illuminated similar way. A demo of set of asana with instrumentation was given in the form of video CD so that patient will be able to perform it at home. It was advised to the patient to perform the asana and pranayam for 45 to 60 minutes at least 5 times a week for better results, preferably in the morning, empty stomach. Follow up every month. If the patient health to be patient deteriorated to shifted to the medical treatment. A daily diary was told to maintain, which was checked at every follow-up. Changes in lifestyle advice accordingly. No medical intervention was needed in the said period. Administration of intervention. Administration maintained each asana posture for a span of 20 seconds. Likewise, 2 repetitions for each asana. Total duration of the schedule was 45 to 60 minutes. Following set of asana were advised to the patient. First, Tadasan. Second, Utkatasana. Next, Virabhadrasana, Trikonasana, Ardhamachandrasana, Paschimottanasana, Setubandhasana, Marjarasana, Bhujangasana, and Shavasana. Set of pranayama is Nadi Shodhan pranayam and Brahmari pranayam. On examination, before and after treatment, we say that heart rate is reduced 90 to 75. Blood pressure was reduced 140 to 92, 118, 74. SpO2, oxygen level is 97 to 98. Height, no change. Weight 80 to reduce up to the 74.2 kg. Weight 80 kg to reduce by 74.2 kg. BMI 27 to 25.1. Respiratory system, cardiovascular system, and per abdomen, there is no such changes seen. Assessment of dyspnea as per the New York Heart Association NYHA classification is used, as all we know. Diagnostic assessment is before treatment and after treatment. ECG will normal both the side. Stress test is conducted according to the modified Bruce protocol, negative for ischemia, but stopped at 12 minutes completed due to the shortness of breath and dyspnea on exertion. After treatment, negative for ischemia also, but completed 15 minutes easily. Med value changes 7.5 to 10. VO2 max is raised 24 to 32 ml per kg per minute. Total cholesterol level is reduced to 190 to 150. Triglyceride level also reduced 140 to 128. HDL level are raised 35 to 42 is a good sign. LDL level is reduced 80 to 70. BSL random is reduced 130 to 124. Assessment of stress test is according to the modified Bruce protocol for the stress test. Total duration is 15 minutes, like this. Discussion of asanas. Cardiac muscle is partly controlled by autonomic nervous system and influenced by hormones like adrenaline and non-adrenaline circulating in the blood. Although the cardiac function is involuntary in nature, it is influenced due to emotional and attitudinal changes and moods. The set of asana prescribed probably effect by the body in 3 ways. First is vagal nerve stimulation. Second, reduction in preserved stress. And third is musculoskeletal stimulation. By massaging the vagal nerves directly, asana may promote parasympathetic activation, thus leading to decreased heart rate, blood pressure, similar metabolic and physiological benefits, resulting in an improved outcome. Yoga has also associated with decreased level of depression, improved quality and quantity of sleep, and weight reduction in the form of reduced visceral fat. Discussion on pranayam. Calmness and mental relaxation are felt immediately practiced in Nadi Shodhan pranayam. It improves the function of digestion and sleep. It removes the blockages in nerve conduction and corrects the neural functions. Brahmari pranayam translates the mind and practitioner giving her blissful feelings. It helps in integration and international awareness and extrasensory precautions for longer time, reduces the instability of mind and calms it down, beneficial to those suffering from stress, high blood pressure, and cardiac disorders. Discussion part. At the end of the study, it was noticed that systolic pressure of the patient was reduced from 140 to 118, diastolic from 90 to 74, BMI alters from 27 to 25.1, MET value increased from 7.5 to 10, VO2 max is improved from 24 to 32 ml per kg per minute, which is remarkable improvement. This is all achieved without any medical intervention. So not only the patients with cardiac alignments can practice it, but even individual can opt for this kind of change in lifestyle. Patient perspective, what
Last
is the
2 minutes, sir?
Oh, yes, sir. Patient perspective, what is the benefit to the patient? Yoga has a great potential as an adjacent therapy, as it is cost effective. Many have not complications which practices as a proper manner under expert guidance. Many patients are nowadays opting try out yoga either before starting medications or combination with the medications. After a year, patients reported that dyspnea on exertion totally reduced, no palpitations, giddiness, and disappeared within a month. Patient should sleep for 7 hours, snoring was reduced, motions were clear, and feeling general wellness was observed. In fact, I've observed that many of his colleagues at work had noticed that positive changes in his attitude, decision-making capabilities were improved, also could handle the stressful situation with much calm and patience. Patient was really happy as his BP has reduced and lost his weight 80 to 74.2 kg. Conclusion is that significant reduction in the blood pressure and BMI. Similarly, remarkable improvement was seen in the MET value and VO2 max values. There was achieved within any other medical intervention and only yoga therapy. This case study proves that cardiac alignments related to the stress can be treated without intervention with yoga. More similar studies can be conducted in generalized and extrapolate that findings for the population. These are some references which was used in this study. Thank you. Thank you so much for listening me, and thank you so much for giving this opportunity to present in front of you. Thank you.
Thank you, Dr. Yogesh Chelmar. It was a fantastic presentation. The most important point was no medicines were used in this treatment. It was completely on the yogasanas, which you had asked the patient to conduct. So over to you, Rahul sir.
Very nice and clean presentation. No questions from my side at all. And all the best, Dr. Yogesh sir. Thank you.
Thank you.
Yes, Dr. Praveen sir.
Yes, without medicine, without any medical intervention, exercise like yoga and pranayama help in heart disease patients. ये जो ये प्रेजेंटेशन से आपने जो पुट फोर्थ किया है, आई होप ये नया एक आयाम है और सभी डॉक्टर्स ट्रीटमेंट डाइट के साथ साथ इस एस्पेक्ट्स को भी अगर फॉलो करें तो डेफिनेटली रिजल्ट्स मिलने वाले हैं और उसका इम्पैक्ट यहाँ पे रहने वाला है. सो थैंक यू एंड कीप इट अप.
Thank you, sir.
We have one question for you, Dr. Yogesh. Whether this patient had sleep apnea, did you monitor him for the same?
No, there is no sleep apnea.
Fine.
Sleep disturbance is there, no sleep apnea.
Fine. Thank you.
Thank you. Thank you so much.
Yes, now we'll move on to our next presenter, Dr. Neeta Hinge from Karvenagar. And her topic of presentation is role of Panchakarma treatment in dyspnea on exertion. Dr. Neeta Hinge. Yes. Dr. Neeta?
Yes, sir. 10 minutes.
Yeah, you need to start your video to be spotlighted. Yes, ma'am.
Yes, sir.
Yes, your presentation is visible now. You have 8 minutes of time for your presentation.
Yes, sir. I'm Dr. Neeta Hinge.
Yes, please continue, ma'am.
Yes, sir. I'm Dr. Neeta Hinge from Madhavbaug Karvenagar Clinic. Good afternoon, all. Today I am going to present role of Madhavbaug's heart failure reversal therapy in DOE NYHA class 3. DO is one of the defining symptom of the heart failure. NYHA has give 4 classes of the DOE. The classification is based on the symptoms of patients' experiences during activity and is most often documented in the clinical notes. As we know, the 4 classes of NYHA. In class 1, there is no symptom with normal physical activity. In class 2, mild symptoms with normal physical activity, comfortable at rest. And in class 3, moderate symptoms with less than normal physical activity, comfortable only at rest. And in class 4, severe symptoms with features of heart failure with a minimal physical activity and even at rest. Out of these, class 3 and 4 are considered as the severe ones. So I am going to present a single case study of DOE NYHA class 3. A female of 60 years old came in Madhavbaug Nagar clinic with a history of HTN, ISD and CHF. Previous history, patient was admitted in the hospital and diagnosed with ACS and ISD. Present complaint of the patient is a DOE. Investigations done 2D echo. Investigations advise ECG, lipid profile, stress test and 2D echo. And my diagnosis was a CHF. Treatment advised oral medicines, tablet ARZ, which contains Arjun extract, and GHA, which contains Gokshur, Haridra and Amalaki. And with that oral medicine started heart failure reversal therapy, which includes centripetal oleation, in which the Arjun, Nirgudi and Dashamul oil I use, thermal vasodilatation with Dashamul decoction, thoracic drip with Dashamul decoction, and per rectal drug administration with Arjun and Punarnava. Centripetal oleation improves the blood vessel elasticity and health. It reduces the hyperactivity of the sympathetic nervous system, reduces palpitation, acts like a negative chronotropic and positive inotropic agent. Thermal vasodilatation reduces fluid retention, salts and toxins. It calms down the hyperactivated sympathetic nervous system, dilates blood vessel. Thoracic drift, it reduces rasadhatu dushti. It improves the oxygen supply to the intercostal muscles and reduces the dyspnea. PRDA reduces, that is per rectal drug administration, reduces the fluid retention and inflammation, and it improves the myocardial muscle strength also. Arjun improves the tone and the health of the blood vessel. It is a cardioprotective, improves blood circulation to myocardial muscles and improves the myocardial muscle strength. Punarnava is act as a diuretic, anti-inflammatory, and it removes the excess fluid from the body. By these treatments, we see the parameters before and after treatment. The before treatment weight is the 73.2, after it is 65. BMI reduces from 30 to 26. Abdominal girth also reduced from 109 centimeter to 99 centimeter. Her BP is before 117 by 72 mm of Hg, and after treatment it is 130 by 72 mm of Hg, because almost all medicines are tapered. Heart rate is 76 per minute, and after that heart rate is 71 minutes. VO2 max improved from 16.8 ml per kg per minute to 36.05 ml per kg per minute. Medicines patient taking before coming to clinic, Rosuva's, Ecosprin, Cardes and Nicoran. Sorry for the Nicoran spelling. Now all medicines tapered, and the tablet Cardes 1.25 milligram patient is taking twice a week. 2D echo before and after shows very good results. Left atrium is 45 mm measurement, and after treatment it comes to 39 mm. Before treatment, 2D echo shows the preserved left ventricular systolic function. And after treatment, it comes to normal size and systolic function. Before it is a dilated left atrium, mild PA pressure, and now it is a normal PA pressure. LVEF improves from 50% to 60%. Conclusion, hence the DOE of the patient was reduced after Madhavbaug's heart failure reversal therapy. And these are the references.
Beautiful presentation, Dr. Neeta Hinge.
Yes, very nice presentation, Dr. Neeta. ये पेशेंट में तो VO2 max इम्प्रूव हुआ है, इको में भी बहुत अच्छा इम्प्रूवमेंट हम देख रहे हैं. Any pathological investigation you did in this patient and any improvement?
Yes, sir. Lipid profile done, but now the lipid profile is also normal. Before coming to clinic, it is also normal because she is taking statin drugs, and after stopping the statin drugs, it is also maintains the normal.
Okay. Okay. Thank you. Keep it up.
Yes, sir. Thank you. Thank you, sir.
Yes, Rahul sir.
Yes, sir. Thank you, Omkar sir, Dr. Rohit Sane, Dr. Rahul, and Dr. Praveen sir. Yes, to give me the opportunity to present here. Yes.
Yes. Rahul sir, over to you. Please unmute.
It's a pleasure, ma'am, to have you as a presenter here. And you are doing really wonderful job, and you are treating so many of patients. And this case is showing that you have made a remarkable change in the patient's life. And see, pathological changes and all the changes, hum research wale log, we always look after the parameters. But the change you made in the patient life is most more beautiful thing that I have observed in your presentation.
Yes.
All the best, and keep doing such a wonderful work.
Yes, thank you. Thank you.
Thank you. So we move on to the next presenter now, Dr. Priyanka Pathare from Goregaon Park, and her topic of today's presentation is effect of Brahmi Grutnasya in hypertension. Dr. Priyanka Pathare. Yes, ma'am. Welcome.
Good afternoon all.
You need to be a bit loud.
Yes, sir. So is my screen visible?
Yes, and thank you for the first slide. Yeah.
Sorry.
Now you can start with the presentation mode, ma'am.
Good afternoon all. I am Dr. Priyanka Pathare from Goregaon Park Clinic.
Can you put it on presentation mode?
Yes. My topic here is effect of Brahmi Grutnasya as an additional treatment in hypertension. Hypertension, sympathetic nervous system and autonomic nervous system plays an important role in hypertension. Excessive stimulation of sympathetic nervous system causes increase in blood pressure, while stimulation of autonomic nervous system decreases the blood pressure. Increased sympathetic activity leads to vasoconstriction, which leads to vascular hypertrophy, which further leads to atherosclerosis, which leads to increased peripheral resistance, which causes endothelial dysfunction, which in turn causes nitric oxide imbalance, which leads to contraction of smooth muscles and which further increases the BP. This is a single case study. My patient's medical history, 35-year-old male patient working in IT sector. He was a known case of hypertension since 5 years. Patient came with symptoms of head heaviness occasionally. Allopathic medicines he was taking, Atoroc and LN beta. His first day vitals were as follows. Investigations done, ABPM and lipid profile, urea and creatinine. ABPM and lipid profile were deranged, while urea and creatinine were in normal limits. Hence, diagnosis was stage 2 hypertension according to a gold standard ABPM investigation. Treatment given. Conventional Madhavbaug treatment was given. Diet therapy, 1000 calorie, low sodium, low carb, high fiber, good quality fats, potassium and magnesium rich diet was given. Panchakarma, centripetal oleation with rose abhyanga oil was given. Thermal vasodilation with Dashmu Kadha was done. And Shirodhara of Jatamansi Quad was used. Oral medicines used were Punura, which contains Nandama Gokshu, Varun, Ashante, which is diuretic, Artil, which contains Sunthi Brahmi, which is anxiolytic and neuroprotective, is that is which contains Vacha, Vipita, Pipili, which is cardioprotective, Lipox, Neem, which contains Neem, Gudmar, Caravilla, which is hyperlipidemic, and Anolax, that which contains Haritaki, Sunthi, Saintha, and Savarchar Lavan, which is laxative in nature. Patient was on daily BP monitoring with good exercise compliance and good diet compliance, and hence his allopathic medicines was tapered. But after tapering, his average BP for last 7 days was around 140/90. Hence, after discussion with ZMH, that is Sadik sir, Brahmi Growth Nasya was started. After 2 weeks, average BP seen, that is again for last 7 days, was 128/84. Method, Nasya procedure was done with the authentic way. It was done in Panchakarma room for 15 days with a gap of 1 day. Purva Kanva, mild massage with til was given. Main procedure, 8 drops of Brahmi Growth was instilled into each nostril, one after the other. For post procedure, patient was advised to ingest the medicine, and if it comes into the throat, he was told to spit it out. Brahmi Growth is a polyherbal formulation. Its references from Charak Chikitsa, 10th Adhyay, 25th Shlok. Its contents are Brahmi, Vacha Kushta, Shankha Pushpi, and Purana Growth. It is mentioned to be used in Apasmar, Dahadosh. Okay, the lipids before and after. Total cholesterol reduced from 225 to 147. Triglycerides reduced from 186 to 108. HDL increased from 35 to 50. LDL reduced from 150 to 89. And the ratio of total cholesterol to HDL reduced from 6.4 to 2.9. His vitals from day 1 to the last day, that is from 13th April to 30th of June. BP reduced from 156/92 to 118/68. Pulse from 109 to 74. Abdominal girth from 107 to 91. BMI reduced from 31.1 to 26.7. Weight reduced from 75.8 to 65. Result, his average BP also normalized, and as per ABPM, ABPM was also normal. Discussion. If we look at the neurological part, olfactory stimulus by the Brahmi Nasya went through the olfactory tract and reached the medial olfactory area of the brain, which further reached from anterior hypothalamus to medial amygdala and the midbrain. The axons of hypothalamus extend to sympathetic nervous system, brainstem, and spinal cord. Brahmi Nasya stimulates ANS and helps reduce hypertension, many researchers have proved inflammation of amygdala leading to hypertension, which is taken good care of by the Brahmi Nasya. Nasya, according to the doshas mentioned in Charak Samhita, for Pitta Vikruti, Gruta is to be used. As in hypertension, we say it is a Pitta Pradhan Vyadhi. We have used Brahmi, Gruta, Madhyam Matra, that is 8 was used, and Marsha Nasya, as it is a oil, ghee, as Gruta was used. Brahmi Kruz is a polyherbal formulation. The contents: Brahmi pacifies Pitta, relieves stress and anxiety, calms the sympathetic nervous system. Vacha is Medhya, Pushta acts as Pachan, and Shankha Pushpi controls the adrenaline and cortisol, reducing stress and anxiety. Puranvrata is Medhya and can cross blood-brain barrier easily, as well as it is Yogavahi. These are the references. Thank you.
Thank you, Dr. Priyanka. Some different topic which we have seen since yesterday regarding Brahmi Grutanasya. So good. I will move on to Rahul sir. Your views on this, please. Meanwhile, the doctors who want to ask questions, the chat box is open. You can type your comments or questions over there. Yes, sir. Rahul sir.
Yes, superb topic, Dr. Priyanka, and excellently you have executed this topic, because use of Brahmi Gruta in hypertension in a Nasya form, and the concept of amygdala and the results with the ABPM that you have shown was exceptional. Superb. No questions at all from my side, and keep it up. All the best.
Yes, good work, Dr. Priyanka. No question from my side.
Okay, any questions in the chat box?
You can move to next presenter. Meanwhile, any question rise in chat box, Dr. Priyanka will answer.
I'll request all the participants to at least appreciate the presenter, if you like, or whether you like or whether you dislike your presentation. But your activeness should be seen in the chat box. Right or wrong?
Well said, sir. Yes, it was a fantastic presentation, Dr. Priyanka.
Good, Dr. Shivali. Good, Dr. Jayashri. Very good, Dr. Yes, everyone should comment. Everyone should take a part. Active participation is expected. Yes, see, we are the young generation, and if we don't make any energy, if we don't show any energy, how we can take Ayurveda to the first line treatment option, right? To take Ayurveda to the first line treatment option, we also need huge energy and support of. We need to support each other, and this is how we can reach to the first line treatment option.
True, sir. There is a small question. Apart from Nasya, any other Panchakarma done in this case, Dr. Priyanka?
So the traditional Panchakarma, that is Snehasvedana and Shirovara, was already done.
Okay, fine. Thank you. So now we move on to the next presenter. Our next presenter is Dr. Amruta Wadekar Shinde, and she's from Vishrantwadi Clinic, Pune. Our topic of presentation is effect of Langana, NBM in fluid retention in known case of CHF, chronic heart failure.
Yes, sir. Good afternoon, everyone. Just give me a second.
Yes. You have 8 minutes of time, ma'am?
Yeah, yes, sir.
Screen.
Sir, my screen is visible?
Yes, it is visible. Okay. Keep it on slideshow mode. Yeah. First, do enable editing. Click on enable editing. second, third line.
Yes, sir.
Yes. Okay.
So, myself, Dr. Amruta Vadekar from Vishrantwadi Clinic, Pune. Today, my topic to present is to study the effect of Langan, that is NBM, in fluid retention, that is ascites as a complication of chronic heart failure. So, my patient is a 66 years old female patient.
Madam, your slide is on first page only.
Oh.
Your presentation mode is not on yet.
Sir,
Ma'am, you need to do this enable editing.
Enable editing.
Without that, the slide won't move ahead. So click on that enable editing button on top.
Enable editing.
Down in a yellow bar.
तो yellow line में मैडम yellow line में लिखा हुआ है ना white line.
Protected view.
Right. Rahul sir, if you have the presentation with you,
वापस शेयर करना पड़ेगा मैडम.
Just a minute, sir.
Enable editing. काय करायचं आता?
Slideshow.
पण ते
फर्स्ट शेअर करा मॅडम.
दिसतंय सर आता?
नाही, शेअर करा.
शेअर कीजिए. Come on Zoom page, Zoom platform, then click on share screen button.
हे कुठे आहे?
Yes, now it's visible. Continue.
एक सेकंड.
yes, ma'am, please continue.
Yeah. So my topic for discussion is to study effect of Langan, that is NBM, in fluid retention, that is ascites as a complication of chronic heart failure. So my patient was 66 years old, female patient. She was having diabetes since 2012. Then she got asthma in 2017, CHF in 2019, ascites in 2020. She came with the complaints of dyspnea on exertion grade 3, flatulence, loss of appetite, constipation, general weakness, and anorexia. She was unwell, pale, lethargic, and distended abdomen. Adult edema was there, and dyspnea was there. Investigations advised were CBC, serum electrolyte, LFT, KFT, lipid profile, TFT, USG abdomen, and pelvis. So, in USG abdomen and pelvis, ascites was diagnosed. 350 ml of fluid was an. There is ascites 350 ml and bilateral moderate pleural effusion was there. So, on that basis, I diagnosed her with chronic heart failure with ascites, DM, and bronchial asthma. So according to that, the treatment advised was in oral medications, Arjun, Punarnava, Deepan Pachan Shodhan medications were used. In diet, initially low carb and moderate protein diet was advised along with Langan for 24 hours. Panchakarma advised was our Sampurna Hriday Shuddhikaran therapy, in which centripetal oleation, thermal vasodilatation, Hriday Dhara per rectal drug administration was done. So, in baseline treatment, again Panchakarma, oral medications, and in diet, after first Sampurna Hriday Shuddhikaran Chikitsa, that is after one first HFRT, I advised her for the Langan for 24 hours. In which during that concomitant medicines were beta blockers, statins, diuretics, sulfonylurea, and biunites. Then initially follow-up was thrice a week, that is alternate day. After that, follow-up was extended to twice a week and then once in a week. Nowadays, patient is visiting clinic once in a month. So after all these treatments, all allopathic medicines are stopped now. Patient is on only Ayurvedic medicines. So we can see the parametric improvement in patient. Day one when patient visited clinic, her weight was 63.1 kg, BMI was 28.4, abdominal girth 112, heart rate 91, BP 120/93, and her random blood sugar was 149, and HbA1c was 6.9. Then after first, as I said, after her first Panchakarma treatment, I advised her first Langan, where no food, no water, and no medications was there for 24 hours. And after first Langan, we could see the result. Weight was 59.4 kgs, BMI was 26.4, abdominal girth was 103, reduced by 9 centimeters. Then heart rate 95, 140/98 was the blood pressure, 131 was her random sugar. Again, after 8 days, second Langan was done, where weight was 57.7, 25.64 was BMI, abdominal girth was 97, heart rate was 92, 139/92 was blood pressure, and sugar dropped to 97. After again 12 days, third Langan done, where weight is 56.8, 25.24 is BMI, 97, abdominal girth was the same here, heart rate reduced to 87, blood pressure was 139/91, sugar 76. Then after 12 days, fourth Langan was done, where weight was 53.9, BMI was 23.96, abdominal girth reduced to 93, then BP was 122/80, random sugar was 70, and HbA1c reduced to 6. In day 1 and latest parameters, one more thing I have added, that is VO2 max. Day 1 VO2 max was 8.78, and where patient walked for 2.42 minutes only. After this Langan therapy, during Langan therapy, whenever I took follow-up of walk test, where patient was able to walk for 6 minutes and VO2 max improved up to 15.98. Here is a part of discussion where Ayurveda explains about 6 basic principles of treatment, among which first one is Langan therapy. The purpose of Langan treatment is to make the body light by relieving heaviness. Usually, lightness is the quality of Vata dosha, heaviness is due to Kapha dosha. So, whenever there is Kapha dosha increases, or wherever there is blocking of body channels by Kapha dosha, whenever Kapha is associated with Pitta dosha, Langan treatment is adopted. So, conclusion, Lagha, that is lightness of body, reduction of pedal edema, dyspnea, weight reduction, as well as abdominal girth. Hriday Shuddhi, feeling of purity in heart. Udgar Shuddhi, feeling of purity in eruction. Kanta Shuddhi, feeling clarity in throat. Lack of tandra, that is drowsiness. And klum, excretion, appearance of sweat, and appreciation of taste for food, hunger, thirst, and contentment. Thank you. My reference is Charak Samhita Sutrasthan 22/9, 18, 34 and 35. Thank you, sir.
Excellent parametric improvement, Dr. Amruta.
Yeah, thank you, sir.
Yes.
Over to you, Dr. Praveen.
Yes. Excellent presentation, Dr. Amruta. यहाँ पे लंघन में आपने सिर्फ फूड के बारे में बोला है कि कुछ खाने को नहीं दिया था 24 आवर्स, तो यहाँ पे शुद्ध त्रुट निग्रह दोनों रखा था या सिर्फ शुद्धा निग्रह पे रखा था?
शुद्ध त्रुट निग्रह दोनों, नो वाटर, नो फूड एंड नो मेडिकेशन फॉर 24 आवर्स.
Okay. Second question is, you saw you in your presentation there is a periodic improvement after each Langana, and there is a progressive decrease in weight also. वो स्लाइड में बिफोर लंघन आपके पास वेट है क्या?
63.1 kg.
नहीं, लंघन 12 दिन के बाद दिया गया है एवरी 12 days.
No sir, when she came on 18th of April 2020 to clinic, where her first treatment was done with HFRT. After 3 days, that is on 24th, sorry, for 6 days, that is on 24th of April, first Langan was done.
Before, there is a data of before and after weight of Langan. लंघन के पहले का वेट और बाद का वेट ऐसे कुछ डेटा है क्या?
Yes sir, I have mentioned in that slide. Before, when day 1 it was 60. I'm not getting it actually.
आज लंघन मैं कर रहा हूँ तो कल का वेट और लंघन खत्म होने के बाद का वेट ऐसे कुछ है क्या कंपैरिजन?
Yes sir, yes. But that minutely I have not mentioned it. Like after every Langan I have mentioned it.
Okay.
I consider it as a, like a previous first Langan weight was considered as like, and on that basis I calculated it.
Okay.
Yes, Rahul sir.
Excellent presentation, Dr. Amruta.
Thank you, sir.
Have you noted any IVC dilation pre and post? That is, I think this is expected. Even the liver profile is expected in such condition pre and post.
Sir, actually I was not having that data, but liver profile was done as investigation done, advised in that I have mentioned it. I have done it, but I didn't mention it in this. But all the investigations were done and everything was normal. I mean, though the ascites was diagnosed, the previous liver function was also normal, and after that also it was normal. Serum electrolyte was done, pedal edema was reduced, and VO2 max also improved.
Good. So at the end, this is very nice presentation, and keep it up. What the suggestions I given, and in the future practice, please try to keep all the data that we have suggested. Apart from that, all the best. Keep it up.
Thank you, sir.
Dr. Amruta, we have a question for you.
Yes.
Did you monitor this patient as this treatment of NBM would take your patient who is known case of DM in hypoglycemia?
DM in hypoglycemia? No, sir, not in DM, but I actually adopted this treatment to, in many patients with ascites or fluid retention, whatever it is like. So I have that case studies with me, but in DM I have not adopted this one.
I think in the case of DM, if we advise patient for a Shutrut Nigraha,
so your voice is not audible, sir.
Yeah.
Audible now?
Yes.
I think the question is very straight. Someone is trying to ask if we add this intervention in a diabetic patient, whether it will take patient to the hypoglycemia or not, right? So if when we are advising for a Langana, definitely we don't advise patient to take a OHL and or the insulin.
Yes, sir.
So in case of if we don't advise patient to take a OH or insulin, patient will not land up into the hypoglycemia, because normally your body will take care. If you are doing only Shutrut Nigra, the body will take care of itself, and it will secrete or it will sufficient amount of glucose will be available all the time throughout the 24 hours. But if someone is taking the OHA during the Shutrut Nigraha or the insulin, then there are chances the patient may land up into the hypoglycemia. So only that thing we have to avoid while advising patient for a Langan chikitsa.
Right. Any signs of dehydration were seen in this patient?
No, not at all. Urine quantity was monitored during NBM.
Fine. Very nice presentation. So now we'll move on to our next presenter, Dr. Archana Vasge from Chinswad, Pune Clinic. And her topic of presentation is impact of diet modifications, Snehapan and Virechan on lipid profile. Dr. Archana, yes, so you can share your screen and you can start your presentation. You have 8 minutes of time. Come to the first slide, please. And keep your screen on presentation mode, slideshow.
Hello, sir. Am I audible?
Yes, ma'am. So keep it on slideshow.
Hello, myself is Dr. Archana Vasge, working with Madhavbaug since last 10 years. Chinswad Clinic.
Dr. Archana ma'am, can you please on the slideshow mode? Maybe it is there on the left-hand corner above, just above the insert icon.
Besides animation, there is a slideshow tab. Besides animation.
Yes. And
yes.
Here, from beginning. Perfect.
Yes. Please continue, ma'am.
My topic is what is the role of Sasneha Virechan in dyslipidemia. Day by day, the occurrence of cardiovascular diseases are increases. Considering the 17 million deaths were happened in the last 2019, which is non-communicable diseases, out of 38% were happen because of only the CVDs. Number of metabolic disorders are day by day increases in India. So considering the primary and secondary prevention in cardiovascular patients, we need to think about the maintenance or the improvement in the lipid profile, as well as the diabetes, hypertension, and dyslipidemic patient, and thyroid and obesity patient. The reason behind all this metabolic disorder that we know is the sedentary lifestyle, stressful life. All these cardiovascular diseases increases the mortality as well as the morbidity in the Indian population. Considering the low economic or the medium economic group, it is the major harmful condition for our definition of health. To improve the quality of life, we need to prevent this condition in the previous stage of disease. Dyslipidemia is considered as the elevated total cholesterol, LDL, VLDL, or the triglycerides level, as well as the lower level of HDL, that is the high density cholesterol, or the combination of these both abnormalities. Abnormalities of plasma lipid can be result in the predisposition of the coronary, cerebrovascular, or the peripheral vascular artery diseases. This increases the chance of atherosclerosis and increases the risk of myocardial infarction, stress, or peripheral artery diseases. Prevention mode of dyslipidemia is the lifestyle modification in considering the healthy diet, regular exercise, quitting the smoking, alcohol, tobacco like addictions, or maintaining the good control on the diabetes as well as hypertension, reducing the weight, and regular monitoring is very important. I am presenting here 3 cases of mine in which different age group and different medical conditions where I am talking about. Case first is 43 years old female who is a known case of hypothyroidism since last 10 years, diabetes type 2 since last 5 years. On day 1, her medication was tablet thyroxine 50 microgram and the Glynas MF1BD. Day 1, she came with the complaint of weight loss by 8 kg in last 5 months, dyspepsia, dysphagia, severe general weakness. We done her HbA1c in a clinic, which was 13.8. I'm telling all the her reports afterwards. I'm telling her telling about the all cases, and then we see the parameters. Her day 1 visit was planned for the diabetes control, and for that we need to do some investigations which we done. Second case is 59 years old male patient. He is a known case of the post-MI plasty 4 years back. Known case of myocardial infarction in past history. Plasty was done 4 years back. Diabetes type 2, hypertension since last 6 years. His day one medicine was tablet Ecosprin, tablet Telma AM, tablet Metexel 25, and tablet Gmer 1BD. Day one complaint was grade 1 dyspnea on exertion and palpitation. Third case was 47 years old male patient. Post-MI plasty was done 3 years back, diabetes since 3 years. Day one medicine is Clavix AS75/10, tablet Metexel 50, and Glycomed GP1 BD. Day one complaint was dyspnea on grade 1, pedal edema while traveling. Both have completed his stress test outside, and that was normal. So we are not advising them stress test again. If we see so I'm not able to move the next. On day one, first patient, who is a female, came for the diabetes reversal. Her day one BMI was 23.73. HbA1c was 13.98. Cholesterol level, which we done afterwards, is 244.42. Triglyceride level was 627.8. HDL was 28.32, and LDL 90.54. VLDL 125.56. ESR was 37, and thyroid levels 0.34, 54 T3, T4 8.16, and TSH 4.95. Day 30, when we start the treatment, that was the Sasneha Virechan as well as comprehensive diabetic care. After 38 days, we received the result. That is, her BMI was 22.89. We are able to maintain her weight very well after giving her the low carb diet or the low calorie diet. HbA1c reduced from 13.98 to 10.88. Cholesterol level 2.15. Triglyceride level, where we see within a 1 month 6.27 reduced to 1.94, and HDL level 28.32. It increased to 35.52. LDL level also increased, but the VLDL level reduced to 125 to 38.88. ESR level also decreased, which shows the inflammatory markers were reduced, as well as thyroid also the maintained. Here we reduce her thyroxine tablet from 50 to 25. Day 60, after 2 months, we do it again, and we receive the result that BMI is also 22.54. HbA1c now 7.9, and cholesterol 180.7. Triglyceride is 141.4, HDL 47.8, LDL 104.6. Where now we reduce it is also VLDL now 28.82. ESR was 11, and thyroid level are again also the normal. Here we again reduce her thyroid dose also from 25 to 12.5. Her cholesterol, Gmer anti-diabetic medicines also stop. Same result we see in second patient, 59 years old male. Day one, he is the obese patient. Here we have to in first case we need to maintain her weight, but in second patient we have to reduce down his weight. And day one at BMI count was 27.9. Day 30 it was 26.7, and day 60 it was 25.1. HbA1c also reduced 88.2, 6.5, and 5.8 now. We completed his GTT. Cholesterol level, as he has a concern about his cardiovascular risk. So considering his cholesterol 199, it reduced to 150, and today on 60th day, it was 147.43. Triglyceride levels, if you see, 475 reduced to 292, and today, and latest it was 162. HDL level 48 reduced to 41.43 after 1 month, and after 2 months it was 52.2. Nice improvement we can see here after losing the cholesterol level also. LDL 56.3, 51, and now it is at 70. VLDL 95 reduced to 25.23 after the 2 months. In third case also, I'm able to show you 27.3 was the BMI count on day 1. It reduced after 60 days, 24.8. HbA1c 6.1 reduced to 5.9. 220 cholesterol reduced to 1.7. After the 30th day, his lipid levels was so low, considering his statin tablet was continued during the treatment, as he was not willing to reduce down it instantly. So after 30 days, when he saw the result, he himself asked to stop the statin, and after stopping statin, after the month, we saw this result. That was 220 to 101, 140 to 198, 39.4, and LDL was 42 and VLDL was 20.3. Here I use the treatment that is Sasneha Virechon specifically for the liver functioning and to reduce down the cholesterol level, as both the patient have the concern about his cardiovascular risk and they have a major concern about the lipids. So Sasneha Virechon was done with the Dadimadi group every day for 5 days. 30 ml dose was given on day 1, 60, 90, 120 and 150 dose. Every day 30 grams was increased. At that time we see about his appetite with the external Snehan Swedan or centripetal oleation or thermal vasodilation were done. After the 5th dose, 6th day was take a rest, and on 7th day given the Abhayadi Modak 2 tablet in the morning and monitor his weight, mala weight, and after that Sansarjan Kram, and then repeat the cholesterol level, as well as lifestyle modification were given, like portion diet, 800 calorie diet. In first patient, we added few calories with the Gruta, regular exercising, stress management with the pranayam and meditation. Quit addiction. In one patient, he has a problem. He has an addiction of smoking, so quit addiction in that period, and plan for the calm sleep. Some Ayurvedic medicines also given, like Guduchi and Gudmar combination, Haridra Amalki Gokshu combination, Nimba Kerala Lasun Arjun combination, and liver tonic like the Kumari, Sunthi Miri Pipli Twak Tejpatra, which we are using as a aluri liquid. So after that,
Last 2 minutes, ma'am.
Yes. Generally, we are thinking ghee or gluta is not allowed in dyslipidemia or in cardiac patient, since many days few patients are not taking a drop of ghee also. So this is something new where we have to tell the patient that ghee is very important to treat the dyslipidemia, because considering the quality of ghee itself is an antioxidant. If we consider the pathophysiology of increased LDL level or the dyslipidemia, there is a inflammatory markers in vascular arteries, or that's why we need to that's why the LDL levels or dyslipidemia we are seeing to repair that endothelium or repair that dysfunctioning of endothelium. So pathophysiology of this dyslipidemia was corrected by the Greta, as well as if we see the twin cycle of fat metabolism or the lipid metabolism, we need to think about that endogenous and exogenous cycle, as well as all this therapy where the Dadimadi Gruta is basically designed for, or the Adhikar was Pandu, where we have to think about again the liver. So all this pathophysiology, all this metabolic functioning, where the Grita is treated our lipids. So Grita and Virechon both are combinedly used in the dyslipidemia to prevent the dysfunctioning or prevent the cardiovascular disorders. So I use this Virechon Panchakarma therapy, and my patient was improved in such a plan. So thank you so much, sir. Thank you for the listening and thank you for the giving me opportunity for the presentation.
Thank you, Dr. Archana. It was a fantastic presentation. Moving on to Dr. Rahul, sir.
Yes, Archana, it's a delightful presentation, very informative, and you again touched the aspect of dyslipidemia, which is the majorly growing problem in all the developing and developed nation. Dyslipidemia is a condition normally people think they are very skeptical of and they avoid ghee or the fat diet. But here, as per the Ayurveda concept, you have beautifully explained how intake of a ghee and followed by the virechan is not just useful, but it can reverse the disease condition. And as you have reversed the disease condition of all the three patients, I have just one question about it. How was your experience while advising patient for a Grita Sevan for consecutive 3 to 4 days? Because many of time patients are not that compliant. So how was your experience?
Basically, on day one, when we ask about the virechan, so day one we explain them कि घी पीना ये आसान बात नहीं होती है. So if you are mentally ready, क्योंकि जब हम कॉलेज में रहते थे तो हमें पहला टास्क दिया जाता था कि खुद घी पी के देखो, तो आपको ये होने वाला है, आपको ये होने वाला है, जैसे आपको हेडेक होगा, नॉशेटिक फीलिंग होगा, कुछ करने की इच्छा नहीं रहेगी, ये सारी बातें होने वाली है. तो ये सब होने वाला है, लेकिन इसका जो रिजल्ट मिलने वाला है, तो जैसे कि हम कहते हैं कि सागर मंथन के बाद हमें जहर भी मिला था और अमृत भी मिला था, तो ये प्रोसेस रहेगी जैसे आपको अमृत मिलने वाला है, तब जाके वो कंप्लायंस हमें अच्छा मिलता है, क्योंकि पहला प्रिपरेशन ही हम अच्छा करके रखते हैं. अगर ये बातें नहीं समझाई और कुछ भी थोड़ा सा ऊपर नीचे होने लगा तो पेशेंट फिर कंप्लायंस देना छोड़ देता है और उसे ऐसे लगता है कि इसकी वजह से मैं प्रॉब्लम में जा रहा हूँ. तो बेसिकली एक तो घी पीने में ही उसे आगे पहले वाला बहुत कुछ दिमाग में रहता है, तो ये समझाने के बाद जब वो रेडी हो जाता है तो कंप्लायंस की बात नहीं आती है.
Okay, super. Thank you, Dr. Archana. Over to Dr. Praveen, sir.
Yes, very nice presentation and unique topic. जैसा हम 2 दिन से देख रहे हैं कि विरेचन का लिपिड लेवल्स पे क्या इम्पैक्ट है, और डेफिनेटली कि घी से या फैट से लिपिड बढ़ते हैं, ये जो कुछ कॉन्सेप्ट है उसको यहाँ पे बहुत सारे रिसर्चर्स ने लास्ट डे से प्रेजेंट किया है कि अगर लिपिड कम करना है, कोलेस्ट्रॉल लेवल को नीचे लेके आना है, बॉडी का इन्फ्लामेशन कम करना है, तो डेफिनेटली पित्त को कंट्रोल में करने वाला विरेचन ट्रीटमेंट अहम रोल प्ले करता है. सो कीप इट अप डॉक्टर अर्चना.
थैंक यू सर.
प्रवीण सर, एक सवाल आया हुआ है. देयर इज वन क्वेश्चन इन द चैट बॉक्स. डू वी यूज रसकल्प इन माधवबाग प्रैक्टिस? एंड सेकेंडली, अगर while asking to continue allopathic medicines, why are the doctors so confident tapering or continuing allopathic medicines?
Yes.
So I think you are the best person to answer this question.
Yes, रसकल्प माधवबाग में हम यूज करते हैं, लेकिन वो बहुत ही ब्रह्म अस्त्र जैसे रहता है, इस फॉर्मेट में रखे गए हैं. सो इनिशियली जब तक हर्बल मेडिसिन या हर्बल कॉम्बिनेशन से जब तक रिजल्ट मिल रहे हैं, हम हर्बल फॉर्मुलेशन ही यूज करते हैं. रसकल्प तक जाने की नौबत ही नहीं आती. कुछ रेयर 1-2 केस रहते हैं हर एक के डॉक्टर के प्रैक्टिस में, मेरे ख्याल से वो टाइम पे वो रसकल्प यूज करते हैं ड्यू परमिशन विथ हायर अथॉरिटी. तो ये एक सिस्टम यहाँ पे डाल के रखी है. नहीं तो बहुत बार जब हम प्रैक्टिस जब हम स्टार्ट करते हैं या जब कॉलेज से पास आउट हो जाते हैं, तो हमारे दिमाग में सिर्फ आरोग्यवर्धिनी, चंद्रप्रभा रस और ये बड़े बड़े रसों के नाम ही रहते हैं. उसके पीछे का साइंस, उसके पीछे का लॉजिक, ये बहुत कम लोगों को मालूम होता है. तो यहाँ पे माधवबाग में हमारी प्रैक्टिस यही इस प्रकार से ही चलती है कि हर्बल कॉम्बिनेशन से ही हमें आगे बढ़ना है. और इसमें हर्बल कॉम्बिनेशन में भी मुझे लगता है 4 से 5 हर्बल कॉम्बिनेशन के आगे कोई ड्रग माधवबाग का नहीं है. तो ये एक एसेट है माधवबाग का. इसके साथ साथ जो अभी जहाँ पे जो ट्रेंड है कि एलोपैथी मेडिसिन को ऑन रखो या एलोपैथी मेडिसिन को विड्रॉ करने का उतना कॉन्फिडेंस, उतना करेज बीएमएस डॉक्टर में या फिर आयुर्वेदिक प्रैक्टिशनर में कहाँ पे आता है? तो इसके पीछे माधवबाग का जो नॉलेज टैंक है और माधवबाग के जो चीफ मेडिकल ऑफिसर गुरुदत्ता अमीन सर है, जिन्होंने जो कुछ साइंस डेवलप किया है, उसके साथ साथ जो कुछ ड्रग टेपरिंग कमिटीज है जो हमेशा अपडेट हमें करती रहती है कि किस प्रकार से कौन से ड्रग को हमें विड्रॉ करना चाहिए, उसका क्या प्रोसेस होना चाहिए, जिसमें हिरेमठ सर भी है, बहुत सारे दिग्गज डायबिटोलॉजिस्ट, कार्डियोलॉजिस्ट, बहुत सारे लोग हैं जो ये हमें हमेशा गाइड करते हैं कि किस प्रकार से हमें एलोपैथी के ड्रग के डोसेज को ऑन करना है या ऑफ करना है। तो इसके रिगार्डिंग कंटिन्यूअसली ट्रेनिंग, एजुकेशन ये होते रहता है और उसका इम्पैक्ट हम देख रहे हैं। जो न्यूली ज्वाइन पेशेंट भी ऐसे कार्डियक पेशेंट्स के साथ डील कर रहा है जिसको कार्डियोलॉजिस्ट ने ट्रीट करना छोड़ दिया है, जिसके ऊपर कार्डियोलॉजिस्ट ने होप दिखाना छोड़ दिया है। तो ये सारा जो कुछ कॉन्फिडेंस उनमें आता है उसके पीछे कहीं ना कहीं माधवबाग का जो कोर नॉलेज है और माधवबाग का जो ट्रेनिंग अप्रोच है, लर्निंग अप्रोच है, ये है, ऐसे मेरा मानना है।
Thank you, Praveen sir. And thank you, Dr. Archana, for this fantastic presentation. Now we'll move on to our next presenter, Dr. Trupti Pathare. And her topic of presentation is effect of Dugdahar in case of heart failure with preserved ejection fraction with non-improving pedal edema. Yes, Dr. Trupti.
Good afternoon
Welcome.
to all the
Good
respected
evening.
dignitaries. I am Dr. Trupti Pathare, Clinic Head of Madhavbaug Clinic, Koregaon Park. I am going to present a single case study. I will just share my PPT. Okay. So my topic for today is effect of Dugdahar in case of heart failure with preserved ejection fraction with non-improving pedal edema. Patient medical history. This patient was a 65-year-old male patient who was a known case of hypertension from 10 years. He was a frequent traveler, came to clinic on 8th of March 2022 with complaints of pedal edema from about 2 years. He had dyspnea on exertion grade 3. As per NYHA classification, this is dyspnea during daily activity. He also had dyslipidemia from 2 to 3 months. Allopathic medicines, he was taking only Telma 40 once a day. Diagnosis was CHF, chronic heart failure. He had pitting bipedal edema. Dyspnea on exertion was grade 3. Stress test completed was only 2 minutes 36 seconds. His VO2 max was 3.5. His termination criteria was dyspnea. Status did not change in ECG. He was enrolled in heart failure reversal therapy. Treatments given, oral medicines. These medicines were given 1 month prior to Dugdahar. Medicines which were given were Punura, GHA Pro, CAT Pro, ARG tablet, Lipox and Anlex. We can see the contents as given in the PPT. Mostly these medicines were cardioprotective, cardiotonic, diuretic in nature. Lipox is anti-hyperlipidemic or lipolytic in nature. Anulax is laxative and anti-inflammatory in nature. Panchakarma done. We had done our Madhavbaug treatment, heart failure reversal therapy. Panchakarma included all these 4 procedures: centripetal oleation with ARG oil, which was a combination of Arjun, Dashmul, Nirgundi, and Til oil. Thermal vasodilation was done with Dashmul Khada. Thoracic drip was done with Dashmul Khada. PRDA, that is for rectal drug administration, or Basti, was given with ARG liquid. ARG liquid was a combination of Arjun and Punanava extract. So after taking oral medicines and after 4 Panchakarma sittings, his dyspnea on exertion reduced. Patient was a frequent traveler, so he missed oral medicines for 3 to 4 days in the past month. His pedal edema reduced from grade 3 to grade 2, but it was still evident. Method. The patient was advised to have only Godugdha for 2 days, that is on 26th and 27th of March 2022. He had Gir cow milk, which is also known as A2 milk. He was advised to take milk even with medicines as per our Guru Sadiq Sir's advice. No other food or water was allowed. Patient tolerated the process well as he was very fond of milk. First day, patient followed easily. From second day afternoon, he started having some weakness. As you see in the screen, the test after the 2-day diet has been shared on the screen. The lipid test done before on 15th of March 2022, total cholesterol was 205, triglycerides was 220, HDL was 35, LDL was 140, even his uric acid was found out to be 9.6. So as you can see in the picture, patient was really frustrated with his cholesterol report, just like a frustrated CID officer. After the 2-day Dugdahar diet, the test was again repeated on 25th of 2022. His total cholesterol improved to 174, triglycerides improved to 144, HDL improved to 32, LDL improved to 113, even his uric acid improved to 7.6. Patient was very happy with the results. Not only the patient, but his wife was also happy with the results. As you can see in the screen, I have shared the vitals before and after the diet. So before his weight was 94. After the 2-day diet, his weight reduced to 91. His BP before the 2-day diet was 140/98. His BP improved to 118/78. Earlier, his stress test, he completed only 4 minutes, that too with great difficulty. His VO2 max was 3.5. After the process, his stress test improved to 6 minutes. 10 minutes is what he is doing at present. 6 minutes, his VO2 max improved to 12. Telma 40 he used to take before the diet. Telma 40 was stopped 1 week after this. Effects of this diet, as you can see, pedal edema disappeared. His lipid test improved in 1 month. His BP was normal. Tab Telma 40 was 3 kgs was seen in 2 days. Along with above reports, his skin complexion also improved. Patient was so happy that he wanted to repeat the 2-day milk diet again. The reference of Dugdahar in short Chikitsa Asthan. The reference is as follows. Shloka 26. The shloka given in the Adhyaya is as follows. Saptaha Aushtram Tatha Api Mahasam Payaha Pibet Bhojan Vari Varji. Which means Charaka has not only mentioned Dugdahar, but he has also mentioned the duration of Dugdahar. Okay. So in the shlok it is said Saptaha stands for 1 week and Vasa is 1 month. So Dugdahar from 1 week to 1 month has been mentioned by Charakacharya in Chikitsastan. He has also mentioned that along with cow milk, other types of milk can also be used. And again in the shloka it has been mentioned Bhojan Vari Varji, which means food and water has to be strictly avoided in this diet. So according to Ayurveda, cow milk properties are cow milk is laxative in nature. It is a virechak in good. It causes langan because it acts like food and medicine. So because patient is drinking milk, he does not feel like he is starving. So it is a fluid overload. The probable mode of action, because this milk causes viration, cardiac fluid overload and venous pressure decreases. This in turn decreases the capillary hydrostatic pressure and fluid filtration decreases, promotes capillary fluid reabsorption. This in turn reduces edema. I have also searched for Gir cow milk properties on Wikipedia. So Gir cow milk is famously known as A2 milk. It is an excellent source of vitamins like vitamin A, D, and B12. It helps in increasing metabolism and it also helps in building immunity. It also provides omega-3 and 6 fatty acids. It is a rich source of minerals like calcium, potassium, phosphorus. It also helps in the regulation of blood pressure. It balances cholesterol levels and maintains the overall nourishment and well-being of the human body. So my conclusion is that Dugdahar is beneficial for non-improving pedal edema in chronic heart failure patients. Thank you.
Thank you, Dr. Trupti. It was a very unique topic because we in Madhavbaug are known to stop milk and milk products in patients because of Santarpanjanya Vyadhis. And you have taken a very different topic. I will like Praveen sir's comments on this, please.
Yes, unique टॉपिक है और दुग्ध को लेके, जैसे आपने कहा कि दुग्ध को लेके CHF में किस प्रकार से हम रिजल्ट मिले हैं वो कमेंडेबल है। यहाँ पे जो कुछ गाइडलाइन चरकाचार्य जी ने दिए थे कि दुग्ध को सिर्फ दुग्धपान की तरह लिया तो डेफिनेटली रिजल्ट मिलेंगे, उसकी क्वांटिटी और उसके साथ क्या क्या हम ले रहे हैं ये भी मैटर करता है। तो डेफिनेटली कौन सी भी चीज किस मात्रा में ले रहे हैं, कब ले रहे हैं, कौन से समय में ले रहे हैं वो मैटर करती है, और वो दवा या फिर विष की तरह काम वो कर सकती है। तो डेफिनेटली गुड जॉब डॉक्टर तृप्ति।
Yes, so the credit goes to Sadiq sir. He has helped me in this program. And I thank all the dignitaries for giving me this opportunity.
Right. Rahul sir, your comments on this, please.
Yes, very congratulations, Dr. Tripti. And this is the most noble topic, I guess, we have heard throughout since yesterday. And there are so many new topics, but this is the something very why it is different, because as Dr. Omkar has suggested that milk, normally we consider milk content insulin like growth factor. It is a santarpan janya ahar, and maximum patient, those who are coming to Madhavbaug or any Ayurvedic physician who are going for a chronic disorder management, they are santarpan janya vyadi. So this is the reason we normally don't advise patient for the milk. But the laghu ahar, as milk as a laghu ahar, and in absence of any other water, fluid or food content, it may have a different result in, especially in a niram avastha. And you did it very exceptionally very well, and congratulations to you. And I think you and Sadiq sir, if you can produce more cases with the same kind of a unique approach, I think in the future we may think about the Dugdahar, maybe a different kind of a treatment modality.
Thank you, sir.
So with your permission, I will like to spotlight Dr. Sadiq. And there was a question in the chat box. How do we think of Agni and Sam Avastha in such a case? So Dr. Sadiq, if you can answer.
Okay, traditionally speaking, because in this case, patient was improving in most of the scenario. The primary thought was to treat pedal edema. Lipid profile was one of the accidental improvement that we noticed. So I did not go by the traditional approach that we use in Madhavbaug till date. And at that time, Ayurvedic approach was used to keep the patient where, like for example, we did NBM in ascites cases. So wherever there is a fluid overload, this kind of treatment have been used in past. The same logic was used here. And honestly, in my experiences, if the patient is going to be kept only on milk, Agni Vichar is also not that important. Most of the patient with even lesser of Agni or less Abhyavaran Shakti can also, in fact, they manage to survive the process with less frustration. So that's what we have observed. The point is here, as I said, but in this case, I think so. We had kept one Pachan medicine in this case because patient was also having a lot of other GI issues. So yeah, one Pachan medicine was there along that period.
Great. So we need to collect some more case studies like this so that we can come to a concrete conclusion. Yes, thanks a lot, Dr. Sadiq Khan and Dr. Trupti Pathare for a fantastic presentation. So now we'll move on to our next presenter. Yes, Dr. Jyoti Shirsagar from Aund Clinic, Pune. And this is a very interesting case. Management of severe psoriasis complicated by recurrent cellulitis in known case of DM with the help of Rakta Mokshan, Ayurvedic medicines and lifestyle modification. Dr. Jyoti, welcome. Good evening. And
Good evening,
best
sir.
wishes for your presentation. You have 8 minutes of time.
Yes, sir.
You need to start screen sharing. Yes.
Am I audible?
Yes, ma'am.
Screen दिख रहा है, sir?
Yes.
Perfect.
It's visible.
Yes. गुड इवनिंग सर, गुड इवनिंग ऑल रिस्पेक्टेड डॉक्टर्स। एक्चुअली टी टाइम हो गया है और दिन भर बहुत अच्छे प्रेजेंटेशन चालू है, फिर भी अभी लास्ट 2 ही प्रेजेंटेशंस बाकी है, तो पेशेंसफुली आप सब लोग रुकिए और ये सब सुनिए, ठीक है। So myself is Dr. Jyoti Shirsagar, clinic head from Aundh branch. My today's topic is management of severe psoriasis complicated by recurrent cellulitis in known case of DM with the help of Rakta Mokshan, Ayurvedic medicine and lifestyle modification. Just a minute, sir. So my question is, what is the role of Rakta Mokshan leech therapy to prevent the complications of steroids or antibiotics in severe psoriasis? We all know psoriasis is a chronic immune-mediated inflammatory condition. Psoriasis affects physiological and psychosocial aspect of patient's life. In conventional system of medicine, there is a no known permanent cure for psoriasis. It depends mainly on steroids, antibiotics, which may cause complications. तो मैंने जब मेरा केस डिस्क्रिप्शन, मेरा केस है 39 इयर्स ओल्ड फीमेल पेशेंट है, जो ओबेसिटी फ्रॉम चाइल्डहुड, सोरियासिस सिंस 2007 14 इयर्स, सेलुलाइटिस सिंस 2007 14 इयर्स, then hypertension 2010 11 years, diabetes, gestational diabetes in 2014, then depression, insomnia and leukorrhea. Family history में mother, father, history of hypertension, brother, diabetes, and patient was hospitalized due to cellulitis multiple times. पेशेंट जब मेरे पास आए थे डे 1 को, तब वो डिस्चार्ज कार्ड लेके ही आए थे हॉस्पिटल से, सेलुलाइटिस के लिए वो एडमिशन लिए थे, और पेशेंट के पास पेशेंट इज ऑन मल्टीपल मेडिसिन, स्टीरॉइड्स, देन एंटीबायोटिक्स, एंटीपायरेटिक्स, एंटी इंफ्लेमेटरी मेडिसिन उनके चालू थे, एनाल्जेसिक्स, देन एंटी हाइपरटेंसिव, कुछ एंटी डिप्रेसेंट मेडिसिन भी उनके चालू थी, देन उसके साथ ही डायबिटीज के भी मेडिसिन OHA चालू थे। नेक्स्ट इन्वेस्टिगेशंस, डे 1 को उनका हीमोग्लोबिन 8.5, HbA1c 7.2, RBS 155, यूरिक एसिड 7.01, सीरम क्रिएटिन 0.7 एंड 2D को LVF 60%, डायस्टोलिक डिस्फंक्शन 2। उसके बाद का भी इन्वेस्टिगेशंस है, जब ट्रीटमेंट उनका खत्म हुआ था, हीमोग्लोबिन राइज टू 10, हीमोग्लोबिन 7.2 से 5.2, RBS 108, यूरिक एसिड 5, सीरम क्रिएटिन 5.5 एंड LVF और 2D को सेम था। डायग्नोसिस, सीवियर सोरियासिस विद सेलुलाइटिस इन DM एंड HDM पेशेंट। ट्रीटमेंट इंफॉर्मेशन, पेशेंट स्टार्ट में हमें विद मेडिकेशन ही आया था, तो जो भी कुछ कॉम्प्लिकेशंस थे सेलुलाइटिस एंड सोरियासिस के, वो सबसाइड हो गए थे, तो उसके हिसाब से ही उनका मेडिसिन कुछ टेपरिंग डोज में बंद किया। देन मेन मेटाबॉलिक डिसऑर्डर्स हमारे सामने थे, डायबिटीज एंड हाइपरटेंशन, तो उसके लिए ही हमने लाइन ऑफ ट्रीटमेंट स्टार्ट किया था, क्योंकि उपद्रव अगर आते हैं तो ही उनका ट्रीटमेंट हमें करना है। तो स्टार्ट विथ ओरल मेडिकेशन, उसमें हमने दीपन, पाचन, विषग्न मेडिसिन, कुछ वर्ण्य मेडिसिन, रक्त शुद्धिकरण, पित्तग्न, मेदोहर, मध्य रसायन, घृत सेवन एंड कृमिग्न मेडिसिन हमने स्टार्ट किए थे। देन डाइट हमने दिया था, जो माधवबाग का डायबिटिक डाइट बॉक्स हमने दिया था, जिसमें लो कैलोरीज, हाई प्रोटीन, एंटी इंफ्लेमेटरी डाइट विथ फ्रूट्स एंड वेजिटेबल्स, एंटी ऑक्सीडेंट्स एडवाइस किया, जो लेप्टिन हार्मोन रेजिस्टेंसिविटी बढ़ाता है। देन हमने पंचकर्मा स्टार्ट किया। फर्स्ट थिंग हमने पंचकर्मा बस्ती ट्रीटमेंट से स्टार्ट किया, जिसमें सेंट्रिपिटल ओलिएशन मींस स्नेहन, थर्मल वैसोडाइलेशन, स्वेदन, PRDA पर रेक्टल ड्रग एडमिनिस्ट्रेशन स्टार्ट किया था, जो हमने फोकस डायबिटीज एंड हाइपरटेंशन, ये 2 डिसीज के ऊपर स्टार्ट किया था। हमें धीरे धीरे वेट लॉस भी उनके साथ मिल रहा था ड्यू टू डाइट एंड ऑल। थोड़ा सा हमने लाइफस्टाइल मॉडिफिकेशन भी उनको बोला था, उनका नाइट का जॉब था तो हमने उसको थोड़ा सा शिफ्ट कर दिया था। देन सेडेंटरी लाइफस्टाइल था, सेलुलाइटिस एंड सोरियासिस फीट पे ही था तो उनको ज्यादा एक्सरसाइज करना पॉसिबल नहीं हो रहा था, तो हमें वेट में और सेलुलाइटिस एंड सोरियासिस का भी थोड़ा सा कंसर्न था उनको, तो इसलिए हमने बाद में फिर विरेचन ट्रीटमेंट भी उनको एडवाइस किया था। विरेचन हमने 2 बार एडवाइस किया। फर्स्ट विरेचन ही उनका प्रवर शुद्धि हो गया था, जहाँ पे हमने 5 डेज उनको स्नेहपान दिया पंचतिक्त भृत, एंड उसके बाद हमने उनको अमारी स्नेहपान एंड इच्छा विधि रस दिया था। उसके बाद उनको 22 वेग आए थे जो प्रवर शुद्धि के पास थे। बट स्ट्रेंज थिंग इज दैट कि इतने 22 वेग आने के बाद भी पेशेंट एब्सोल्युटली नॉर्मल था, उल्टा वो हैप्पी था कि वेट लॉस हुआ है, देन एनर्जेटिक फील हो रहा था। तो ऐसा कुछ नहीं है कि आयुर्वेद से जो पंचकर्म हम सजेस्ट करते हैं जैसे वमन या फिर विरेचन, उससे पेशेंट बहुत ही सीरियस कंडीशन में जाता है। सेकेंड थिंग, उनको हमने शिरोधारा भी एडवाइस किया। शिरोधारा रिलैक्सिंग, सूदिंग, कामिंग इफेक्ट्स ऑन माइंड। तो उनका जो एंजाइटी लेवल था, उनका जो इंसोम्निया ये डिसीज था, तो उसके हिसाब से उनको थोड़ा सा इम्प्रूवमेंट उससे मिल रहा था। ये सब होने के बाद जैसे स्किन डिसऑर्डर्स हम बोलते हैं, उपद्रव हमें मिलते हैं। डायबिटिक पेशेंट्स में इम्यूनोसप्रेसेंट होने के कारण और डायबिटीज के अफेक्शन, डायबिटीज के साइड इफेक्ट जो है वो स्किन के ऊपर हमें ज्यादा दिखते हैं। तो पेशेंट्स में ऑलरेडी सेलुलाइटिस एंड सोरियासिस था ही, तो उसका जो रिकरेंस है वो हमें दिखने लगा था। उसके साथ हमने फर्स्ट तो उनको धावन, देन ऑयल एप्लीकेशन ये सब सजेस्ट किया था, बट उससे हमें रिजल्ट इतना मिल नहीं रहा था। सो व्रणशोथ में जो हमें व्रणशोथ में जो हमें एडवाइस किया है ट्रीटमेंट, स्नेहरी भी ही क्रिया योगेने तथा लेपनैरेपि याक्तस्तु व्याधयः शांति तथा सम्यक सीरा व्यधात। If disease cannot be cured by other treatments like snehan or lepan, then Siravad is treatment of choice. Same, yatra raktam adhishtanam vikaranam vikarinam anyatra hi tatha dushyam karmaram trabhamam tatah. By this treatment, we can directly minimize dushti of rakta dhatu and pitta dosha. Because of this, it helps to reduce local inflammation in Vranashotha and will help to minimize symptoms of Vranashotha. जैसे ही हमने लीच थेरेपी स्टार्ट किया, हमें ट्रिमेंडस रिजल्ट मिलने लगे। जैसे कि रेडनेस सीवियर था वो कम होने लगा, रेड स्ट्रिक्स भी थे, स्वेलिंग उत्सेक था, देन उष्ण स्पर्श था, पेन था, टेंडरनेस था, लीकिंग ऑफ येलो एंड पस फ्लूइड था, जो सब सबसाइड हो गया था। और भी कुछ पैरामीटर्स है जिसमें हमने रिजल्ट मिला है, जैसे एपेटाइट, एनोरेक्सिया था पेशेंट को स्टार्टिंग में, तो उसका अग्निवर्धन हो रहा था धीरे धीरे। देन स्लीप पैटर्न भी उनका इम्प्रूव हो रहा था। कॉन्स्टिपेटेड पेशेंट रहता था, उसमें भी हमें रिजल्ट मिला। देन पीटिंग एडिमा 3+ था, वो एडिमा भी सबसाइड होने लगा। HbA1c 7.2 से 5.2। देन वेट 114.1 था जो 108, जो रिड्यूस बाय 6 kg। BMI 48.9 से 46, रिड्यूस बाय 2। देन abdominal curve 133 से 122, रिड्यूस बाय 11 सेंटीमीटर। मॉडर्न मेडिकेशंस भी कुछ थे उनके जो एंटी हाइपरटेंसिव थे या फिर डायबिटीज के लिए थे, वो सब रिड्यूस कर दिए गए। ब्लड प्रेशर 150/100 एंड आफ्टर ट्रीटमेंट 130/80 पे आने लगा। इचिंग एट नाइट, हाइपर एसिडिटी, ल्यूकोरिया, headache, burning maturation, dryness of skin, ankle joint pain with restricted movements, ये बहुत सारे कंप्लेंट्स लेके हमारे पास आए थे डे 1 को। तो जैसे ही हमें लीच थेरेपी का रिजल्ट मिलने लगा, तो ये सब कंप्लेंट्स में हमें अच्छे तरीके से चेंजेस दिखने लगे। ये कुछ फोटोग्राफ्स हैं जो हमने लीच थेरेपी के दौरान ली थी। जो फर्स्ट डे का फोटो था जिसमें सिवियर सेलुलाइटिस था, मतलब ऐसा लगा कि स्टेरॉइड्स के बगैर दूसरा काम नहीं हो सकता है। बट पेशेंट बहुत ही घबराए थे क्योंकि उनको हर एक ईयर में मिनिमम 2 to 3 टाइम्स हॉस्पिटलाइज होना पड़ता था ड्यू टू सेलुलाइटिस रिकरेंस होने के कारण। तो उनको जैसे ही स्टेरॉइड स्टार्ट किया जाता था, उनको डिप्रेशन, इंसोम्निया, वेट बढ़ना, ये सब कंप्लेंट स्टार्ट हो जाता था। तो पेशेंट को इस बार तैयार ही नहीं थे हॉस्पिटलाइज होने के लिए। तो फिर हमने लीच थेरेपी जैसे स्टार्ट किया, आप देख रहे फोटोज में, लीच थेरेपी से धीरे धीरे उसका स्वेलिंग, रेडनेस ये सब कम होते दिखाई दिया, तो हमने लीच थेरेपी एटलीस्ट 4 to 5 टाइम्स रिपीट किया है 15 डेज के गैप से। तो आप लास्ट फोटो में देख सकते हैं कि सोरियासिस देन सेलुलाइटिस ये सब बहुत अच्छी तरीके से रिड्यूस हुआ है विदाउट एनी हॉस्पिटलाइजेशन। ये पेशेंट का बिफोर एंड आफ्टर का फोटो है, जिसमें पेशेंट का बहुत ही अच्छा रूप दिखाई देता है। यूजुअली पेशेंट ओबेसिटी एंड अदर ये कॉम्प्लिकेशंस के कारण सोशल उनका लाइफ थोड़ा सा डिस्टर्बेंस रहता है। पेशेंट भी ऐसे ही थे, बट जैसे उनका वेट रिड्यूस होते गया, उनका सेलुलाइटिस, सोरियासिस कम होते गया, पेशेंट बहुत ही हैप्पी थे। लास्ट पार्ट डिस्कशन, leech therapy improves blood circulation and reduces congestion is due to presence of carboxy peptidase, A inhibitor, histamine-like substances and act. Thus, it corrects diabetic in microgenopathy. It has peripheral vasodilator constituent in saliva, which improves blood circulation. It has anti-inflammatory action on nerves. It acts as Vrana Shodhak and Vrana Ropak. And my conclusion is alternative therapies like leech therapy proves very effective for treating of chronic diseases like psoriasis and cellulitis. It is able to stop recurrent cellulitis and depend on antibiotic and steroid cycle. Reference from International Journal of Applied Ayurveda Research. And thank you so much.
Super presentation, Dr. Jyoti. Your views on this, Dr. Rahul?
I think I don't need to speak anything about Dr. Jyoti's presentation. The participants are praising her like anything. If you can see, go to a chat box, Dr. Jyoti, and you can see everyone. I think everyone is feeling like see, this is the way Ayurvedic physician. This is the attitude of Ayurveda physician, and this is the change the Ayurveda physician can bring in the this kind of incurable disorders. Hats off to Dr. Jyoti, and you literally made us feel proud that we are now that condition you have treated is the condition where many of us skin specialists and other doctors, they must have been given. But you you stand there, you made a change in the patient's life, you corrected her diet, you bring her HbA1c from a diabetic to the almost to the normal, and with all the types of Hetu Viparit Chikitsa, Vyadhi Viparit Chikitsa, and Dosha Viparit Chikitsa, you used all the three aspects, the 360-degree approach of Ayurveda treatment. And the results are there, and the patients with the happy face, and I'm just feeling the goosebumps right now. And God bless you, Dr. Jyoti.
Yes, sir. Thank you so much.
Yes, जैसा अभी राहुल सर ने कहा कि ये केस हैंडल करने के लिए बहुत ज्यादा करेज की आवश्यकता होती है, क्योंकि अभी अभी आपने माधवबाग के साथ जर्नी शुरू की है, और इस प्रकार के केस को हैंडल करना, एड ऑन टू दिस डायबिटीज पेशेंट में लीच अप्लाई करना है, नहीं करना है, ब्लीडिंग स्टॉप होगा नहीं होगा या कंटिन्यूअसली वैसे ही रहेगा, बहुत सारे क्वेश्चन मार्क एज अ फिजिशियन, एज अ वैद्य उसके दिमाग में चलते रहते हैं। इंस्पाइट ऑफ दैट आपने अच्छी मूव करते हुए, सारे एस्पेक्ट को अंडरस्टैंड करते हुए इस केस में अच्छे रिजल्ट्स दिए हैं। तो इसका क्रेडिट जितना आपको जाता है, उतना माधवबाग का लर्निंग एंड डेवलपमेंट डिपार्टमेंट जो हमेशा नए डॉक्टर के ऊपर जो काम करते रहता है, उसको इस काबिल बनाता है कि वो उनके सामने आए हुए ईच एंड एवरी पेशेंट्स के साथ डील कर पाए, उनको जस्टिस दे पाए, और हर एक पेशेंट का डिसीज रिवर्स कर पाए। तो हैट्स ऑफ टू यू एंड आवर लर्निंग एंड डेवलपमेंट डिपार्टमेंट। थैंक यू, थैंक यू, थैंक यू।
And one more thing, sir, I want to share कि सबसे बड़ा योगदान तो सादिक खान सर एंड ओंकार सर का है, क्योंकि पेशेंट्स में हर एक ने कुछ भी ट्रीटमेंट हमने अगर पेशेंट को दिया तो अलग अलग कॉम्प्लिकेशंस हमें दिखाई पड़ते थे। जैसे स्किन के लिए दिया तो इधर डायबिटीज, हाइपरटेंशन, ये सब फ्लक्चुएशंस हो रहे थे। तो बहुत बार हमने सादिक खान सर को परेशान किया, ओंकार सर को परेशान किया, पेशेंट का भी फोन चालू था, मेरा भी फोन चालू रहता था। बट हैट्स ऑफ कि सब डॉक्टर, सब मेंटर्स, कभी भी हमने क्वेश्चन डाला और उन्होंने आंसर नहीं किया, ऐसे नहीं होता है। तो थैंक्स टू ऑल डॉक्टर्स एंड ऑल मेंटर्स, थैंक यू सो मच।
Thank you, Sadiq sir, and thank you, Jyoti ma'am, for this presentation. We'll now move on to our next presenter. Wow, we have a fantastic presenter with us, Dr. Dipali Deshmukh madam, who is in Madhavbaug since last 18 years, and she will be presenting from our Khopoli hospital. And the topic of our presentation is anti-pro-BNP reduced by Ayurvedic Panchakarma medicines and in chronic heart failure patients. Over to you, Dipali ma'am. Welcome. Good evening, ma'am.
I am audible?
Yes, ma'am.
Audible, ma'am.
Yes. Thank you for giving me this opportunity. First time in 18 years, I am showing this presentation. And my topic is anti-pro-BNP reduced in chronic heart failure patient with Ayurvedic Panchakarma and oral medicines. So I saw so many patients, 10,000 plus patients in chronic heart failure patient. I am showing one patient's case study. His age was 45 years.
You need to share your screen first.
Please share your screen. Your presentation needs to be shared.
Okay, sir.
There is a share screen button at the bottom, ma'am.
Green color button.
Share screen ला हा त्याच्यानंतर तुमचं पीपीटी मोड ऑन करा आणि ऑल द बेस्ट. पहिल्यापासून स्टार्ट करा परत.
Doctors who don't know about Dr. Dipali Deshmukh ma'am, I'll just like to give a brief introduction. She is the doctor who has given Khopoli Hospital OPD department a huge success, because she is handling many patients every day since last 18 years now. As Jassi told, she has handled more than 10,000 patients till now, and beautiful results have been given by her in Khopoli Hospital. So today we are blessed to have her presentation in front of all. Yes, Dipali ma'am, your presentation can be seen now. Just put it on presentation mode, slideshow mode. Yes, ma'am. Rahul sir, if you can help Dipali ma'am. There is a, yes, but it needs to be on the presentation mode, ma'am. Slide showचं जे बटन आहे ना वरती ॲनिमेशनच्या बाजूला, तिकडे क्लिक करा. Slideshow, ma'am, besides animation. Yes, please click it, and from beginning, first one, first one. Yes, ma'am. Click करा दे. Unmute, ma'am.
Yes. My topic is NT-proBNP reduces in chronic heart failure patient with Ayurvedic Panchakarma and oral medicines. So
मॅडम फर्स्ट स्लाइड वर घ्या, तुमची 7th स्लाइड दिसते. फ्रॉम बिगिनिंगला क्लिक करा एकदा स्लाइड शो मध्ये.
सर दिसते आता फर्स्ट
नहीं दिसत आहे. राहुल सर, इफ यू कैन हेल्प. डॉक्टर दीपाली मैम. ओके, रिज्यूम स्लाइड शो त्याला क्लिक करा मॅम.
सर सुरू झालं आता. होतंय सर आता.
अजूनही नाही. Rahul sir, am I audible?
Yes sir, you are audible.
Yes. Madam, resume slide show kara. Rahul sir, if you have the presentation with you and if you can share the screen.
Click on from beginning.
सर आता झालंय सुरू. बिगिनिंग सुरू.
नाही अजून. रिज्यूम स्लाइड शो ला करा.
केलंय सर.
नाही होत आहे. स्टॉप करून परत शेअर करा.
परत शेअर द स्क्रीन कर.
तर आता होतंय.
डबल क्लिक करा.
बॉटमला राईट साइडच्या बॉटमला जे हे आहे स्लाइड शोचं बटन आहे त्याच्यावर क्लिक करा. नाही शेअर झालं. ठीक आहे, माझ्यामध्ये जाऊ दे असंच पुढे.
Yes ma'am, no problem. Yeah, relax. You have 8 minutes of time.
My topic is NT-proBNP in chronic heart failure patient is reduced down by Panchakarma and oral medicines.
Madam, your screen is not visible. Yes.
Yes, thank you, Dr. Rahul.
Thank you, sir.
Yeah.
Yes, ma'am.
Yes. I am showing you one case study of chronic heart failure patient. His age is 45 years old man. Known case of DM and HTM since 2012. He complains of dyspnea on exertion grade 3rd, palpitation, ghabrat, and pitting type of edema. And he went to allopathic hospital, and they show that the 2D echo was EF was 15% and NT-proBNP was 25,000. And they advised them high risk angiography and bypass surgery and next pacemaker insertion or heart transplant. And patient refused all the things because they said that you have to stop your job
as he was a general manager in international company, and he has to stop his his job profile. He need to fly twice in a week, so he refused to go the intervention. I went to intervention, and he came to me at February 2018 in Madhavbaug hospital as complaining of dyspnea, and I took his 2D echo. It was EF 15% and NT-proBNP was 25,000, and I started his treatment with oral medicines, Panchakarma, in Sampurna Hruday Shuddhikaran, and our lifestyle modification. In February 2018, we continuously follow up with medication and all the things, and in March 2018, after first follow-up, his 2D echo we done, it was 25% EF, and NT-proBNP was 2000, and in next continuous we were following the patient. December 2018, the EF was 36%. In August 2019, its EF was 40% and NT-proBNP was 325. Because of personal conditions and due to COVID situation, he didn't come for follow-up till February 20, and in February 20, he suddenly came with complaints of dyspnea on exertion, grade 3rd, pedal edema, palpitation, घबराहट, and suddenly we done his 2D echo. The EF reduced to 20%, and his NT-proBNP was 4,125. We started his treatment with our Panchakarma, oral medicines, and lifestyle modification with allopathic medicine. Since to February 2020, continuously we are doing his follow-up once a month, and we are taking his care with diet, exercise, and oral medication. And in this time, since February 2020, his EF was 20%, and the NT-proBNP was 4,125. It reduced down to in March 22, it reduced down to 42% EF, and NT-proBNP reduced down to 292. जहां उसका NT-proBNP 4,125 था, 20% EF था. उसके बाद हमने उसका पंचकर्मा ओरल मेडिसिन में अर्जुन क्षीरपाक हमने उनको 2 टाइम किया 40 ml आफ्टर मिल, A2 मिल्क ही था. उसके साथ उनको कैप्सूल शोथग्नि शोथहर काम करता है 2 BD बिफोर मिल, एंड अश्वगंधा, ऐसे हमने ओरल मेडिसिन दिए. उसके साथ संपूर्ण हृदय शुद्धिकरण में हमने स्नेहन, स्वेदन, हृदय धारा, बस्ती ये ट्रीटमेंट करके उनका लोड कम करके उनका EF हमने इम्प्रूव किया. और विथ दिस वी रिस्ट्रिक्टेड इज वाटर एंड साल्ट रिस्ट्रिक्शन हमने किया. और उसके साथ उनको ठंडा जो पदार्थ होते, जितने कोल्ड सब्सटेंसेस होते हैं, इट इज वैसोकॉन्स्ट्रिक्शन करते हैं, इसलिए हमने उनका आइसक्रीम, कोल्ड ड्रिंक्स, ठंड सब पे उनके बंद किए. अभी टिल मार्च 2022, अभी लास्ट मंथ में हमने फिर से उनका EF किया तो 42% EF दिखा रहा है, और उनका NT-proBNP 292 यानी 292 इतना ही दिखा रहा है. इनका सिडमस और एलोपैथी सब मेडिसिन चालू था. सिडमस फर्स्ट टाइम 1 BD चालू था, फिर हाफ BD किया. अभी लास्ट फरवरी में उनका हाफ OD था. अभी इनका आज मार्च में जो हमने लास्ट फॉलो किया उसमें उनका सिडमस टोटली हमने बंद किया है. यानी इसका कंक्लूजन ये है कि हमारे आयुर्वेदिक पंचकर्म मेडिसिन एंड लाइफस्टाइल मॉडिफिकेशन से NT-proBNP भी इम्प्रूव होता है, पेशेंट का EF भी इम्प्रूव होता है, उसके साथ उनका लाइफ स्पैन भी बढ़ता है. जैसे अभी राहुल सर ने बताया था कि जब हम क्रोनिक हार्ट फेलियर पेशेंट में 1 ईयर में 23% मोर्टेलिटी रेट होता है, तो इसमें हमने अभी उनको 5 इयर्स का स्पैन इम्प्रूव करके दिया है, यानी क्वांटिटी प्लस क्वालिटी ऑफ लाइफ उनका हमने इम्प्रूव किया है विथ आवर आयुर्वेदिक मेडिसिन एंड पंचकर्मा। उसके साथ हमने उनको, जिसके डॉक्टर ने उनको, एलोपैथी डॉक्टर ने कहा था कि आप फ्लाई नहीं कर पाएंगे, आपका काम छोड़ना पड़ेगा, आपको अभी घर में ही बैठना पड़ेगा, तो अभी वो प्रॉपर उनका जो जनरल मैनेजर का पोजीशन है, इंटरनेशनल वो ट्रैवलिंग करते हैं, वो सब कुछ कंटिन्यूअस उनका चालू है विथ देयर प्रॉपर प्रॉपर मेडिकेशन, लाइफस्टाइल मॉडिफिकेशन, डाइट एंड एक्सरसाइज, वो सब प्रॉपर उधर भी जाके भी वो फॉलो करते हैं। तो टिल अभी वो एकदम अच्छे हैं। तो 5 इयर्स हमने उनका इम्प्रूव किया है। तो विथ आयुर्वेदिक मेडिसिन एंड पंचकर्मा and our treatment, patient can improve his lifespan and quantity plus quality of life. And it reduce down their anti-proBNP level and EF increased. Thank you.
Thank you, ma'am. It was a fantastic presentation. Moving on to Dr. Rahul, sir.
Dr. Deepali, ma'am, I'm very happy to see you presenting this wonderful case because, as you rightly mentioned, chronic heart failure condition is very fatal, and especially the patient with a high level of anti-proBNP. While treating such patient, we need a lot of courage and a lot of knowledge. And you are with the experience of 18 years of experience of a clinical cardiology. You treated, you justify the Ayurveda very well in this case, and superb job done, ma'am. Hats off to you.
Yes, Praveen sir, your views on this?
Yes, जैसे अभी केस प्रेजेंट किया है मैडम ने, डेफिनेटली एंटी-प्रोबीएनपी ये गोल्ड स्टैंडर्ड पैरामीटर क्रोनिक हार्ट फेलियर का, और अगर इसमें हम किसी पेशेंट में इंप्रूवमेंट लेके आते हैं तो कोई भी दुनिया का डॉक्टर चैलेंज नहीं कर सकता है कि यस आयुर्वेदिक ट्रीटमेंट ने इंप्रूवमेंट नहीं मिला है। तो गोल्ड स्टैंडर्ड पैरामीटर पे इंप्रूवमेंट दिखाना ये बहुत बड़ी बात होती है, और दीपाली मैडम और माधवबाग के सभी डॉक्टर्स ये कर रहे हैं, तो सबको मैं हैट्स ऑफ कहता हूँ। थैंक यू।
Yes, so thank you for your comments. Thank you, Dipali ma'am, for your presentation. Now we are moving to the second last presenter of today, Dr. Hina Furia from Dadar West, Mumbai Clinic, and her topic of presentation is congestive chronic failure, congestive cardiac failure. Dr. Hina?
Yes, sir.
Yes, you have 8 minutes of time.
Yes, sir.
Best wishes for your presentation.
Thank you, sir. Good evening, all. Good evening, all. My topic is efficacy of Dugdha to improve mortality and morbidity in chronic congestive cardiac failure. Myself, Dr. Hina Furia. I am practicing with Madhavbaug since 2012 as a clinic head in Dadar West Clinic. My main objective to select this topic, as we all know that heart failure can severely decrease the functional capacity of patient and increase the mortality risk. So it is important to diagnose and effectively treat the disease to prevent hospitalizations and improve quality of life and enhance patient outcomes. The mortality rate for hospitalization for heart failure is estimated at around 10% at 30 days, 22% at 1 year, and 42% at 5 years. This increases to greater than 50% for patient with NYHA class 4 and stage D heart failure. Increased hospitalization rate also increases financial burden. However, this can be avoided with Ayurvedic interventions. At present, the current treatments which are available for CCF are just medical management or treating the underlying cause with surgery. I have taken a case series of 3 patients in whom I have been treating that patients from from the year 2017, presented with the symptoms of NYHA class 4, bilateral pedal edema, abdominal heaviness, dry cough, and orthopnea. this medical history of all the 3 patients in front of us. The patient A was 62 years male patient. He is presented with the above symptoms in 2019 with low ejection fraction. The patient B was 61 years female. She was presented in 2021 with very low ejection fraction of 10 EF. And the third patient was a preserved ejection fraction, 48 years, and she has been visited to me in 2017 with preserved ejection fraction, but still she was in congestive cardiac failure. The first patient, what was there? It was diagnosed with diabetes mellitus in 2011, then dilated cardiomyopathy and CCF in 2019. From 2019, he is under our treatment, and still till today, he is not never ended up in any hospitalization or any other medical care. Patient B has been diagnosed with diabetes mellitus in 2016, then dilated cardiomyopathy and congestive cardiac failure. And the patient C, which is diagnosed with hypertension and hypothyroid in 2015, after which she has suffered from atrial fibrillation. For atrial fibrillation, she has been treated with cardioversion thrice. After cardioversion, she presented with the symptoms of congestive cardiac failure, which was diagnosed at our clinic. And all patients were presented with this clinical findings. Abdominal was tense, fluid around the lungs. I found creps in the basal areas, pedal edema. In fact, edema was still like the whole body was edematous. You can't identify only pedal edema. Pedal edema is still thigh region. Abdomen was swelling, and patient was not able to sleep. I used to take ECG while in supine position. You can say in the sitting position. It was not able to take an ECG in supine position. So almost sitting position, I have been taken the ECG. For other investigations, I had found chest X-ray, USG abdomen, RFT, LFT, CBC, and 2D echo. I found pleural effusion in chest X-ray, and USG abdomen. I found ascites from moderate to severe ascites. Now the line of action, like what I did was like patient was initially with this parameters. Weight was around 80 kgs on the first day for the A patient. B patient was 72 kgs weight, and third patient was 81 kgs, where we found BMI to be 28.6, 30, and 40 kgs respectively. 40 BMI, sorry. The abdominal girth was 108, 106, and 115, the 3 patients, and the pulse rate was higher side, 108, and 123 and 150 for the 3 patients. BP was 117, 72, 120, 80, 150, 90, and EF was in the first patient who was from 2019, the EF was 20%, the 2021 patient EF was 10%, and the last patient EF was 55%. As we all know that we also see for the VO2 max as they are class 4 NYHA classification. So VO2 max was less than 3.5. They were end stage congestive cardiac failure. Patient regretted admission, so I have treated them. And with the initial medicines were with patients were already on some allopathy medicines. The first patient was on Lasix, Glador, Jalra, Deriphyllin, and Ditor, which later on with our interrogation we stopped for the treatment. Lasix was being stopped and was shifted on to Ditor later on, and diabetes medicines was reduced, and Deriphyllin was stopped completely. The B patient, she was only on Glador M2, and later on we started with Vimada, BD Rose, Lesilactone, Lemataxel, Digoxin, because she was just 10% EF, and we don't want our patient to end up in some other critical conditions. So we have been started with Vimada also. And the third patient was on Selocan XL, Stamlo, and Warfarin, and Thyronol. Here the interrogation in the second patient was done after basic treatment of my my diagnosis was CCF with pleural effusion and ascites, and mainly the diagnosis I made is that we have to first treat ascites, and accordingly we can go further for the management of congestive cardiac failure. Main therapy was the diet therapy. Interrogation was done by me. The second, oral medication and panchkarma therapy. In diet management, I used cow milk, Dugdha Ahar. Dugdha Ahar was used in 1 liter from morning 8 a.m. to evening 8 a.m. in divided doses, like morning, mid-meal, mid-evening, every time 200 ml without any milk, water or no other food. OHA had been stopped in that time, but still we found that sugar and everything was normal during that phase. With cow milk, I used to treat patient for almost 7 days. First 7 days, no other therapy was introduced. No panchkarma was introduced initially. Only cow milk was given for the 7 days, and I found that patient was reduced from the weight of like higher 6 to 8 kg weight loss in just 3 days, and or water retention was reduced, and patient was Agni was better. He was feeling appetite was better. His motions were passing well. And then I shifted him to moon diet, and then our traditional diet kit and everything. Fluid intake was always restricted from 1 liter for EF, low EF, and 1.5 liters for the preserved ejection fraction patient. Oral medications were used was SMP Churna, Linolif, and Arjun Sherpa, just because SMP Churna and Linolif treating ascites is the main thing over here. And Amari oil frequently for variation was being used by me. After treating the ascites with Dugdha Ahar, I did the Panchkarma therapy, which helped me to improve the ejection fraction of the patient. And this helps, which includes the centripetal oleation, which improves the cardiac output of the patient. Then the thermal vasodilatation has been done to reduce the water overload, fluid overload from the body. Hruday Dhara was done exceptionally for improving the strengthening the respiratory muscles and reducing the dyspnea on exertion complaint. And cardiotonic herbs were imparted via Basti per rectal drug administration in the patient. Patient is in follow-up in Naujivan treatment from 2017, 2019, and 2021. All the 3 patients are consecutively in follow-up every month for the Panchkarma treatment. These patients, I have also shared this slide before also, and again, I'll just for comparison sake, I am showing here again. Patient A's vitals.
Last 2 minutes.
Yeah, patient A vitals has been reduced from 80 kgs to 61.8. B patient from 72 kgs to 58, and C patient from 81 kgs to 68. The BMI has significantly reduced from 28 to 21, 30 to 24, 40 to 31. Abdominal girth was reduced from 108 to 93, 106 to 115, and all pulse, BP, and ejection fraction has been improved in all the 3 cases. And VO2 max is, all the 3 patients are still on walk test, and their walk test has been improved from less than 3 to 14 ml, 15 ml, and 16 ml respectively. Mainly, I have treated the complication like Updra complication has to be treated first, then the main treatment has been treated. So Dugdahar in ascites is important. It has been treated according to Charak Chikitsa Udar San, where milk is used and it helps to end diuresis, where the main treatment of diuresis, kidney involvement is there. But when we give Dugdahar, there is no renal impairment included in this. And the patient, like through purgation only, the fluid overload has been reduced, and symptoms are relieved within 3 days. Main conclusion, I improved the patient quality of life. Dyspnea from third grade dyspnea, I've come back. Patient is on grade 1 dyspnea. Or you can say NYHA classification, where minimum physical activity, maximum physical activity where is problematic. No hospitalization of any of them. Fluid restrictions has been followed till date with the patient. Weight and abdominal girth control is continuously monitored. Patient has been given education about the same, and planned exercise to avoid any exacerbations of the above disease. So takeaway is that efficacy of Dugdahar in CCF with pleural effusion and ascites has been significantly given results for keeping my patient alive for past 5 years, 3 years, and 1 year respectively. My reference is Charak Chikitsa Udar Rog and Heart Failure Reversal Therapy of Madhavbaug. Thank you.
Fantastic presentation, Dr. Hina. Superb presentation. And I feel this is one of the best presentations which we have seen so far. Your views on it, sir. Rahul, sir.
Hina, very nice presentation and very well presented. The only part I confused when you suggested the patient C is having a LVF of 55 and still you label your title as the CCF. So that was my question, how you can define that patient as a congestive cardiac failure.
Sir, I had investigations with the patient. I had done all the investigations. LFT was deranged, X-ray was showing pedal edema, and ECG was like atrial fibrillation. Heart rate was 150 per minute at that time when patient visited me.
Okay, great. Any reoccurrence after stopping of Dugdahar?
No, sir, no reoccurrence. Recurrence means if the patient is having some hectic schedule. Sometimes if patient does like आज control नहीं किया खाना या फिर तो then that time I just advise like in between sometimes I have given Dugdahar again and again for 5 years. In between, if actually the C patient had an incident that she lost her husband, so that time her diet and exercise was disturbed a lot. So that time she again put on weight. She went till 65 kgs. The symptoms were starting. So again, I did a Dugdahar for 1 or 2 days. Then again, it's normal back. Like no other intervention was required for this patient.
Yes, Praveen sir, your views.
Yes. बहुत ही अच्छा प्रेजेंटेशन दुग्धार का. आई थिंक ये सेकेंड केस है. जैसा अभी राहुल सर बता रहे हैं कि हमें ये एक्यूमुलेट करने चाहिए केसेस ताकि हम ये कंक्लूड सॉल्यूशन पे आ जाए कि दुग्धार किस प्रकार से हम इम्प्लीमेंट कर सकते हैं एज अ मेडिसिन, क्योंकि एज अ डाइट पार्ट हम तो रिस्ट्रिक्शन रख रहे हैं दुग्धार का हमारे पेशेंट्स में. जितने भी नॉन कम्युनिकेबल संतर्पणजन्य जितने भी व्याधि है उसमें हम दुग्धाहार को रिस्ट्रिक्ट करते हैं, लेकिन दुग्ध एज अ मेडिसिन अगर यूज किया तो डेफिनेटली आपने जैसे दिखाया रिजल्ट्स दिख रहे हैं. सो ऑल द बेस्ट, बेस्ट ऑफ लक.
सर पेशेंट जलोदर में संतर्पण के बाद अपतर्पण जन्य में चला जाता है.
राइट.
तो ये जो भी उदर चिकित्सा में दिया है वो पूरा अपतर्पण जन्य दिखाई देता है. ये पेशेंट में सारे लक्षण अपतर्पण के दिखाई देते हैं.
There is a very fantastic comment in the chat box. Dr. Hina, you are one of the best researchers in Dugdahar.
Thank you.
And how you got the Dugda? गाय का दूध मुंबई में आपको कैसे मिला?
Sir, Godugda Ahar, I had asked patient to take from proper tabela जहाँ दूध दिखती है, गाय दिखती है, वहाँ जाके वहाँ से लेकर आओ. That is only the thing what I have been done so far. I have not followed any that ये उसका बच्चा जिंदा है या नहीं है, वो सब चीजें हमने नहीं देखी है. Classical नहीं देखा इतना ज्यादा background, क्योंकि वो पता है पर वो book picture है, practically थोड़ा सा impossible हो जाता है सर वो.
Good.
Awesome presentation. Now we move on to our last presenter. Thank you, Dr. Hina. Now we move on to Dr. Vihar Bidwai from Pusad Clinic, Pune. And his topic of presentation is Preventive Cardiology in Ayurveda. Dr. Vihar, just a minute, I will spotlight you now, sir. Yes, Dr. Vihar.
Yes.
Good evening. You have 8 minutes of time with you.
Yes, sir.
Doctors, please stay till the end. This is one of the very nice presentations, so don't miss. Yes, Dr. Vihar, you need to, yes.
Myself, Dr. Vihar Bidwai. Today's my topic is Preventive Cardiology in Ayurveda. It is only a conceptual study. So there is no case presentation and all. It is for only just knowledge of like PG students and UG students. So hope it will be knowledge boosting to all of you. I am clinic head of mini clinic Pusad. More than 50% of the deaths and disability from the heart disease and strokes can be cut down by the combination of simple and cost-effective treatment, national efforts and individual attention to reduce major risk factor, the major leading cause of the death in the developing countries. It is estimated that 90% of cardiovascular diseases is preventable, and prevention of CVD involves improving risk factor through healthy eating, exercise, and avoidance of tobacco, smoke, and limiting alcohol intake. As per the Ayurveda, in the transport intestinal tract by the action of costagni, that is digestive fire, production of the ahar rasa, which is normal in quality and quantity, depends upon the normalcy of the costagni. The rasa dhatu is the first dhatu which gets formed after the ahar rasa, that is nutritional portion of the food after proper digestion of the food, and is circulated by the action of Vyan Vayu throughout the body, providing nutrition to 7 dhatus, that is rasa, rakta, mas, med, asti, majja, and shukra. The organs and the channels through which this rasa and samvahana circulations take place are collectively termed as rasava strotas and hriday, along with the mula dhamnis, which are considered as mool or main organ of this strotas. In the contrast of this, in contrast, if quality and quantity of ahar and costagni are not in appropriate condition, it leads to improper digestion of the food and subsequent formation of abnormal rasa dhatu, which has direct impact on hriday. A set of rasa dhatu which has direct impact on hriday, and a set of rasava strotas, in other words, the indiscretion followed by human beings in term of ahara, vihara, can directly cause impairment of agni and thus leads to the formation of vitiated ras dhatu. This vitiated ras dhatu is not capable for performing its normal function of providing proper nutrition to 7 dhatus in human body. In contrast, if the quality and quantity of ahar or costagni are not in appropriate condition, it leads to improper digestion of the food and subsequent formation of abnormal rasa dhatu, which has direct impact on hriday. The seat of rasavaha strotas, in other words, the indiscretion followed by human beings in term of, sorry, I think it is repeated.
Last 4 minutes, doctor.
Cardiac risk factor and preventive measure in Ayurveda. Non-modified risk factor, modifiable risk factor, and emerging risk factor and Ayurvedic guidelines for modifiable risk factor. Madhumeha, diabetes, and ucha raktachap, hypertension, sthaulya, and obesity. These are the major issues. Treatment for margavarana, anabhishandi chikitsa. The drug use should be sneha karaka and strota shuddhikara and should be avoid abhishanda. The drugs as well as food articles should not aggravate kapha or pitta, but should do pathanolomana and vachapana. Non-modified risk factor are advancing age, genetic predisposition. Modifiable risk factors are sedentary lifestyle, hypertension, type 2 diabetes mellitus, dyslipidemia, lipid disorder, overweight, obesity, metabolic syndrome, smoking. Emerging risk factor are Helicobacter pylori and chlamydia, pneumonia, calcium supplementation, vitamin D deficiency, and antiphospholipid syndrome. The major risk factor of heart problem are autoimmune disorders, age, obesity, stress, alcohol, tobacco, high lipid level, and lack of physical activity. The common predisposing factor of hridrogas are describing on authoritative text of Ayurveda are excessive use of hot, ushna, snigdha, and tikta foods. Also kashaya rasa, tikshna rasa, viruddha ahara, and lack of excessive physical exercise or lack of exercise, excessive stress, fear, anger, retention of natural urges that are vega dharan or dharan of adharaniya veg, excessive fasting, ati karshari, overeating, irregular food habits, improper application of basti and drastic purgatives, excessive consumption of alcohol, tobacco, cigarettes, etc., and injury to chest or vaksha pradesh. Common symptoms of hridaya roga are
anorexia. You have last minute. You should come to the conclusion point.
Yes. Conclusion is Madhavbaug treatment is playing important role in continuous improvement of the patient. Continuous research and development is required in the field of cardiology and Ayurveda. Madhavbaug research team is excellently working on it. Though medicine and though medicines are available for the treatment of heart disease, it is like an walking between two blades of scissor in absence of the evidence-based medicine. Ayurveda has definitive role in playing in preventive cardiology than curative. It is a duty of all to collect and compile proper cases and to produce the data. And if we do proper presentation in various magazines, and if we if we work more on evidence-based medicine, then it will be very good to establish an protocol of preventive medicine and to prove Ayurveda in a worldwide way. Thank you.
Oh, yes, Dr. VR, that was a very informative presentation. Rahul sir and Praveen sir, your comments on this, please.
Dr. Vihar, you took a great effort to compile all the information, and it's a really good beginning. Now you just joined the Madhavbaug family, and you started your practice as a preventive cardiologist. So it's always good to gather good information, because your eyes can't see what your mind doesn't know. So this is a good thing. Definitely, it will take your practice to the next level, and all the best to you.
Thank you, sir.
Yes, Praveen sir.
Yes, all the best, VR sir.
Thank you, sir. Thank you.
Yeah.
So doctors, we will call this a day now, because we have completed around 21 presentations today, and tomorrow too we are going to meet 21 to 22 new doctors with their subjects, with their case studies. And I will request all doctors to please share the link of this cardiology symposium to all your colleagues, all your fellow mates, so that they can also get this knowledge regarding scientific treatment shown by Madhavbaug. And all the doctors of Madhavbaug, you need to get in all your colleagues in the session so that nobody misses this knowledge tank. So thank you all, one and all, for being part since last 1 p.m. We are near about 5 hours. Yesterday too, we have invested our 5 hours in good scientific knowledge. And today too, we have invested. So in 2 days, we have invested 10 hours of our busy schedules into this knowledge sharing. So expecting all to be present even tomorrow and day after tomorrow with huge numbers, because very nice presentations are going to be done tomorrow and day after, and I don't want any one of you to miss these presentations. So we'll meet tomorrow 1 p.m. sharp and take हम लुफ्त उठाएंगे नए नए सब्जेक्ट्स का. बहुत समय से इंग्लिश बोल रहा हूँ, तब थोड़ा हिंदी में भी बोल लेता हूँ. बहुत बेहतरीन सब्जेक्ट्स कल और परसों आप सभी के सामने आने वाले हैं. सो बी प्रिपेयर्ड for some new concepts and new ideologies in reversing heart diseases, diabetes, blood pressure. So thank you one and all. Thank you, Rahul sir. Thank you, Praveen sir.
Thank you, Omkar sir. Thank you very much.
So bye-bye. Take care.
Bye-bye.
Thank you.